Consider it an epidemic, yet you rarely hear a thing about it. At first, it seemed to strike only one segment of the population. Now, Barry Peterson tells us this is no longer the case.
It was devastating, you know. At that time, I was 29 years old. To be told that I had cancer was just, it turned me around.
Bobby Campbell is fighting for his life, one of a rapidly growing group whose battle has fascinated and frightened modern medicine. He has Kaposi sarcoma, a deadly skin cancer that first appeared on the bottom of his feet as spots the size of a quarter. There is a 1 in 5 chance a victim will die within the first year of the illness. It's a disease first detected in the gay community that has now spread beyond that. A disease experts are now calling a national epidemic.
There are more lives claimed, victims claimed, than toxic shock and Legionnaire's disease combined. And yet most of the country doesn't know about this cancer.
Why?
Well, I think it's because it's a gay cancer.
It appeared a year ago in New York's gay community, then in the gay communities in San Francisco and Los Angeles. Now it's been detected in Haitian refugees. No one knows why. And in heavy drug users, especially in New York City. No one knows why. And in some people with hemophilia, a disease that prevents blood clotting so the patient needs frequent blood transfusions. Why? At the Center for Disease Control in Atlanta, where 400 cases have been reported, a special task force has now been set up. One possibility, a rare herpes virus may attack the body's immune system, bringing with it the cancer or a lethal form of pneumonia.
By finding the cause of this, we may be able to dissect out that part of the immune system that prevents cancer in general.
And there are more whys. Why just certain geographic areas? Why just certain groups? And most frightening, the possibility that the virus can be transmitted from person to person, virtually a contagious form of cancer. Specialists argue that millions of dollars should be spent for research now.
What we can learn from this group of individuals about cancer in general, how it's transmitted, what causes it, and hopefully how to stop it, is absolutely unbelievable.
But there is almost no money being spent so far. One New York group is raising a few $1,000s for research by selling T-shirts.
What did the spots look like?
In San Francisco, a Kaposi sarcoma hotline opens, supported by private donations. Bobby Campbell spends one morning a week at the hospital for chemotherapy for a disease that at the moment has not spread.
When I came down with this disease, I found this button and it absolutely reflected my position. You know, I may be down, but I'm not out.
For Bobby Campbell, it is a race against time. How long before he and others who have this disease finally have answers, finally have the hope of a cure? Barry Peterson, CBS News, San Francisco.
It's not yet been proven, but some doctors suspect that blood banks and plasma centers may be spreading a new and mysterious ailment called AIDS. That is, acquired immune deficiency syndrome. Over the last 2 years, about 1,000 Americans have been struck by the ailment, which destroys the body's ability to fight infection. 400 of the victims have died. How to combat it has produced a controversy in the medical community, but some blood banks are already changing procedures, and we have a report from David Dow.
In some of the nation's blood banks and plasma centers, there is a new sign of the times, an appeal that 3 diverse groups of potential donors not donate blood or blood products.
There's some additional questions that we need to ask because of our concern about AIDS, okay?
Questionnaires have been expanded to weed out male homosexuals, intravenous drug users, and Haitians, groups that have suffered most of the reported cases of AIDS. The new screening process stems from growing suspicions, anyway, that AIDS may be transmitted through blood.
What it amounts to is, I think, very strong circumstantial evidence.
The evidence comes from a small but vulnerable segment of the population, the 15 to 20,000 Americans suffering from hemophilia, the shortage of the clotting factor in their blood.
Typically, hemophiliacs require frequent injections of a product made from the straw-colored blood plasma drawn from thousands of paid donors. Since the AIDS epidemic began, doctors have found the disease in at least 12 hemophiliacs, and what may be symptoms in many others. The unaffected are beginning to worry.
It puts each of us in a quandary. Is the risk imposed by bleeding more than the risk imposed of the possibility of getting AIDS? And none of us know.
For college professor Charles Bell and many other hemophilia patients, the plasma concentrate they can store at home and inject themselves is not just a lifeline, it is their key to an active, somewhat normal life.
I really don't have an option. I have to continue using the plasma, or the concentrate as it's called. The thought of abandoning the kind of life that I have as a result of the concentrate is almost unthinkable.
Cutter Laboratories, the nation's leading supplier of the plasma product, has accelerated tests of a pasteurizing process it hopes will kill the unidentified AIDS agent, if it is indeed carried in blood. The paid donors who provide most of the company's blood products are being asked to voluntarily withdraw if they fit in one of the AIDS high-risk groups.
Do you think it's possible that some could just slip through?
Yes, I think that is a possibility, but I think if we word the question such that they realize that they could possibly be harming someone by donating, hopefully we'll get more honest responses.
Still, most of the nation's general blood supply comes from voluntary donors at community blood banks. And though some of them, too, have initiated AIDS-oriented questionnaires, a blood bank spokesman doesn't believe it's necessary.
We have no medical or scientific evidence that justifies such a course right now, and I think it's overreaction.
For now, no one is flatly declaring that the nation's blood supply is in danger. Too little is known about AIDS itself, what it is, and how it spreads. But until those questions are answered, other questions will persist among the Americans who depend on the blood of others for their own life and health. David Dell, CBS News, Oakland.
AIDS, or acquired immune deficiency syndrome, kills 4 out of 10 people who acquire it, and that mortality rate may climb. Since it was first recognized in June 1981, the incidence of AIDS has doubled every 6 months. Those, of course, are frightening figures, and Barry Peterson tonight reports that in some places, fear of the disease is itself becoming epidemic.
It was yet another reaction to the growing fear about AIDS. New regulations to be issued by the San Francisco Police Department. Regulations explaining special masks and gloves to be used when a police officer is dealing with someone who may have AIDS. Some called it overreaction.
Of course, we don't know all the answers. There's a lot of uncertainty and even a mild amount of hysteria. And I think that with the police reaction, I think that will only fuel the fires.
We think we're being very cautious and very responsible in what we're doing. We don't feel at all that we're claiming anything.
We have this paper we're asking everybody to read concerning AIDS.
Reaction 2 at a major city blood bank. If a donor's lifestyle fits that of AIDS victims, the donors are politely turned away because AIDS can be transmitted through blood. AIDS patients fall into 4 major groups: drug users, hemophiliacs, Haitians, and homosexuals. So reaction in the city's gay community, because sex is the other major way to transmit AIDS. Bathhouses and nightclubs that cater to casual sex are going out of business. Casual sex has become a fearful thing. A special AIDS hotline helps victims fired from jobs or evicted by roommates who believe incorrectly that one can get AIDS just by being near someone who has it.
That kind of behavior isolates us even further. It's scary enough to have a serious disease without feeling like you're a leper.
No healthcare workers have gotten the disease, but some fear exposure to something so dangerous and so unknown. But concern is growing as more cases appear. A New York sanitation worker now has AIDS. Officials theorize today he may have been cut by AIDS-contaminated drug paraphernalia in garbage he was picking up. More frightening, a study in the New England Journal of Medicine of 7 couples indicating men with AIDS pass it on to their female lovers.
Well, it shows the potential for this syndrome spreading to some degree through the general population.
Doctors say they do not yet know how far and how fast the disease could spread. Barry Peterson, CBS News, San Francisco.
A House Ethics Committee report out today concerning allegations.
Do you know anything about AIDS? Go ahead. Immune deficiency, acquired immune deficiency syndrome?
No, I don't. No, I don't. Sorry. I'm not much help.
Sorry.
All right. Come on, Heidi.
Yes, I do.
And you know how it's transmitted?
Yes.
What do you know about it?
It's acquired immunity deficiency syndrome. It's The high-risk groups are homosexual men, intravenous drug users, Haitians, and hemophiliacs.
I think you know it. All right, thank you. Thank you very much.
Thank you.
Where are you from?
Louisiana, actually, but from California.
We're doing a story about AIDS. And I was wondering if you know anything about it.
I've read about it.
What do you know about it?
It's a contagious disease, immune deficiency syndrome, something like that, and dangerous from what I hear. Dangerous.
Do you know how it's transmitted?
Sex. Yeah.
Anything else?
That's all I know.
Thank you very much. Sure. You story about AIDS. Do you know about AIDS?
Oh, no, I don't want to catch it. That's it.
What do you know about it?
Not too much.
Do you know how it's transmitted?
As far as homosexuals, they said it was come from the penitentiary homosexuals, and that's about it. That's all I know.
Do you know anything else about it? What it stands for?
No.
Have you ever known anybody who had it, or you worry about it?
I worry about it, yeah. I definitely worry about it. I don't deal with too many people now. I'm very precautious, but as far as knowing anybody, no.
But you're careful about it?
Oh, yeah, I'm very careful now. You got herpes, AIDS, gonorrhea. I'm very precautious. And there's a lot of homosexuals around here. I can see y'all doing an interview around here. And I'm very precautious about it.
Thank you very much.
All right.
We're doing a story about AIDS. Do you know what AIDS
Absolutely. is? Absolutely. Acquired immune deficiency syndrome.
So you have read about it?
Absolutely.
Are you concerned about it?
Absolutely.
Do you know how it's transmitted?
Either through sexual contact, certain people, ethnic groups have it, and also hemophiliacs who receive blood. My primary concern is anybody going into the hospital who has to take a transfusion. If he borders on the question of life and death, the question is this: does he take the additional blood, or does he leave it up to nature and God will wish to cure him?
So it is something you think about?
Absolutely. Under having gone some surgery some years ago when blood was required, I'd be a little reluctant today with which to accept blood.
You would try to donate your own blood, or?
Well, if possible, if God gave me the ability with which to give blood to people, knowing that I'm in a healthy condition, I would do it. But the only thing is that the blood banks today do not make any honest attempt with which to determine the donor, whether he's free from. We had hepatitis. I don't know if you recollect that when the time came when we used to donate blood, and there was a high incidence of hepatitis, which resulted in a lot of fatalities. I'm concerned. I'm a professor here at New York University. I have a number of students who may engage in some sexual practices which we may frown upon, which may, again, I'm not here to criticize what they do, but again, we say the homosexuals are being subject to this, I think, more than any single group.
Do you think that it could be transmitted some other way besides sex? I mean,
I'm not aware of anything else. I don't think science is even determined. I think I gave you this through transfusion, through sex, and certain hereditary background, like sickle cell anemia. It's conceivable there may be some hereditary trait attached.
But when you're dealing with homosexuals, you're not worried about that?
Well, when you say dealing with homosexuals...
Oh, no, in class, let's say.
Oh, absolutely not. There's no exposure. The only time you should be aware of this exposure.
Thank you, sir.
Okay, good luck.
Thank you.
Whatever you do.
Okay, yes, the question.
All right, well, we're doing a story about AIDS, and I was wondering if you knew anything about it.
Yes, I read a lot about it. There's been a great deal of publicity, and I know it's a very serious thing.
Do you know how it's transmitted?
It's through sexual intercourse, I believe. I'm not quite certain.
And it's something do you worry about it? Do you think about it?
No, because I don't think anybody I know will be exposed to it. It's rather a constricted thing, as I believe.
Do you know what it stands for?
There's no immunity in the body from anything. A slight cold could injure a person or do a great deal of harm to a person. Yes.
Thank you.
Okay.
Did I?
You knew it?
Oh, yeah. I don't live there.
We're doing a story about AIDS. Have you heard of AIDS?
Yes, I've heard of AIDS.
What do you know about it?
Well, it's sexually transmitted disease, largely homosexual, and it's generally feared. And in homosexual places it has depressed rents because people are afraid to move in.
Oh, you think so?
It has happened. Fire Island Pines, for example.
I'm sorry, could you say
Fire
that?
Island Pines.
You mean it in Fire Island?
Yes, on Fire Island, renting is down considerably because people are afraid of catching AIDS.
Is that something that concerns you?
It does concern me, yes, because I teach around here and my students may get infected, etc. So, okay.
Thank you very much. Good.
Yeah,
but you know, it's. Is it something that is happening in Australia at all? No. It is in Europe, yeah.
Yeah.
But not in Australia. No. Is it in the press there at all, or?
It is attracting attention naturally.
What sort of attention?
Well, the reflection of the discussion in the United States.
But then it's basically something that's coming from the United States?
Well, yes, the information and the discussion and the whole debate about it, yes.
Is there any concern, do you think, about contact with Americans?
No, I wouldn't think so, no.
All right, thank you. I'm doing a story for CBS about AIDS, and I'm just curious what you do know about it.
Well, I know it's mostly found among homosexuals in the New York area and in San Francisco, and that people don't know how it's caught. And that there's no cure for it, and that everyone's stumped by, exactly what causes it and what the cure is.
Do you know how it's transmitted?
I think it's transmitted sexually.
Is it something you are concerned about?
I'm not worried personally about catching it.
Thank you. You know about it?
Yeah, I've heard about it. But I don't know a great deal about it.
What have you heard?
I've heard it's a very serious disease and it's killing a lot of people.
And do you know anything about how it's transmitted, or?
Yeah, sure I do. I know it's transmitted through sexual contact or through needles, through hemophiliacs can get it, patients can get it.
Are you concerned about it?
No, not at all.
So you don't think that?
I don't fall into one of the high-risk categories, so I'm not concerned about it. But I'm worried for other people, for a lot of other people.
And you think that we should be spending money to look into it? I mean, the government should?
Yes, I do, because 1/3 of Europe was killed in the 1400s by a plague. And I don't think we can afford to let those kind of things happen.
Do you think this could be similar?
Not really. But I think we have to be very concerned about it. I think that science has learned too much since then for it to happen. I think there's something else going on other than what we're being told. I don't think it's just transmitted sexually or one way or another. I think it's transmitted by a number of contributing factors. So. Okay.
Thank you very much. What do you know about it?
It's mostly homosexuals get it, and it affects the blood cells that fight off disease or whatever.
Do you know how it's transmitted?
No, I guess not really. But I guess by touch, or you can get it anyway, can't you? Or just I don't know.
Just so you know, they say it's transmitted through sexual contact and blood.
But then they were saying that people had gotten it, other ways, just by touch of,
Are you concerned about it?
Yeah, I think it's it's not a good thing.
Do you worry personally?
I've given it thought, but I don't know that I would, have any worry about it. And again, I guess I don't know enough about it to really.
People, have you heard of it? What you know about it?
Yeah, I heard of it. I'm just ashamed that they haven't done anything about it. They're just hiding it. It's like they're using money. Everything is money. People die, funerals. So it's like all money. They should come out with a cure for it already. I mean, you see people die 2 years incubation period. People die 2 years later.
You don't think enough is being done?
I don't think nothing's being done. I think it's being behind the closet too much. And I feel sorry for a lot of, the homosexuals that are being, covered up about it, and all the health spas are doing a lot about it now, but not enough, The Congress or somebody up there should try to do something more about it. Because really, AIDS, they found a cure for herpes now. It's not a cure, but at least, it's something that you can live with it and not die.
So it's something that you think about? You worry about it at all?
Definitely. I mean, it's not a thing just of homosexuals. It's a thing of everybody's. There's a grandmother died a couple of days ago. So, everybody can get it. You never know, really.
Do you know how it's transmitted?
Well, there's so many sketchy, information about it that I really don't know how it's transmitted. But just by, the hemophiliacs, blood transfusion and all that. But I'm skeptic about the idea of handling food and catching it that way. I really don't think you can catch it that way. I think it has to be more or less about involvement of drug users and, I think it's people with weak blood that get the sickness, That's what I think.
Thank you. Very articulate. What do you know about AIDS?
Well, as far as what I know, it comes from homosexual. I don't understand how do kids get them though, as far through their parents, and also I can't really tell you too much about it. Only what I know about it.
What I want to know.
As far as through the blood cells, sexual contact. The other way, I don't know.
You concerned about it?
Yes, very.
For yourself?
For myself, for a lot of other people too.
Do you change the way? Have you changed the way you deal with people or you think about it in your daily life?
Oh, a lot. Because I used to know plenty of faggots. I have nothing against them because they people just like me. But if they have a disease that cannot be cured, I don't have no kind of part, for socializing with them.
Even if it's just having lunch or sitting in a room?
No chances at all.
Thank you. You heard about AIDS?
No. What do you say?
Acquired immune deficiency syndrome. It's a disease that gets in the bloodstream.
No, I don't know. I don't know any about that. Sorry.
It's okay. Thank you. A couple questions for CBS.
Okay.
Just look at me. What do you know about AIDS?
That it's an epidemic. It's a disease that's reaching epidemic proportions. And that it strikes mostly homosexuals, hemophilia, people who have blood transfusions.
Do you know what it stands for?
Something immune something system.
And you know how it's transmitted?
Through sexual contact with blood transfusions, what I hear. But I hear they don't know much about it. It might start hitting the general public, so I hear.
You think it will?
Might, yeah. It might.
You worry about it?
I did it first, but I don't anymore, It's life. If it happens, it happens, I can't spend my life worrying about it. It'd be nice if they had a cure for it, I think a lot of it's a result of, this might be an unpopular statement, but I think a lot of it's a result of the fact that America's a very decadent place. The 60s with the free love and the sexual revolution, it's backfiring. I've traveled abroad. I was surprised at how unpromiscuous Europeans were compared to Americans,
So you think it's a result of the sort of excesses of the sexual revolution?
Yeah, decadency. Basic decadency all around. On the part of homosexuality, heterosexuality, America in general.
Do you think that...
Huh?
Sorry, say that again?
Herpes, too, I think, is a result of decadency. I think it's... Both those diseases are the result of a very decadent society,
There's some ministers Baptist ministers are saying this is God's punishment. Do you go along with that?
No, I don't believe that. Huh?
It's a little too strong.
Yeah, I believe in history. I think if you look through history, whenever societies got real decadent or something, plagues happened, or governments toppled because people stopped caring, you know. People stopped voting, people stopped caring, you know. People lived, like I say, I think it was a result of the 60s and 70s. I think, you know, I don't mind the hippies and everything. I thought they were nice and everything, what they stood for, but things just got too decadent. And as a result, we're paying for it now.
You're paying for it?
Yeah, we're paying for it in human lives because there could be a plague, you know. There could be something like AIDS could start really killing people, could spread to regular population. And I think that's a direct result of the fact that our society's become pretty decadent. You know? A lot of the morals that were once, you know, held up aren't that held up anymore. You know? That's about it.
Thank you.
All right.
Thank you very much.
Very little, only what I read. Just know what I read in the newspapers and the magazines, and it is a little scary, I'll say that. You know, I think it's very scary, sort of a thing.
Are you scared for yourself?
Yes, I am afraid for myself. I understand that there's, like, from what I've read, there's about a 3-year period, 2 to 3 year period where it kind of lies dormant and you don't know if you have it or not. So it's possible that right now I'm sitting here with it. You know, that concerns me. I have to be a fool not to be concerned about it.
You know how it's transmitted?
I understand primarily sexually, through sexual contact, you know. But I don't know much about it. I don't think that the doctors know much about it.
You are concerned?
Yes, very concerned. No, I think the government should take a little more interest in it. I think that they've only started taking an interest when it got to society in general. I think that when the gay community was involved with it, you know, they had no or very little concern. Now all of a sudden it seems to be spreading to straight people and to you know, elderly people, and the government is starting to take a little bit of an interest. But I really think that initially, as long as it seemed to remain within the gay community, they didn't care. Thanks.
I'm concerned about it, but I don't know much about it. I wish, you know, they develop something more official and let the people know, you know, how to, I don't say prevent it though, but to know what it's all about, because people doesn't know much about AIDS. Well, I have read and I have seen television what they put about the AIDS, so I is concerned about myself. I'm not afraid because I know how to keep away from you know, things, and what I only can say is, you know, the people should know more about it, because there's a lot of youngsters who they don't know anything about sex, and it's the way you get it from, you know. But some people say this mosquitoes, some people say this, you know, food, some people, you know, you never know exactly what it's come from, you know. So it's what the people should know more about it. You know, this AIDS is the worst ever come. You know, more than herpes, more than, you know, any other, you know, venereal disease. And it's really bad because it's getting more and more into New York, you know, and unfortunately, you know, it's no age and it's no, you know, male or female that you can say you can get it from.
A special day for gay states, an annual day marked by parades in a number of cities. The march of an estimated 40,000 people down New York's Fifth Avenue was the 14th annual Lesbian and Gay Pride Parade. As the marchers passed St. Patrick's Cathedral, though, they found a nearby prayer vigil of Catholics who regard the homosexual event as blasphemous. The parade was meant to be festive, but underlying it was a serious concern: AIDS, the acquired immunity deficiency syndrome that claims homosexuals among its primary victims. AIDS was a major theme of the Gay Freedom Day parade in San Francisco. Jim McManus reports.
Organizers say this is a festival, a celebration of gay life, but there is a deep undercurrent of pain and fear.
My own family won't come to San Francisco for this parade because they're afraid by breathing the air that they're going to get AIDS.
Bill Jones does not have AIDS, but he knows men who do, and this year's parade is dedicated to AIDS victims, the living and the dead.
demanding adequate research for what could be a catastrophic illness so that we get to the bottom of it before it hurts more people.
Nationwide, more than 1,600 victims since 1979, 4 out of every 10 dead, cases doubling in number every 6 months. Public health officials say it is a deadly epidemic among gay men.
One of the situations which leads to spread is recurrent, multiple anonymous sexual activities.
Fear of public backlash started a fight in San Francisco's gay community, some leaders demanding a massive public education campaign for gays and for a fearful general public. A few wanted silence, and one gay journalist felt the pressure.
And that pressure, ironically enough, has come from gay leaders who are solely concerned with whether or not the AIDS epidemic will hurt gay political power.
Finally, San Francisco decided to go public with warnings and health guidance. Owners of gay bathhouses joined the campaign and now are watching their businesses decline, some headed for bankruptcy.
I feel like I'm an AIDS victim financially. I think that my life is turning around now because of the AIDS panic.
Sudden failure of the body's immune system is still a medical mystery, and gay leaders insist the problem belongs to everyone.
I wish that the federal government would begin to deal with this disease as an American disease, not a gay disease. That this could be the front runner of a real tragedy in American health.
I mean, we're human beings. Basically, we're made up of the same cells and things. If I can get AIDS, you can get AIDS.
James McManus, CBS News, San Francisco.
There could be a plague, there could be something like AIDS could start really killing people, could spread to regular population.
And if I get a disease from somebody I come in contact with, I don't know if I'm going to spread it to my family or not, and that bothers the heck out of me.
The fear is mounting, with or without proper justification. The disease is AIDS. Medical technicians wear protective clothing. People in the streets worry if they'll get it too. This morning, in this half hour, we're going to address the fear and the reality of AIDS, how it is and is not transmitted. Hello, it's Tuesday, June the 28th. Good to have you with us.
That'll take up most of this half hour, but Pat Collins will be here to wrap up the entertainment news and shows like Fame that continue to have a life after the big networks. And a reminder about Tiny Tim. He'll be coming up.
The time now, 18 minutes before the hour.
All across the country, people are wondering what causes AIDS. In Atlanta, the National Centers for Disease Control says the cause of AIDS is unknown, but it seems most likely to be caused by an agent transmitted by intimate sexual contact through contaminated needles, or less commonly by blood or blood products. No evidence suggests transmission of AIDS by airborne spread. Now, the CDC adds there is growing evidence that casual contact offers little or no risk. But these words have a long way to go before they catch up to some of the wilder rumors about AIDS. Betty Ann Bowser shows us what people are thinking about this deadly disease.
If I get a disease from somebody I come in contact with, I don't know if I'm going to spread it to my family or not, and that bothers the heck out of me.
I have seen the stories about the blood banks being contaminated with it, and yeah, that concerns me.
There could be a plague, there could be something like AIDS could start really killing people, could spread to regular population.
In the past 6 months, the number of people who have come down with AIDS has nearly doubled. The vast majority of those people will eventually die. So as the numbers increase, so does something else, and that is fear. Paramedics in San Antonio know the facts about AIDS. No known cause, no known cure. They've heard the theory that AIDS might be spread through contact with blood and secretions. So, like paramedics in Indianapolis and policemen in San Francisco, they carry surgical gloves and masks to protect them from the unknown.
Until we find out exactly how it is transmitted, it doesn't hurt to take all the precautions that we can.
Across the country, blood banks report donations are down, as rumors spread that you can get AIDS from donating blood. And because one theory holds that AIDS can be spread through saliva, life-saving classes are canceled in Coronado, California. There are no government guidelines, no rules for handling the bodies of AIDS victims. In New York City, that is enough for some morticians to say they won't embalm victims of the disease.
We really don't know what we're dealing with, and we feel a responsibility to our membership in educating them in terms of the seriousness of the disease.
You have a better chance of being struck by lightning than of getting AIDS. Still, fear spreads faster than the disease. The daughter of a woman suspected of dying from AIDS is frightened for members of her family.
God forbid, we all have it. We're scared. Yes. We really are. We're scared.
And now, James Robison Daily, a program...
In Dallas, fundamentalist ministers are preaching the word that AIDS is a plague that will spread from the gay community to the general population.
It is a plague, a disease that is carried largely in the homosexual community and is now being spread into the heterosexual community. It's being spread to children, to little babies.
On his radio talk show, Reverend Marlon Maddox warns listeners about AIDS.
Many in the homosexual community are involved in the food business. How do we know? But their handling of food cannot in some manner transfer AIDS to the people that eat in those particular restaurants.
Even the medical community cannot agree about AIDS. Dr. Donovan Campbell is an anesthesiologist and trustee of Dallas Doctors Against AIDS, an organization that wants homosexuality to be illegal in Texas.
If one is against the repository or the reservoir of the disease, then he's got to be against the reservoir of the disease, whether it's cows or monkeys or homosexuals.
To say we can outlaw gays or regulate homosexuality is ridiculous. And to use AIDS as a crutch is taking those of us that are unfortunate enough to have the disease and using us as whipping boys against our own kind. And that's despicable.
Len's fears about AIDS are different. He is a successful Texas businessman who speaks to us in silhouette because he doesn't want people to know he has AIDS.
Because I have a business to protect. I have got friends and family to protect. I've got my own peace of mind to protect.
Nowhere does AIDS anxiety run higher than in San Francisco, where 4 or 5 cases are diagnosed each week. It is something health officials try to combat, but it's not easy.
We're inundated with calls from either companies or individuals who want to know, what are my risks? Can I ride the bus? Do you know where it's safe? Will my dog catch AIDS from eating a bone that my next door neighbor gave him?
Some people have been evicted from their homes, either by their roommates or by their landlords, because of people's fear of contamination through the kind of casual social contact. People have been either fired from their jobs or forced from their jobs.
Randy Schultz has lived with AIDS phobia. He is a reporter for the San Francisco Chronicle. He is also gay.
I had a cold last week and coughed, and somebody jokingly said, "Oh, Schultz has got AIDS." It was a joke, and it wasn't meant to be malicious, but that means that it's always on their mind. But more than anything, I think it's just people are afraid of death. And when they see AIDS, they see death.
You want to get up in front of a group and say, here's what it feels like to have AIDS, and yet you know that you have a chance of alienating that entire group and affecting them just by your mere presence, because they're going to fear, through a lot of misconceptions that have been brought forth and a lot of misunderstandings, that they're going to be contaminated in some way, which of course is not the case.
That's how people are feeling about AIDS. In just a moment, a top U.S. medical official is going to tell us the known facts about what does and does not cause AIDS.
Time now, 12 minutes before the hour. 90% of the reported AIDS victims have been between the ages of 20 and 49.
Borrowed blood from a bag keeps 7-year-old Michael Tamerlani alive. But an irrational fear of AIDS in New York is now threatening his and the city's blood supply. Donations are down by 25% to a level that is dangerously low. The blood bank says because people associate the needle and giving blood wrongly with getting AIDS.
People are afraid. They're afraid to give a unit of blood. And what they're afraid of is maybe they could catch AIDS.
The Greater New York Blood Bank supplies 260 hospitals that care for 18 million people. All they need to keep going is 2,200 units a day, and only half that much has been coming in.
The shortage in New York has already reached the stage where some hospitals are juggling surgery schedules based on blood availability. And officials say if donations don't pick up dramatically, they're only a day or two away from citywide surgery rationing.
One of the hospitals worrying is Sloan Kettering Memorial, where 300 times a day they need blood for someone like Michael.
It will leave our patients in the lurch. These people's lives depend on the blood that we transfuse them. And if we haven't got the blood, I'd hate to think of what would happen. Simply cannot maintain a number of people alive.
I'm Margaret Heckler, Secretary of Health and Human Services. I've just given blood at my local blood bank.
A television ad is now ready to put the AIDS fear to rest nationwide. The Tamerlan is just hope people hear it before ignorance separates someone like Michael from his life's blood.
My son needs blood.
Jane Wallace, CBS News, New York.
More evidence tonight that the disease AIDS, acquired immune deficiency syndrome, has reached out to take the lives of infants. There are indications that 3 infants who died recently in the Los Angeles area may have been the first infants in the country to die from AIDS transmitted through blood transfusions. Jerry Bowen explains the evidence.
2 of the 3 suspected infant AIDS victims died at Los Angeles Children's Hospital, a facility which specializes in the diagnosis and treatment of immune disorders. Jeffrey Pardo was one of them. Like the others, he was born premature and required frequent blood transfusions. And researchers theorize some of that blood was infected with AIDS.
We had the possible route of their acquisition, and that would have been possibly, again, through the blood transfusions that they had received as sick newborns.
Jeffrey spent the first 4 months of his life at Huntington Memorial Hospital in Pasadena, where he underwent numerous blood tests that then required blood transfusions. But after his release, he never seemed able to avoid disease.
He had chronic ear infections. He had anemia that bone marrow tests could not provide a reason for. His development slowed to almost nothing. Never in his life did he ever get above 12 pounds.
Since Jeffrey's death, Huntington Hospital has instituted a blood donor screening program, similar in nature to that applied by Red Cross blood banks nationally, aimed at eliminating all high-risk donors. But Red Cross officials aren't convinced the infants died as a result of AIDS-contaminated blood.
There is a small, very small risk of getting AIDS from blood transfusion. Our best estimates now are that there's a risk of about 1 in a million.
But Jeffrey's father, a physician now practicing in Brooklyn, believes his son was that 1 in a million.
I can't feel any anger because whoever donated the blood did it willingly, did it with all the good intentions in his heart.
And health officials say there is no way to trace the suspected AIDS-infected donors. In all probability, said one doctor, the suspected carriers are unaware they have the disease themselves. Jerry Bowen, CBS News, Los Angeles.
Today on AIDS, the acquired immune deficiency syndrome, and what the government is doing to fight it. It heard one victim lament, quote, "I hope my epitaph won't read that I died of red tape." Eric Ingberg sums up today's testimony.
The opening witnesses before the House committee were 3 AIDS victims, young men who now live with the threat of death.
The effect of being told that I was immune deficient was devastating. I called my parents and said, I'm going to die.
It's a matter of day to day, waiting around, waiting for something to happen, living in constant fear that I'm going to wake up one morning and find lesions.
As homosexuals, the 3 are members of the highest risk group, which also includes intravenous drug users and hemophiliacs. 80% of those infected die. Medical researchers testified that the number of victims could increase from 2,000 now to 12,000 next year, as many as 3 million within 5 years. The government will spend $26 million seeking a cure this year, but researchers say it's not enough.
As a medical researcher, I can tell you that we have lost much valuable information. Individuals who we could have questioned epidemiologically about who they had contact with are now dead.
A forest of unknowns is how one doctor described the disease. Almost nothing has been learned, not even what laboratory animal to infect to search for answers. The researchers are calling for hundreds of millions in federal funds and an emergency government plan. All justified, they say, by the spread of the deadly disease and by their belief that the fear of AIDS, even among groups not likely to catch it, is rapidly becoming an epidemic in its own right. Eric Engberg, CBS News, Capitol Hill.
Fear of AIDS, acquired immune deficiency syndrome. The fear is reported widespread among the general population, worry about catching this mysterious deadly disease. What about that concern inside hospitals where AIDS patients are treated? Wyatt Andrews has been investigating the problem.
In this hospital, he is called a no-code patient, meaning that the next time his breathing stops, it will forever. Nurses will not rush to his rescue. He is dying from AIDS. Doctors, nurses, and therapists will attend his last moments carefully, but they admit they are afraid.
The first day, I was scared. I think we were all nervous, but we had each other to back up.
There was a fair amount of hysteria, I think, high anxiety among employees.
It happened so quickly. The phone call came from surgery, AIDS victim arriving in 30 minutes. And suddenly, in spite of the years of training, the years of hepatitis and smallpox, in spite of all of that, these medical professionals hesitated.
They were frightened to go in the room. To be very honest, people are rotated. Who's going to have them next, you know?
Hospitals now find themselves quickly teaching their own staff members the realities of AIDS, that it is not believed to be very contagious, that it does not travel through the air, that simple precautions against touching the victim's body fluids are enough. But the process of education is slow. Example. At the hospital where much of the taping for the story is being done, hospital administrators asked CBS News not to identify the hospital out of fear that that kind of publicity could literally clear the house. They don't want it known that AIDS victims are treated here. There are other kinds of hospitals, San Francisco General, where AIDS victims have their own ward, and Emory University Hospital, where most AIDS victims are free to roam the hospital.
We would see patients in the hospital with AIDS walking the halls if they feel up to it. Yes, there's no, they don't have to be in strict isolation.
Actually, if you wanted to avoid the risk of getting AIDS, probably the safest place for you to be would be in the hospital. And the reason for that is that you're not likely to have a sexual encounter with a homosexual male or use illicit IV drugs in a hospital.
But because of all the fear, last June, 2 California nurses resigned their jobs, protesting what they said was the hospital's failure to protect them against AIDS victims.
Dilant and 100 milligrams ibuprofen Q8 at 4 p.m.
These nurses now think their fears may be irrational, and they have come to realize that this patient deserves the same kind of treatment as any patient who is dying.
We still worry and we still have that fear of the unknown, but he's still a patient, and he's still hooked up to the same machines and still needs the same things done for him. And you can't question that.
His pressure was like hundreds earlier, and now it's 69 or 70, so it's steadily going down.
His pressure steadily dropped to 0. Yesterday at 4:30, he died. Wyatt Andrews, CBS News.
Good evening. This is the CBS Evening News. Dan Rather reporting. Federal health officials today reported there were 730 new cases of acquired immune deficiency syndrome in the first 3 months of 1984. That just about matches the highest quarterly total yet for the deadly disease called AIDS. But Lim Tucker reports that word came even as health officials in Washington announced a major advance in the battle against the so far incurable disease.
For more than a year, scientists had reported finding bits and pieces of the AIDS puzzle, but today's announcement was the most dramatic yet.
The probable cause of AIDS has been found, a variant of a known human cancer virus.
The breakthrough came at the National Institutes of Health, where a way was found to mass-produce the AIDS virus, study it, and most importantly, to test blood for it.
It should solve the problem both for blood transfusions and for hemophiliacs, in the sense that when this test becomes commercially available, then of course we'll be able to screen blood. What we have at the moment is not particularly of great benefit to people with the disease right now.
American scientists will go to Paris soon to see if a similar breakthrough announced there last week is the same virus. But while the French were cautious in touting their findings, the Americans are predicting they'll find a vaccine which could totally prevent AIDS in 2 to 3 years. Lem Tucker, CBS News, Washington.
Homosexuals' disease called acquired immune deficiency syndrome, or AIDS, was first diagnosed in 1979. It has created the kind of fear that causes some people to push it from their minds. But in the first 46 weeks of this year, there have been more than twice as many cases of AIDS reported as over the same period last year. And now there is new cause for concern, and Barry Peterson looks at the troubling facts behind those figures.
Take a deep breath for me.
The diagnosis, AIDS, always fatal. It almost always confined to 4 high-risk groups: homosexuals, intravenous drug users, Haitian refugees, and hemophiliacs, but a virus that may be on the move into the general population. In San Francisco, there is concern over 2 cases, men not in the high-risk groups who got AIDS, apparently from sexual relations with women who were drug users and had the disease. So health officials are sounding an alarm.
There's a potential for a wider spread, and I think that's why it's important to let people know the risk that they might be taking.
To this point, many people feel, I think, falsely reassured that they're not at risk to get this disease.
The concern here is strengthened by recent studies in Africa, where AIDS is a disease exclusively among heterosexuals, apparently passed on in some cases by prostitutes. Experts worried that the same thing could happen in this country. Prostitutes giving it to their customers passing it on to wives or lovers, a deadly venereal disease. But no one knows how widespread such incidents may become.
There's limited knowledge about how rapid transmission, heterosexual transmission, will occur.
Researchers trying to untangle the puzzle of AIDS stress that its spread to the heterosexual community is rare. A handful of cases nationwide amidst nearly 7,000 victims.
We know that the virus spreads by promiscuous behavior. Those individuals have multiple partners within, let's say, 1 year. We've got to say, therefore, either it takes a rare individual or rare practices that allow this to happen.
Officials don't expect the disease to spread as rapidly among heterosexuals as it has among gays and others in the high-risk groups, where there are 14 new cases daily, 6 deaths every day across the country. It will be twice that many this time next year. And there are indications the virus is mutating, changing, leading some researchers to the gloomy prediction that the chance of a one-shot cure-all vaccine anytime soon may be fading as fast as the disease is spreading. Barry Peterson, CBS News, San Francisco.
New research results out tonight on AIDS, what one of the authors of the study published in the latest New England Journal of Medicine calls a picture of an epidemic more complex and serious than anyone had anticipated in 1982. Among the findings, about 400,000 people in the United States now have been exposed to the virus associated with AIDS. It does not mean all of these people have AIDS or will get AIDS. But over the next 2 years, say the researchers, there could be 40,000 new AIDS victims, and AIDS could cost $500 million to treat this year alone. There is still no AIDS cure. There is an AIDS virus test about to be put on the market, but as is the case with so many aspects of AIDS, the enemy isn't just disease, it is fear. Lem Tucker reports.
22-year-old Bill Bauman is a hemophiliac, dependent on blood donations for the vital clotting factor which keeps a hemophiliac from bleeding to death. And because of his dependency on the blood of others, Bill now has AIDS.
You can't be worried about it because it won't do you any good. You know, I know they're trying their best to filter out all the bad stuff.
For the nation's hemophiliacs, AIDS has now replaced bleeding as the #1 killer. That is because the AIDS virus can be transferred through blood, and every year 6 million Americans, including hemophiliacs, depend on donated blood for survival. To help protect the blood supply, homosexuals, intravenous drug users, and some Haitian immigrants, all at high risk of getting AIDS, have been urged not to give blood. And shortly, the federal government will license the first blood test to detect if any potential donor has been unknowingly exposed to the AIDS virus.
We believe this is a very good test, that it will enhance the safety of blood transfusions, that it is not a perfect test. Very few tests are.
For anyone testing positive, the big question will be what it means and does not mean.
It does not mean the person has AIDS. It does not mean the person will get the disease of AIDS.
It means simply that the person has been exposed to the AIDS virus. That is, if the positive test result is correct, which experts agree will be a major problem.
Most of the people that turn positive on this test, in fact, will be false positives, won't be infected with the virus at all.
And at present, there is no quick, inexpensive way to check results of a test which could have devastating social and psychological ramifications. Portland, Oregon is typical of many cities where that worries people, both inside and outside the gay community.
Why take the test and lose or run the risk of losing health coverage, of job stigmatization, isolation?
We have left that individual high and dry with the fear, am I going to get AIDS or not? How to explain it to his family, his partner or her partner. I think that many blood donors will feel this as irresponsible.
As the problems emerged, many local and state health and blood bank officials asked the federal government to delay introduction of the test. But one official said that seems very unlikely because the politicians have promised to do something about AIDS. And so the test, problems or not, will almost certainly go ahead. Lem Tucker, CBS News, Washington.
The American test today that is aimed at reducing the risk of the disease called AIDS being transmitted through blood transfusions. Lem Tucker in Washington has our report.
Bill Bauman is one of a growing number of people who has gotten AIDS through blood transfusions or blood products required by hemophiliacs. 2% of all AIDS cases now fall into that category. To help keep the blood supply uncontaminated, people at high risk of having AIDS have been urged not to donate blood. Meanwhile, scientists search for a test which would detect the AIDS antibody in blood. Today, the announcement that they found it.
This test adds a major dimension of protection to our present safeguards. Its use will keep our blood supplies safe and indeed make them even safer. This test is, in fact, the answer to the prayers of thousands of Americans facing surgery or otherwise requiring blood.
The test is a simple screening device and should read positive if a person has been exposed to the AIDS virus. It is not a diagnostic test, so a result showing the presence of AIDS antibodies does not mean that a person has or will get the disease. Officials warn that some tests will come back with false positive readings. There will also be some incorrect negative results, which means some contaminated blood could still get into the blood supply. Officials say they're working to lower the rate of error. Meantime, they emphasize that this test is a lot better than nothing at all. Lem Tucker, CBS News,
Tucson. San Francisco today became the first city to start screening blood donors for signs of exposure to the virus associated with AIDS. The city is using a new test approved by the FDA less than a week ago. Correspondent Barry Peterson looks at day one of this program designed to take some of the panic out of giving and getting blood and the fear of having AIDS.
Daniel Friedman was among the first whose donated blood was tested for signs of AIDS.
My primary hope is that it'll give our San Francisco public a renewed sense of confidence in their blood supply, which has been, I guess, shattered.
Shattered by deaths of those like Mary Johnstone, who got AIDS from a blood transfusion. Her husband now faces hip surgery, had close friends give blood just for him.
Well, in my experience, to take blood from the pool, from the blood bank, is like playing Russian roulette.
Our public right now expects us to move with expediency, and we're going to do it.
So officials here had the new test kits rushed to San Francisco and immediately started training staff.
Okay, let's try it again.
The test, about 95% accurate, detects specific antibodies, a sign that a person has been exposed to AIDS. If the test result is orange, the blood will be discarded, but the donor won't be told. This to prevent the blood bank from attracting donors in high-risk groups who are now discouraged from giving, but who might come in just to get a free AIDS test. The next step, make the test available to anyone who wants it, who fears he or she has been exposed to this dread disease. Barry Peterson, CBS News, San Francisco.
CBS Evening News, Dan Rather reporting. AIDS is a frightening disease that is known to have struck at least nearly 12,000 Americans and probably more. A disease that has been fatal in half of those cases. A disease for which there is no known cure. Tonight, David Dow reports another case of AIDS has been confirmed, affecting the most well-known victim yet.
After 3 days of confusion at the American hospital in Paris, a spokesperson for Rock Hudson finally confirmed that the actor has the deadly disease AIDS.
Mr. Rock Hudson has acquired immune deficiency syndrome, which was diagnosed over a year ago in the United States.
He had come to Paris to see an AIDS specialist, but became ill and hospitalized before he could do so. Doctors now say they've also found a still undiagnosed liver abnormality that may or may not be related to AIDS. Hudson's assistants insist he is cheerful and improving rapidly, though no prognosis has been issued publicly. The disclosure comes as AIDS victims and their allies in this country are becoming increasingly impatient with what they see as a lack of commitment to conquering the disease.
I think everybody is saddened that Rock Hudson has AIDS, and I think people should be saddened that almost 12,000 other Americans also have AIDS.
Today, some predicted that the admission that a famous movie star has AIDS would boost public support for other victims.
That says to people, anyone can get AIDS, first of all. And secondly, to a lot of people who have AIDS, I think it is part of the feeling of I'm not alone.
Even before the Hudson disclosure, more and more big-name entertainers were publicly supportive of fundraising efforts to combat AIDS. With today's announcement, organizers expect the list to grow.
I certainly think that it will bring us more people to help support us, and that would ideally translate into more money.
The fondest hope of many in the AIDS field is that the Hudson case will help them achieve a long-time goal, the same level of research funding as the other major diseases of American history. David Dow, CBS News.
Key point to remember, the so-called AIDS tests do not say one way or the other whether a person actually has AIDS, will get it later, or pass it on to someone else. They only say whether the material being tested has ever been exposed to the AIDS virus. On that score today, federal officials said that the AIDS test has been highly reliable and highly effective in screening donated blood and ensuring the safety of this nation's supply. That is small comfort this evening for some sufferers of AIDS, including more than 80 hemophiliacs who got AIDS from infusions of contaminated blood. I should say they got it from the transfusions of contaminated blood. Frank Currier looks at the plight of one young AIDS sufferer who not only has to live with his own fears, but now everyone else's.
With doctors saying he hasn't long to live, 13-year-old Ryan White will not be allowed to attend public school in his hometown, Kokomo, Indiana. Ryan White has AIDS.
I don't want nobody else to get it, and I can see where they're worried. But, I mean, if my doctor says it's okay to go back, I mean, I don't see no reason why I can't.
The 7th grader contracted the incurable disease last year while receiving blood transfusions for treatment of hemophilia, a condition where normal blood clotting factors are absent.
Ryan had no control over getting AIDS, and we've just had to fight for, it seems like, everything, and now we'll just have to keep on fighting.
Though the Indiana State Health Commissioner recommends that children with AIDS who are well enough should be allowed to attend school, county school officials here feel that Ryan could pose a serious health threat to his classmates.
What we know about it combined with what we don't know just makes it too big a problem and too many question marks.
But in Washington, a federal health official disagrees.
To date, there's no evidence of spread by casual contact from children or adults to others.
In children, AIDS is an emerging problem, specialists say, with only 148 cases documented by the government. For Ryan White, it means volunteer teachers must bring the schoolroom to his home this year. And to that, says Ryan, I will miss my friends. Frank Currier, CBS News, Kokomo, Indiana.
Much of historic Arlington Park
racetrack. Sheer numbers are what's changing the lifestyles of more than 12,000 Americans with AIDS. More than 700 are women, and nearly 150 are children under the age of 13, most of them born with the disease. Most adults with AIDS still fall into the high-risk groups: homosexuals, intravenous drug users, and hemophiliacs. But the growing number of heterosexuals with AIDS is becoming bitter food for thought for many singles who've enjoyed sexual freedom.
It's gotten so much publicity. Everybody's scared to death about it.
The topic of discussion is AIDS. What was once thought to be a disease affecting gay men and intravenous drug users is spreading to the general population. At least 118 cases of AIDS transmission between heterosexual partners have been discovered. The statistics are causing many single heterosexuals to think twice about their lifestyles.
I'm really starting to think maybe in my future relationships that I shouldn't be as promiscuous as I have been because, I mean, I don't want to, such a fatal disease.
As you mature, you realize that being more selective in your choices as to whom you're going to be with is what's more important.
Casual sexual encounters are dangerous as long as we don't have remedies and medicines to treat infection caused by viruses. Casual sex, multiple sexual partners, all this should be reduced and limited seriously.
The advent of AIDS may turn back the clock on the sexual revolution.
I definitely would not have a very short-term, let's go to bed type relationship, basically because of, hey, I don't think the risk is worth it.
You know, people say to me, but you are awful. You tell me I can't have sex. And I have to answer, look, I'm not telling you not to have sex, but you better know the facts. You make your own decision.
How I may help you?
The New York City Health Department is running an AIDS hotline that is designed to give out the facts. And the callers, as you might expect, are no longer only gay men.
Our phones, for the most part, are ringing off the hook. And absolute cross-section of your population is calling in. So it's dramatic to go from 45 calls a day to 200 it speaks for itself.
The panic over the AIDS epidemic, some say, is due in part to the recent barrage of publicity on the subject and the fact that AIDS is a disease that does not discriminate. But some experts believe that the panic is solely a product of ignorance.
AIDS is not dangerous unless there is sexual intercourse between people or the transmission of blood between people.
Swinging singles and those with fast-track lifestyles are now being cautioned to slow down at least one aspect of their lives.
Your role in the appeals court decision yesterday that reinstated a Texas law against sodomy. Martha Teichner reports now on a case that attracted the attention of homosexuals around the country.
The ruling by the 5th U.S. Circuit Court of Appeals reinstates a 1974 Texas law making homosexual activity illegal.
Well, I think the sober reality is that as of late yesterday afternoon, almost 1 million lesbians and gay men are now criminals in the state of Texas.
In 1979, Dallas schoolteacher Don Baker went to court on behalf of all the state's gays and succeeded in having the state sodomy statute overturned. But 6 years later, attitudes toward gays in Texas have changed, and so has the makeup of the Court of Appeals. 6 of the 9 judges who voted to revive the law are new Reagan appointees.
Newsweek calls AIDS the public health threat of the century.
In Houston earlier this year, AIDS was the key issue used to overwhelmingly defeat a gay rights referendum. In the current case, the group Doctors Against AIDS argued before the appeals court that controlling homosexuality would help control the disease. But gays said that driving them back into the closet would make finding a cure for AIDS more difficult.
Medical issues have never, ever been decided in court. They are determined and looked at and examined in the laboratory. That's where AIDS should be looked at.
Gays contend fear of AIDS may be leading to a national backlash and a return to traditional morality.
If you sow, you shall also reap. And I believe this is the reaping of what we've sown.
AIDS, the disease exists because of sin. The Court of Appeals decision reaffirms the right of the state of Texas to legislate morality, exactly the issue that gays intend to use when they appeal the ruling to the U.S. Supreme Court. Martha Teichner, CBS News, Dallas.
The state of
age 59. David Dow and Terry Drinkwater look at a life devoted to Hollywood dreams on screen and a man whose death brought home the reality of AIDS.
Rock Hudson died quietly at home in an apparent coma, in sharp contrast to the raucous media scene as his body was driven away. In his last days, he had been more than a famous actor. He had given a deadly disease, AIDS, a visibility and urgency it had never had before.
We believe that what he did
made an enormous difference in public awareness across the country.
In July, Hudson went to Paris to seek treatment and wound up, through an agent, becoming the first public figure to acknowledge having AIDS.
He felt that this was his responsibility and that if he could help anybody, he wanted to. I think he was pleased that he did that.
Hudson's disclosure helped ensure the success of an AIDS benefit dinner, which raised $1 million and was attended by many of his old Hollywood friends, including Burt Lancaster, who read a letter from a by then bedridden Hudson.
I'm not happy that I have AIDS, but if that is helping others, I can at least know that my own misfortune has had some positive worth.
And it didn't stop there. Just last week, a former co-star announced formation of an AIDS foundation. The first contribution, $250,000 from Hudson.
I want to thank Rock Hudson for his generosity and leadership in the fight for life.
Beyond such tributes, old colleagues today offered others. To Hudson, the person.
He's a very dear and loyal friend. That's the first thing everyone will say about Rock who's ever worked with him.
Hudson's last performance was an act of friendship, an appearance in a program about animals for an old friend, Doris Day. David Dow, CBS News, Hollywood.
The principal difficulties seem to be that the anesthetics you get in these bars are never as effective as the customer hopes.
It took 26 films and 5 years for him to prove that he was more than just a 6'4" hunk with a made-up name. And his role in The Epic Giant confirmed what the critics were beginning to say. Rock Hudson was a very good actor.
I run reality at all times.
Of course, Jordan.
And that's the way it is. Everything that's in it and on it is run by me.
The role brought him an Oscar nomination and confidence in himself as a leading man.
You learn to relax enough to be able to think, to let it come inside and let it out.
Relax.
And that takes years. At least it took years for me.
Then there were the romantic comedies, the best remembered, Pillow Talk with Doris Day.
Can't you get the other leg in?
Hope so, ma'am. Sure hate to leave without it.
In the 1960s, he was the decade's third biggest box office attraction, behind only Cary Grant and Elizabeth Taylor. And on TV, the star of the hit series Macmillan and Wife.
My mother-in-law, I'd have her arrested for what she does in the kitchen. She could get
Few prove so versatile on the screen and on stage.
But just when they think I'm through, I rise again, full size again, and give those doubting Thomases a walloping surprise again.
Hollywood loved Rock Hudson as a favorite leading man, a role that Hudson played with no regrets.
I liked my life. I love my life.
Terry Drinkwater, CBS News, Hollywood.
When a celebrity or a public figure becomes ill, it of course changes the way the public views that disease. It happened with Betty Ford's breast cancer. It happened with President Reagan's colon cancer. And Rock Hudson's fatal illness has already changed attitudes about AIDS. Dr. Robert Arnott is here to talk about how this could help speed finding a cure for AIDS as well.
Morning, Forrest.
Good morning, Bob.
Often scientists who search for the cure to a disease also look for a search to funds to support their work. And that can be a very difficult and lonely task. Public support comes only after the disease comes very close to home. When it was revealed that Rock Hudson had AIDS, that disease did strike home. Rock was someone we had all known for years.
I'd feel a lot better if you'd let me see you home.
I think clearly that the news that Rock Hudson, your famous son, had the disease captured the imagination of the media, dramatically increased the public's concern, who sent a clear message to their legislatures, congressmen from all over the country, city and local officials, saying, what are you going to do about AIDS? Now we want to know.
2 months ago, Rock Hudson went to Paris seeking a cure for AIDS. Suddenly, the nameless, faceless victim of this horrible disease had a name and a face that everyone knew. The media had a headline, a sexy leading man with a dreadful disease and no cure. At an AIDS benefit, Burt Lancaster read a letter from Hudson.
I'm not happy that I have AIDS, but if that is helping others, I can at least know that my own misfortune has had some positive worth.
Rock Hudson's illness let a nation know that there was something to be afraid of. The disease was not under control. We learned children got the disease. Heterosexual women got the disease. 13,000 Americans had the disease, and 1 million had the dreaded virus. So congressmen went home to their districts on recess and found the #1 concern of voters was AIDS.
We were able to get only $70 million. But I would not have been able to do the same thing before Rock Hudson.
Money for AIDS research in the U.S. before Rock Hudson went primarily to understanding the disease and education. The virus causing the disease was discovered, but few dollars were channeled into developing treatment. Rock Hudson's run to Paris for a treatment unavailable in the U.S. changed that forever. Now scientists who think drugs can treat and possibly cure the disease are getting the support they lacked earlier.
I guess Mr. Hudson's legacy to us will be that more Americans now know that we have a problem that we've got to put serious resources into in order to conquer.
Would Rock Hudson still have to go to Paris for the treatment he received in July? The answer is yes. Clinical trials for new drugs are extremely limited in the U.S., and until they are proven effective, that's the way it will remain. Now, of course, there is one new drug, BAWA509U, which looks extremely promising, and we'll have a special report on that next week, plus other antiviral drugs in the use of AIDS.
All right, Bob, keep us posted on developments. It is now. The stars of Hollywood were shining brightly in Arizona last night. They were there to help raise money to fight a disease that is causing fear all over the world. Nadine Berger has our story.
The latest AIDS research benefit took place last night in a tent on a horse farm in Scottsdale, Arizona. But that didn't stop nearly 1,000 guests from paying top dollar to dine with MC Bob Hope and chairwoman Elizabeth Taylor, and to hear why the money they donate is critical.
Because there's an element of fear and panic that's involved with the disease, and I'm afraid there's a lot of bigotry that's connected with the disease.
Where do I have a 2,000 bid? Do I have a 2,000 bid over here?
Some stars use their celebrity status to auction off celebrity goods. Others sang for their supper.
One more time.
I'm doing this benefit for everybody, for mostly the children who are getting AIDS, and it's just ridiculous that they are getting this disease through no fault of their own.
The last AIDS benefit Elizabeth Taylor chaired in Los Angeles brought in over $1 million. Tonight she's hoping for even more, and a chance to bring similar benefits nationwide. So it is not surprising that Taylor received the Woman of the Year award for her efforts.
And I want to thank all of you who've honored me tonight with the award. I thank you with all my heart.
Nor is it surprising that the child star of National Velvet convinced some American horse breeders to donate 11 Arabian mares, net worth $2 million, to be auctioned off for AIDS research. All day, these horses primped like movie stars. There were makeup applications and hoof polish. This 4-day-old filly waited patiently for her mother's pedicure. So far, there are 85 documented AIDS victims in Arizona, though it is suspected that many more refuse to make their diagnosis public. But Hollywood is as public as it gets, and celebrities hope their contribution toward the end to AIDS will be as powerful as the end of at least one Broadway play. Nadine Berger, CBS News, Scottsdale, Arizona.
A serious scientific squabble accompanies the war against AIDS.
The international conference opens with the main French and American researchers fighting AIDS in the labs and each other in the courts. The issue, who really discovered the AIDS virus? And did the Americans steal the credit from the French?
We are the first to isolate this virus in 1983.
They had a case report. They had not mass-produced the virus. They had not linked it to disease. They had not characterized it.
No one disputes that researchers at the Pasteur Institute discovered a virus 3 years ago. But did they know what they had? Whatever they had, they let scientists at the National Institutes of Health have a sample for study. And shortly after that, the Americans held a press conference.
The probable cause of AIDS has been found.
That announcement infuriated the French, who say they had already found the cause of AIDS.
There was no press, there was no people. We did not announce that we find the virus, we are working.
The French are so mad that they are now suing the U.S. government for patent rights to the AIDS blood test. Their Madison Avenue public relations firm and their New York lawyer say the Americans couldn't have developed the test without the virus the French lent them.
They simply studied it, concluded we were correct, renamed it, and claimed it as their own.
As it stands, revenue from the sale of the AIDS blood test, about $2 million a year, heads right to the U.S. Treasury. But by 1988, that's expected to be $10 million, and the French would like to see some of it head right to them. Besides, they feel France's honor is at stake, maybe even the Nobel Prize, and certainly the reputation of the institute founded by the great Louis Pasteur. Still, critics wonder, whatever happened to that other fight, the one against AIDS?
Thing is so unbearable, so awful, and the scientific problem is too important to see these people losing time.
Many scientists would like to see this whole matter resolved with money from the AIDS test going to some sort of international fund. But national pride and scientific egos are involved here, and no one expects a settlement anytime soon. Susan Spencer, CBS News.
In Paris, the International Conference on AIDS continues today. Dr. Mervyn Silverman is president of the American Foundation for AIDS Research. He is attending the Paris conference. He joins us from there this morning. Good morning, sir.
Good morning.
Are there any headlines that we can say are coming out of the conference? Any breakthroughs that you're seeing in the treatment of AIDS?
No major breakthroughs, possibly a small incremental step in the production of a vaccine. They've developed a protein which, when mixed with put in the body of an animal, then put in a test tube, seems to prevent the AIDS virus from infecting the cells. This is an exciting first step, but we still have a way to go. It seems like here in France they have only 800 cases. There's over 22,000 worldwide, and 92 countries have at least one or more cases.
The National Institutes of Health are working with bone marrow transplants and report that the news there is at least encouraging. Do you concur with that?
I think, again, it is encouraging, but we have a long way to go. I think the new combination of certain drugs with bone marrow replacement may be helpful, but unfortunately, and I hate to sound pessimistic, each thing is going to be like a step, as a baby stepping before they can even walk and run.
As we're looking at the spread of the disease, Dr. Silverman, is this approaching, I hate to use the word plague proportions, is it moving into an epidemic stage at this point?
Well, to tell you the truth, it's been epidemic for years, and it certainly is, with over 20,000 cases in the United States, with a projection of over several 100,000 cases by 1990. There's no question that we face a terrible problem. It's one that is easily prevented, and people can easily protect themselves. So it's not something like the plague or like the flu hundreds of years ago or smallpox. So in that sense, it's not as serious. But if people ignore the warnings, get involved in the two high-risk behaviors, then the spread is going to continue, and unfortunately, many, many lives will be lost.
The two high-risk behaviors are?
The intimate sharing of body fluids during sexual relations and sharing of needles and IV drug abuse. If you're not involved in those two things, you really have very little to worry about.
And we are seeing that this involves heterosexuals as well, aren't we?
Absolutely. A study out of Sweden showed definite bidirectional. In other words, it went from a man to a woman, from a woman to a man, and then the man to another woman, and a woman to another man. So anyone who believes that this virus is not indiscriminate is wrong. It doesn't matter whether it's male or female, gay or straight, black or white. If it's put in the wrong or the right situation for the virus, it can do its harm. Heterosexuals are at risk.
Is it fair to say, Dr. Silverman, as you see it this morning, the problem is going to get a good deal worse before we begin to see it getting better?
I think it's going to get worse, but I think we can be encouraged by the technology that is available and the intellect that we have working on this, and I sincerely believe we're going to make some giant strides, but it's not going to be overnight.
Dr. Mervyn Silverman is president of the American Foundation for AIDS Research. Thank you for joining us from Paris, sir.
You're welcome.
Maria has more on this. Maria?
Thanks a lot, Forrest. Well,
doctors today are confronting a new dilemma posed by the deadly disease AIDS, and it centers on organ transplants, a marvel of modern medicine. CBS News correspondent Peter Van Zandt reports.
Well, as far as I know, it's a first, and I certainly hope it's the last.
Doctors in Greensboro, North Carolina were stunned to learn that 2 transplant patients had received organs that were later discovered to be contaminated with the virus that causes AIDS.
As much as we know and as bright as we think we are, our system has let us down in this instance.
The organs had been removed from this man, Joseph Evans, who had been declared brain dead after an automobile accident. Prior to the transplant operations, Evans' blood was tested for the presence of AIDS antibodies at this Greensboro hospital. The test was negative. Doctors say that prior to his death, Evans had received 20 pints of blood through numerous transfusions, which made the presence of the AIDS antibody difficult to find.
Diluted it to a level where we could not detect it.
Most health experts are calling the Greensboro incident a fluke and hope it doesn't frighten people away from important transplant operations.
Whether or not that has people decide that they're not going to have transplants, I think would be a mistake. Because if you look at all of the saving of lives that occurs from transplants.
Most transplant operations occur within several hours after an organ becomes available, usually after an automobile accident. But the AIDS test takes at least 4 hours to complete, and doctors say a new, quicker AIDS test must be developed to eliminate the fear of the disease from transplant operations. Peter Van Sant, CBS News, Greensboro, North Carolina.
Whatever promise the AIDS drug holds, the disease itself presents a clear and present danger to humanity. Nowhere is the toll more widespread than in some African nations. In Uganda, there are sights of despair reminiscent of the vivid pictures from the famine in Ethiopia. CBS News medical correspondent Susan Spencer in Washington narrates these exclusive pictures from Uganda.
To keep him here. The baby in this Ugandan hospital is dying of AIDS and crying out for help. So, too, is much of Africa.
Many people are going to die. And within 2 years, I think, the area will be a desert, as far as I can see.
These are the first pictures to show the devastation of AIDS in Central Africa, where it is rampaging through the general population, striking men and women alike, where millions of people are believed infected, but where governments in the past downplayed it. Here, AIDS is called slim disease.
This area is largely affected by that traces of slim. There are in hundreds of them.
The people at this remote trading post on Lake Victoria say their first AIDS case was in 1983. The village had 500 inhabitants then. More than 100 have died of AIDS since. In a nearby hamlet, Florence Nasaka, a former barmaid, and her infant daughter both suffer with the disease. A few hundred yards from the Nasaka house, 23-year-old Beatrice Mamudu has been sick for over a year. An abandoned shack stands nearby, the family of 7 wiped out by AIDS. And almost next door, relatives mourn a girl who has just died.
Up to 15-20% of the individuals appear to be infected in Uganda. That also means that 15% of the blood supply is infected.
Blood is contaminated through the reuse of unsterilized needles. Village nurses sometimes have only one. That's part of the reason the AIDS virus got a foothold in the general population early on. Unlike the U.S., AIDS is not primarily a homosexual disease in Africa, and it's spreading among heterosexuals like any other venereal disease.
The same thing could happen here in the United States if we're not careful. And I think now is the time that we can practice control on prevention of it becoming more of a heterosexual disease.
They're trying prevention in Uganda. At the trading post, the area political leader spreads the word, no promiscuous sex. Studies find up to 88% of prostitutes are infected. On Sundays, the local priest explains prevention from the pulpit, too. His people, he says, are frightened.
They are greatly afraid, and if no remedy is found, they are afraid that they are likely to be an extinction of the people here.
After several years of denying AIDS existed at all, the governments in Central Africa now are quietly asking for help. They no longer have a choice. They cannot afford to help themselves. Uganda spends under $2 a year per person for health care, and they have no idea how many people have AIDS, how many have died.
The best thing is to talk about it so likely so that the whole community gets to know. In that we might get some help.
Until help comes, the doctors struggle. But in many parts of Africa, this battle already seems lost. Susan Spencer, CBS News, Washington.
You go home with somebody you meet in a bar, I mean, you're gambling with your life.
People often say, is there an AIDS vaccine? And we always say, yes, there is. It's called a rubber, a prophylactic.
You don't know what that fellow has been through. You don't know where he's been, who he's been with. You're playing Russian roulette.
I have AIDS. And I don't know how long I have to live.
No, quite honestly, I don't think I'll make it that much longer. If I make it through the winter, I would be surprised.
In a war, you lose your youngest. We're at war now with this AIDS virus, and we're losing our young people.
If people would take the time to learn about AIDS, that their fears would go away. I was never afraid of Ryan after they told us that he had AIDS. I still picked him up and held him and kissed him.
We're having real trouble here. A lot of us are dying.
AIDS is going to be to Minnesota what it is now currently in New York and San Francisco.
We've had 16 women die with this disease in this city. We've had children die with disease in this city. We know the individuals, and they look a lot like you. They look a lot like me.
This is a CBS News special. AIDS hits home. With Dan Rather.
In 5 short years, according to the Public Health Service, AIDS could become one of the top 10 causes of death in the United States. In 5 short years, the AIDS death toll could strike 200,000 people. Right now, perhaps 1.5 million Americans are carrying the AIDS virus. AIDS is striking home in America, striking home in ways scarcely imaginable a few years ago. Tonight, CBS News reports from the front lines of the battle against AIDS, from the hospital wards treating men, women, and children. We'll examine how AIDS has affected the sexual revolution. We'll report on how AIDS is an increasing danger to heterosexuals, and how AIDS has turned neighbor against neighbor. The images we have found are brutal and heartbreaking. But if America is to come to terms with this killer, they must be shown.
I'm sick and I hurt. I don't want to hear about prostitution and drug use and gay. I didn't want to hear about it when I was healthy. I don't want to hear about it now. I don't need to hear about it. That's irrelevant. The fact is that I'm sick and I need help.
Meredith is not an intravenous drug user. She's not gay, she's not a prostitute or a hemophiliac. She got AIDS from her boyfriend. He used drugs.
Well, when I walked in the room, he started screaming at me, I have AIDS, or they think I have AIDS. You know, after denying the fact that I could get AIDS, all of a sudden it smacked me in the face.
Slowly, that truth is beginning to dawn on straight America. AIDS is not a gay disease. AIDS is a venereal disease, and it can pass from men to women and women to men. It just happened in this country to hit the gay community first.
In very sexually active groups, once the virus enters that group, you have the ingredients for a true explosion in that population.
The explosion already has hit Africa, where AIDS has always been a heterosexual disease, and where it's killing men, women, and children in staggering numbers. The experts say you can't draw conclusions about what's ahead for this country by looking at Africa. The situations are too different. But today, AIDS has a foothold in the straight population here, too.
Among heterosexuals today, I think the prevalence of infection is extremely low, less than 1%. It's not going to stay there. It's going to increase.
It is actually occurring at a frightening rate.
Dr. Margaret Fischel works in a Miami AIDS unit.
Now probably 18-20% of the cases we are now seeing at this time in our medical center can be related to heterosexual transmission.
A large population of drug users and Haitians may skew the Miami numbers, but because of the long incubation period, it's impossible to know just how widespread this virus really is, how likely one is to encounter it. One controversial study found high rates among Army recruits. Critics say the study included too many drug users. Its author insists it is a warning.
We did a cross-sectional survey of the American population of young people, and we found a lot of virus. We found a very serious silent epidemic.
I think there's a subgroup of the population, if you're sexually active, have multiple contacts, I think, I would be concerned.
For people like Sheila, who got AIDS from her bisexual husband, the concern is twofold, both for herself and for partners she may have infected inadvertently.
I had been with other men since I've been with my husband, and of course I had no idea I had been infected at the time. And of course, since I found out, I haven't been with anyone.
Did you tell them?
In one instance, I told someone.
And in the other instances?
I decided it would probably be kinder not to, since in both instances it was a one-time thing.
There's dispute over how much risk there is in a one-time thing, but the potential danger exists, especially with prostitutes.
16% of the streetwalkers around the 11th Avenue area and in some other areas of Manhattan show the exposure to the virus.
It's unclear how many men will get AIDS from prostitutes, how many women from bisexuals, how many men and women from drug users. The hope is that people will realize there is danger in sex with someone you don't know, in sharing needles, and that in the U.S., heterosexual AIDS will stay confined to a few percent. And no one hopes that more intensely than those with AIDS.
This is a real disease, and a lot of people are going to die, and a lot of children. And people have to stand up and become educated. They have to.
What it creates for them is what, has to be a nightmare situation.
Even for doctors so schooled in the ways of death, AIDS is a terrible enemy.
You have to realize that, no, they're not going to get better. They're going to get worse, and they're going to die. Okay.
Dr. Terry Coates makes her rounds at St. Vincent's Hospital in New York.
You're moving out pretty well.
Pardon me?
You're moving out pretty well. You don't seem to be using your oxygen as much. You want to say something to cheer him up, or you want to say something to lighten things a little bit. And it's the only way that I can deal with it.
Little victories, says Dr. Coates, a day at a time.
You can't look at these people as if, well, we might as well not do anything. They're going to die anyway. Because what is a week to someone who doesn't have much time at all? A week might be worth a week, maybe the rest of their life.
Life, AIDS, and the shadow of death. A struggle being played out many places across America.
12:32, Ken's Daily in your lunch hour from Love 98 KCFO. Good looking day in Tulsa aside from the
Tulsa, Oklahoma, where you can find Christian rock on the radio, the home of Oral Roberts University, the heart of the Bible Belt. The last place you'd expect to find an AIDS problem, not anymore.
AIDS has come to Middle America. AIDS has come to Tulsa.
Even in Tulsa, people meet every week in encounter groups trying to come to grips with AIDS.
You lay in bed and say, God, you're dying. You're 28 years old and you're dying. It's a funny feeling to die.
In the American heartland where traditional values are cherished, they are beginning to understand that AIDS is no longer a strange disease that only happens someplace else. AIDS hit home in Stillwater, Oklahoma, where identical twins, Randy and Ron Anderson, grew up, one gay, the other straight. Now Randy has AIDS. It is still difficult for Ron to accept.
It's something that happens to the other guy.
And when it, hits somebody as close as a twin brother, well, you definitely know that something can happen to you just as quickly.
I have never, ever believed that I was going to die. Not once. I don't believe it.
There is at least a chance that Randy can overcome the disease. Early next year, the twins will undergo a rare bone marrow transplant, a procedure that has shown some promise in the past.
Hope it works. That's what I pray about, that God will let it work. He gave us the opportunity to do it. Now we just got to kind of rely on Him to let it take its course and work.
For Randy Anderson in Oklahoma, there is at least hope. But here in Kansas City, there are AIDS victims, as is so often the case, whose only hope is that someone somehow can ease their suffering.
So how have you been since you got home?
I'm just tired.
Glad to see you dressed for the weather
Yes.
today.
Kansas City, too, is learning to deal with AIDS. The Good Samaritan Project here is a privately run hospice, a place where people with AIDS can live and be cared for, a home where people who have no place else to go can come to die.
I'll do it.
Good Samaritan Project, this is Virginia.
Virginia Allen runs the place.
We've had 16 women die with this disease in this city. We've had children die with disease in this city. We know of children that are exposed to it, that are carrying the virus, that now have been diagnosed with AIDS. We know the individuals, and they look a lot like you. They look a lot like me.
In the last year alone, more than 100 men, women, and children have died of AIDS in Kansas City, including one woman who got the disease when she was raped.
One at a time, baby, one at a time.
For those who live here, it is all one step at a time, trying to cope with pain, uncertainty, and frustration.
Slow.
This isn't enough. This is not what I wanted out of life. To live in a house like this.
What's the hardest part for you?
Hardest part, knowing I'm going to die. That's the hardest part. It's a real hard thing to accept. There's days when I say, well, God, I pray to my God, take me today, just get this over with. And there's days that I say, oh, God, thank you for the hope.
Hope and comfort also come through Good Samaritan Project volunteers who visit AIDS victims and their families. Olivine Henley visits Michael every week, most of the time just to listen.
I talked to my mom again on Sunday, and then it took me almost a day to read this. Dearest Michael, I'm still reeling from our phone conversation last night. Know that we love you. I'm still entertaining my right to denial. When the going gets tough, though, the tough get going. Very last but not least, know we love you. Mom.
Maybe it's less painful for those of us that are involved, although the pain is there and the sorrow and the grieving is there. But we can also look at, we made a difference in their lives while they were dealing with, trying to live with a fatal illness, that we made a difference.
To gauge how Americans view the AIDS epidemic, CBS News polled 823 adults nationwide last week. 1 out of 20 people said they knew someone who has AIDS. Most with an opinion said they thought the government isn't spending enough on AIDS research. And though the evidence is AIDS is spread only by sex, contaminated needles, and bad blood, sizable numbers still thought you could get it from casual contact. Roughly a third believed it's transmitted by kissing or by drinking from the same glass. Not so, say experts. More than 80% of the people we questioned expressed concern that AIDS will spread to the general population. And 1 out of every 4 young adults said that fear of AIDS has made them more careful about sex.
Do you think about AIDS when you go out?
Sometimes. I think more these days you have to be more cautious of who you go out with because nobody wants to get AIDS.
time, heterosexuals, straight Americans, thought AIDS was somebody else's problem. That is, if they thought about AIDS at all. AIDS is what homosexuals got. But a scary reality is starting to hit home, that the AIDS virus is out there, and it's not just gays who are catching it. So in 1986, the sexual revolution is undergoing a sexual evolution.
Before, maybe I used to go out with 6, 7, 8 girls, and I would take the one-night stance, and I'll admit it. I wouldn't do that now. There's no question I wouldn't do that now. It's not worth it. Because of AIDS.
Do you ever wonder about some guy you went out with 4 years ago?
Yes.
You really do?
I have a particular boyfriend in mind at the moment.
What do you...
You know why? Because this guy told me, he revealed to me, that he had this thing that he would go with prostitutes when he could.
So what do you wonder?
I wonder if he had AIDS. Out of all the people that I know, he always comes into my mind when I think about it.
Anybody can get it. Anybody can get it. Anybody is susceptible, and I think you increase the risk if you're dating a number of people. If you're going home with people you barely know, you think is sensational, and you don't know what that fellow has been through. You don't know where he's been, who he's been with. You're playing Russian roulette.
Russian roulette. That's the analogy holds up in that if you lose at either,
you die. It's very simple. Is it worth it? Is this man worth it?
It will not come and get you. You've got to go out and get it.
Dr. Terry Crenshaw, a California authority on AIDS.
People are under the illusion that, they can judge character and that they're going to be able to be selective. But that truly is a fallacy, because when you have sex with someone today, you also have sex with everyone they've had sex with for the last 5 or 7 years. And there's absolutely no way to judge the character of that particular population or even have any idea what the numbers are.
Alexandra is 41. She lives in Los Angeles. She is heterosexual and has ARC, AIDS-related complex, a possible forerunner of AIDS.
Again, I normally wait a fair amount of time before I sleep with somebody, but we seem to have so much in common that I just slept with him sooner than I normally would have. Slept with him 4 times.
She had no idea the man she slept with was bisexual.
Before I slept with him, I said, have you been with many women, since you've been here? Never thinking to ask, have you been with many men since you've been here? And he said, no, actually, I haven't been. I've hardly been with anybody. I've been more concentrating on my career.
It could be years before Alexandra knows if she in fact will come down with a full-blown case of AIDS.
I just thought I had the flu. Something that could be taken care of, but I never gave it even a thought about AIDS.
But it was AIDS, a suburbanite who had no idea of how she got it. She wasn't an intravenous drug user, she had no transfusions, and she was married.
I cried and cried because I thought I was going to die. I thought, I'm done with, I'm going to die, But then my mom said, no, you're not, you're not, you're going to be fine. Just get to the doctors. Get yourself taken care of. So that's what I did, and so far everything's worked out okay.
She told us that 1 year ago. 6 weeks later, she was dead.
She didn't really realize how serious the illness was.
And what was your reaction when you found out?
I died.
This is her husband. He had a secret his wife didn't know about until she got AIDS.
Your wife didn't know that?
My wife had no idea.
That you were bisexual?
No.
Even though his wife died of AIDS, he is healthy. He may only be a carrier.
Forgive me for asking this question. It's not easy, but do you feel in some way as if you murdered your wife?
No. Though the small town that I came from on the East Coast have labeled me a murderer.
Because she's dead?
Mm-hmm.
For a very long time, straight America thought AIDS was somebody else's problem. Straight America doesn't think that way anymore.
If I make it through the winter, I would be surprised.
St. Vincent's again. Call the patient Paul. He's 33.
You talked about making your own arrangements, and you thought that was best. Funeral arrangements are one thing. Death and the fact and the finality of death is another.
I must admit I'm a little angry about it, but you got to look at it like it's a fact of life, and it's going to take place at some point. It's just that I have some limitations that you don't.
Hospitalized for the 4th time.
Maybe we can just slow this down a little.
You mentioned that you'd considered suicide.
I think anybody that was in this situation has. If they say they haven't considered it, they got to be lying.
But in the end, you voted not to do it. You voted with yourself and decided to stick with life.
I think by having this disease, life is a little bit more precious to me than it was beforehand.
I do glance out the window and see what kind of day it is, and particularly on weekends when I used to sleep in, it's now get up and get out, because it's a beautiful day and I'm not quite sure how many more of these I'm going to have.
Jeff, can you tell me how sick you were when you first had AIDS?
When I was first diagnosed, I was in the hospital with pneumocystis, and I literally couldn't get out of bed. I was so weak, extremely sick, a very severe form of pneumonia.
A new drug, AZT, put Jeff's disease on hold. No patients taking AZT have been cured, but most lives have been prolonged.
AZT is a first step. It is an important first step. It is proof that something can be done about the AIDS virus.
It wasn't a simple step to take. Scientists were at first baffled, even intimidated by the elusive disease. Finding and testing a drug like AZT was no accident. Scientists learned as much about the AIDS virus in 2 years as they did about cancer or heart disease in 2 decades.
You can see the results. They were done in a scientific, objective manner. This is the first time that there's been a controlled study from the laboratory to the clinic. The drug does something.
But getting the drug is something else. Until federal approval, strict guidelines have been set that determine who will and who won't get the drug. And even when approval comes, supplies will be limited.
Yes, I want and need AZT. Because I know that it can prolong my life.
The mother of this 3-year-old AIDS patient asks anonymously,
when we're talking about a disease like AIDS that's deadly and you have nothing to lose, why why keep it from them?
I may very well get it, but I don't have it yet. I think it should be I think it should be as widely distributed as is necessary, since it is the only thing that we have so far.
Under the stringent guidelines now in effect, he didn't qualify for AZT.
I would like to take it, yes, of course. If I don't get it, well,
One week after we did this interview, he was dead.
Come on, Lenny, baby. And there was times when I just couldn't take it. I would say, God, please take me, get it over with, I don't want to live anymore. But then my girlfriend said to me one day, listen, I'm getting real tired of this. If you don't get up off your butt and help yourself, God and nobody else is going to help you. So, from that day on, it woke me up when she said that to me. From that day on, I just got the will to live, and that's the main thing, the will to live.
St. Vincent's. Call him Tony. Doctors think he got AIDS from shooting drugs. He's determined to beat it.
I prayed, and I just willed myself to get better. I said to myself, well, I got all these people out there that are sticking by me. If I'm not going to do it for myself, let me at least do it for them.
So far, nearly 15,000 Americans have died of AIDS, all hoping, at first, to tough it out.
It's a wonderful attitude to have.
They gotta have it, because like I said, the will to live is what it's all about.
How much of this, I'm not afraid, I don't have any fear of that, is you psyching yourself up for what you know you face?
This ain't such a bad, big bad guy that scares me at all. I mean, like I said, I fought bigger guys than this. This don't mean nothing. It's just another little fight to me.
I was very young and had started off using other drugs first and then followed into the intravenous drug use.
She is 30 years old and she is suffering with AIDS.
My contact with the disease was through my husband's IV drug use.
They have been married for 18 years. They have 4 sons.
I believe that I contracted it from a sexual relationship I was in before I was married with someone who was bisexual.
A wife and mother with AIDS. Her child, diagnosis uncertain.
I take responsibility for my own actions. I take responsibility for my own relationships. And it was not a risk that I was aware of.
My life is my life. That's the only way I know, is the way I did it.
I am not ashamed of my diagnosis.
There are few victims of AIDS who are willing to speak out publicly, but she is trying to make people understand.
What's the worst thing about this for both of you?
If something happens to me today or tomorrow, I have nothing for my kids. I have nothing to leave them.
But in a certain sense, her children have more than these children do, because hers are not infected with the AIDS virus. Some have called this a 20th century leper colony. It is the pediatrics AIDS ward of a New York hospital. And it is home to these babies because foster parents are virtually impossible to find for children with AIDS. Dr. Elaine Abrams.
This little boy is about 18 months, and he's quite ill now. He has AIDS and has major problems with his blood system.
The Centers for Disease Control say about 360 children in this country have full-blown AIDS, but they don't keep track of the children who have tested positive but don't show symptoms. AIDS is even more brutal to children because their immune systems are so fragile.
As he grows older, eventually he'll know that he's sick, and maybe slowly but surely I'll just let him know why he's sick and what kind of sickness he has.
She will tell him that they both have AIDS, that she was addicted to heroin.
The only thing that I really worry about is getting real sick, because I've been very, very sick. I've almost died twice.
Maybe it's not a huge problem yet among heterosexuals. Maybe it's not a huge problem yet among children. But I mean, how big do we want the problem to get before we're going to do anything about it?
What are y'all going to do about AIDS? What are you going to do? Yeah, I'm one of them. I'm one of them.
David Hurlburt is one of America's new untouchables. He does not have AIDS. He is not close to anyone who has AIDS. But he is suing an insurance company he says discriminates against homosexuals because of the AIDS crisis. That indirect association with the disease has been enough to make David Hurlburt a virtual leper.
I'll tell you when I felt alone. Just after I was in the newspaper because of the lawsuit, I went into the washroom at my company and noticed that other people in the washroom had stopped flushing the toilets. I later heard that it was because now several people are afraid that they're going to catch AIDS from me because I flushed the toilets in the washroom. I wanted to cry about it, is what I wanted to do. But now what I do is flush toilets and not think about it.
Like other gay men in San Francisco, Hurlburt discovered that insurance companies have set special standards which can deny coverage to homosexuals, AIDS or not. And AIDS or not, anyone with any connection to the disease can wind up among the new untouchables. People have been fired from their jobs, evicted from their homes, cut off from family and friends. The fear of AIDS breeds discrimination. Janet Bruner was fired when her boss found out she simply had volunteered to help people with AIDS.
Yeah, I've been treated like I had the disease, even though I do not have the disease, even though they could not, no one can get the disease from me because I don't have it.
Happy birthday to you. Blow out your candles.
Ryan Thomas got AIDS from a blood transfusion just after he was born. He's been fighting the disease ever since.
I opened this one.
He didn't have to fight the discrimination until this year, when he was old enough to go to kindergarten.
One little boy that has the AIDS virus in his blood, and the whole community just about is afraid of him and afraid of the virus.
But they don't have to worry about, getting it from Ryan or from us. Unless they have sexual contact with Ryan or direct contact from blood to blood contact with Ryan, they don't have to worry about catching it.
Actually, for a few days last month, Ryan did join other students in Atascadero, California, but under the especially careful eyes of school officials.
We're overly cautious, perhaps, but we're cautious on things like every kid have their own pencils, so they wouldn't be sharing and chewing on each other's pencils.
But when another child picked a fight, Ryan bit him and was suspended from school. His parents are suing.
If we can take it straight from the doctor that he has AIDS and still not be afraid of him, they can at least accept it and learn a little bit about it. I mean, I've had one girl come up to me and ask me how I could put Ryan in school knowing that he was going to kill all the kids at the school.
Well, the bottom line is he isn't any other child, and he does have to be treated a little differently.
Those parents who don't want Ryan in school say they need proof positive that AIDS cannot be transmitted by casual contact.
It'd be different if it was something where they were just going to get sick and it was going to run its course, but we're dealing with death here.
There is no 100% guarantee, but there isn't on nothing. The chances of Ryan spreading AIDS in school are over 1,000,000 to 1. The chances of them kids being killed on the way to school are 5,000 to 1, but they still send their kid to school every day.
If we saw the car coming, we'd move our kids. In this instance, we can see it coming, and we just want to be sure with our kids.
Ryan wants to be He-Man.
Ryan does have some friends, but as long as AIDS remains such a potent source of fear, those associated with it are likely to be shunned more often than they are embraced.
It's not Ryan so much, it's the AIDS, and it's impossible to make people understand and feel comfortable.
This thing hasn't changed my love. I would never stop loving him, no matter what.
Beth Israel Medical Center, New York.
And I don't know about
The woman is speaking to a hospital counselor. Johnny, her son, is about to die of AIDS. Johnny's sister, too, has come for the death watch.
How did you feel about it when you first found out, and how did you cope with it?
I cried till I did not know that so many tears could come from one person. I cried because I don't want to give him up.
To his dying days, Johnny never told his mother about his homosexuality or the AIDS. taboo topics back home in the hill country of Virginia.
He was my son, and I don't know about other mothers, but I don't see how one could turn one down. I really don't. I've loved him too long.
We spoke to mothers, fathers, and lovers of people with AIDS.
On a December morning in 1983, my daughter called me up and told me about her boyfriend contracting AIDS, and that it was a sexually transmitted disease. Nobody knew a cure for it, and that struck terror in my heart.
And he said very casually, "Oh, well, there's good news and there's bad news." And I don't remember what the good news was. He goes, "The bad news is that I've got AIDS, but don't worry about it, Mom, I feel great." That was in May. In fact, it was a week before Mother's Day. And he died this past June 30th.
What's the roughest part of it? What's the toughest thing for you?
I guess in a way it's the helplessness that one feels. Seeing, your offspring ill and being in, not being in a position to really give any direct aid.
You just kind of wish all the time that it would just go away and you could have your life back.
I think I would be angry if the person who transmitted it to my daughter or my son.
Well, he didn't know. And he was a kind person. He was a loving person. He was a caring person. He wasn't trying to hurt her. And he died a horrendous death.
Do you find yourself thinking, why me, why my son, why did it happen to us?
I did sort of say why Dave, because it seemed that his life was valuable, but then who might have said that his was more valuable than someone else's?
She was talking about my lover, David. I can't imagine anything more difficult than watching the person you love most in the world die. Painfully and slowly and without hope.
It was an extraordinary circumstance. The two of you were in the same room talking about the same person with great love and affection. I think I've been around enough to know that a lot of people are going to say, this is really unusual. Do you feel it's unusual not to feel any anger, any hostility, any blame going in the direction of your son's friend and lover?
No, of course not. David loved James. Why shouldn't I love him? And if I hadn't loved him for himself, I would certainly for the care that he took of Dave.
How do you answer the question of, well, if I had had a different lifestyle, if he had a different lifestyle, maybe this wouldn't have happened?
This virus has no idea what David's lifestyle was. It has no brain. It's not a moral judgment. It's just a medical aberration, a horrible thing.
As we have seen in this broadcast, the terrible price of AIDS is expressed most tragically in human terms. For society and for the government, the dollar cost of medical care over the next few years could be staggering. Who will pay? Who should pay?
Look at his will. What's going to happen to his will?
3-year-old Alex has AIDS. Insurance pays $15,000 a month in home nursing costs.
His medication, which he takes 3 times a day intravenously, is about $50 an infusion. The nursing is $17 an hour, but that's much better than in the hospital.
Nick's medical bills have run over $235,000. That's covered by insurance, but AIDS has cost him a career he'd worked very hard to build.
I've had colonoscopies. I have had bronchoscopies, which is washing of the lung. I have had, oh my goodness, so many, it's hard to think.
If you designed a disease to do the worst possible damage to a person, you'd come up with AIDS. If you designed a disease to make it as difficult as possible for insurers to deal with, you might come up with something very much like AIDS.
You have 2 lesions.
Major East and West Coast cities that form the AIDS belt pick up the brunt of payment for the uninsured. But by 1990, the cost will rise dramatically in Middle America.
By that year, AIDS is going to be to Minnesota what it is now currently in New York and San Francisco.
With the prospect of the new drug AZT, some doctors are taking extraordinary measures to keep patients alive long enough to get it. When AZT is approved early next year, costs may soar.
I think it's almost certain that AZT is going to increase the cost of caring for patients that actually have AIDS because it will prolong their illness.
Insurance companies say they won't issue new policies if they've determined you're at risk for AIDS. Like many AIDS patients, Alex's insurance runs out this year. Welfare won't pay for nursing care at home, only in a hospital.
To have him hospitalized would cost at least 4 times as much as what he's being treated with at home.
I never go to the hospital ever again. I'm going to stay home.
Many AIDS patients are too sick to work. Others are fired when employers discover they have AIDS. Some must quit their jobs to be eligible for state or federal health benefits.
They will have to go on to Medicaid to get their hospital bills paid, but they can't go on to Medicaid until they've spent down their assets to a certain amount. So we invite people from the middle class to become a member of the welfare class.
The drop to the welfare class is fast and devastating. Even with insurance, the financial impact hits AIDS patients and their families hardest. This was Doug's family home before it was repossessed by the bank.
My parents have made it very clear to me that even though I've lost their home and their security and their nest egg in life and their retirement home and money, that it's no big. They just said, son, you did your best. It was too big of a project, and we love you, and you don't owe us anything.
Just little things that people say.
Paul Castor was fortunate to have VA benefits, but even with good medical coverage, the Castor family's financial system eroded even faster than Paul's immune system.
He's family. He's my son. He's my baby. No way in hell I'm going to take and turn against him like I know a lot of other people have turned against these poor kids, and I think it's a damn shame.
Even being at home, it's too much. It's too much on them. They're not well themselves.
What's the hardest part?
Facing reality. Am I right, Paul?
Yeah.
Yeah.
Scientists fighting the war against this awful disease do have one powerful weapon. They know what causes AIDS, and they know how to prevent it, if only people listen.
It's embarrassing to most people to talk about sex, to say safe sex means you have to use condoms. Well, that's the kind of thing that is going to have to start happening if we're going to stop the spread of AIDS.
That word is getting out in some cities mostly where there's been a lot of AIDS. This is Booker T. Washington Junior High School in Miami.
Then I want to ask, how can you prevent from getting AIDS?
Nurses from a local hospital have come to explain the new facts of life to students. Students likely to be experimenting with both sex and drugs. And the nurses pull no punches.
People often say, is there an AIDS vaccine? And we always say, yes, there is. It's called a rubber.
I know you may feel like a jerk buying them or taking them out or putting them on, and you don't think it's romantic.
Sex, Drugs, and AIDS is a new education film aimed at the same audience and just as frank.
I don't want to get pregnant. I don't know what to use because I don't want any diseases either. You know, I just... What do you use?
I use condoms.
Just can't believe it. I didn't think anybody used those anymore.
Released only this fall, the film has been purchased by organizations in more than a dozen states already. The Army, too, has an AIDS movie, a new kind of training film.
Well, I liked what I saw. And before long, every chick on the street knew me by name.
The acting may be questionable. The message is not.
What can you do to protect yourself? The most obvious, of course, is don't have sex with prostitutes.
Warnings are being pushed now, too, by the Surgeon General in new TV spots and in a highly explicit pamphlet about AIDS. Its main targets, low-income groups at risk because of high rates of drug abuse, and the young.
They are very active sexually. They are having a lot of partners. And when you do take a history, you find out they may have had 3 or 4 partners in one weekend.
and they know next to nothing about AIDS.
I now hear you can get it from toilet seats.
Do you ever worry about it?
I just think it's something that's not going to happen to me.
Gee, I don't want to go around asking about AIDS. You know, people might think I have AIDS, or might think that I'm a homosexual.
It's an unmentionable type of a thing.
Today, mentioning the unmentionable and getting the word out about prevention is the only answer. Just ask those who didn't know.
Please, I beg of you, I do not want anybody to go through what I've gone through, you know.
All people have to become involved with this and to understand this disease. It's the laws of self-preservation.
Which brings us back to the hospital rooms, where the little victories and the inevitable defeats are played out each day. Here's what's happened to some of the people with AIDS we have come to know and respect during this report.
Tony was well enough to leave the hospital over the weekend, still toughing it out. Paul learned that he too might go home in a few days, to the winter he so dreads. Johnny remained in an irreversible coma. His mother said her goodbyes and returned to the hill country where he was born. And this man, Bill, who'd been watched over lovingly by his mother, received a final benediction.
He asks for your forgiveness, and he also asks for a peaceful death, a death which will take him right from here into your arms. And we ask that this might be a beautiful, peaceful time for him until he dies. We also ask for a release of some of the pain that he's going through. And when it's time, we ask that you take him home and that he pray for us from his place with you.
Bill died last Sunday.
Amen.
Hospital in New York City, our vantage point tonight for a special look at the impact of AIDS, which by now has touched virtually every community in this country. New York City has roughly a third of the cases. Today, officials opened Bailey House, a new facility for homeless AIDS patients, for people who have run out of money. It will house 45. There is likely to be a long waiting list. It's estimated that 1.5 million Americans now carry the AIDS virus, and 270,000 will die by the year 1991. This week, the Centers for Disease Control in Atlanta will hold an extraordinary hearing to focus on what to do. Among the more controversial issues, the question of mandatory testing for the AIDS antibody. Who should be tested, and who should have a choice?
You to hold for just a second, please. The AIDS hotline at St. Clair's.
Are you worried about that? You might have this? They won't be able to see you till May. No, there are that many people who want to have tests.
Most of the callers besieging the country's AIDS hotlines, wanting to be tested, are heterosexuals, panicked at the realization that they, too, could be at risk.
I think the public in general is really beginning to wake up to the scope of the problem and the personal message that the problem has for them.
Very sick to my stomach and cramps. You have cramps.
That despite the fact that relatively few AIDS cases in this country are classified as heterosexual, only about 4%. But by 1991, the number is expected to double. And with AIDS seen now as a threat to the general population, and with no vaccine or cure in sight, there are calls for wide-scale mandatory testing. Supporters say many people at risk just haven't come forth voluntarily.
I didn't really want to know. That's why I never got tested. You can be tested, and you can get totally freaked out.
But civil libertarians insist that requiring tests would be both a violation of individual rights and futile.
Mandatory systems never ultimately work. They send people underground, they frighten people, they turn people away.
The Centers for Disease Control isn't so sure, and at what are likely to be jam-packed hearings this week may explore requiring AIDS antibody tests for all marriage applicants, hospital patients, people who go to VD clinics, pregnant women. Conservatives charge that it's only the political power of the gay community that's held off mandatory tests this long.
The public health officials of America have been intimidated from preventing them to take the response they should and treat it as a public health issue. They're still treating it as a civil rights issue as we speak today.
Mandatory testing could lead to widespread discrimination across the United States. It could lead to purging of entire industries or groups of people if those records ever became public.
Any recommendations the CDC might make on mandatory testing would have to be approved by the states. Privately, some health officials think the hearings are simply a way for the Reagan administration to go on record as considering tough action. Health officials are doubtful that many states would take it.
I'm quite sure that my colleagues from other high prevalence areas of AIDS will feel as I do that we must maintain the confidential and voluntary nature of AIDS testing.
Many see the calls for mandatory testing as simply a reaction to the fact that there are no easy answers. There are some scattered reports that an AIDS vaccine is being tested in humans in Africa, but most experts think that it will be many, many years before an effective vaccine is widely available. And along the way, there are questions. Who will test it? Who will take it? And with all the liabilities, what company is going to want to make it? For the drug companies, finding a cure for AIDS may offer far less hassle and even greater profits. As Victoria Corderi reports, the race is on, and it is often unscrupulous.
Our next story is about hope and hopelessness. AIDS has almost become a synonym for death. The disease has no cure and few treatments. Some blame the federal government for not responding to the epidemic fast enough. Others point to standard medical practice, which so far has little to offer. The stage is set. People are frightened, and every quack out there knows it. As the AIDS epidemic grows, so does the network of AIDS fraud. Charlatans who advertise mostly by word of mouth, although some are bolder than that. They feed on despair, and it's so very simple. When you've been given a death sentence, you'll try anything, from the unproven to the unbelievable.
An AIDS patient came in just recently. He was practically dying. And in less than 15 minutes, he opened his eyes and was feeling sober. He said, "I like looking at pretty girls." I said, "You're crazy. You just came in here half dead. What you talking about looking at pretty girls?" That's how quick he responded, because the body accepts things electrically. Life is electrical.
And death from AIDS avoidable, Dr. Sabi claims.
The mucus is clogged in the nasal passages.
Dr. Sabi isn't a doctor. He's an herbalist, a man from Honduras who brought his bag of miracles to Brooklyn. His cure for AIDS starts at $500. It's the same regimen of diet and herbs he prescribes for everything, including this woman's sinus problem.
Your heart beats fast once in a while. It picks up a beat or two. Now, how do I know all of that? Because everybody had the same disease. I am asked, how am I curing these diseases? Some people call me scientist, some call me voodoo man, some call me a whole bunch of stuff.
I would call him part of a growth industry that we will see related to the exploitation of the AIDS virus. People out there who are prepared to market hope and sell it at premium prices. Virginia Apuzzo is New York's Deputy Commissioner of Consumer Protection. She learned of Sabi's cure the same way his AIDS patients did. She read his ad in the newspaper. When you advertise that you can do something that you can't do, and then you charge $1,300 for it, we call that consumer fraud. Sabi says he's cured 7 people with AIDS. When asked for proof, he offers up the case of a Boston man.
Frank left left Boston and took a cross-country trip, happy as a lark, because the doctors told him he's free of AIDS. He came back to Boston with a slight fever that they could not understand. The infection had gone too far. I was there too late. Frank died. But the doctors in Boston told me, you know, he didn't die with AIDS. I'm happy to tell you, Dr. Xavier, that you cured him of AIDS. So thank you very much.
But Frank Knight's doctors and his death certificate say something very different. Both confirm Frank Knight died with AIDS.
People fall for this stuff. Well, how come? The question becomes, how much are you willing to pay for hope? And in a desperate situation, in a situation in which you feel there is no hope, the answer is probably anything you have and then some.
Doors closing, doors opening, doors.
There is a desperate need for hope in Houston, Texas, which has the fourth largest population of people with AIDS in the country.
I'm safe, it's only change.
Desperation is what drew Roy to this healing group. When he's not trying to sing away his sickness, he's grinding up wheatgrass in his kitchen on the advice of a nutritionist.
What I'm going to do is I'm going to make a green drink.
Roy believes the green drink will make him well, but he's not counting on it alone. He also takes the experimental drug AZT, the only AIDS treatment approved by the government.
This is the AZT that I take.
Is there any irony, you think, to the fact in one hand you're holding traditional medication and the other hand you're holding an alternative?
The nutritionist would say baloney to the pills. The doctors would say baloney to the green drink.
So what do you say?
I want to live.
Roy is terrified. He's given a diagnosis that, for all he knows, means he will die.
Dr. Richard Conklin is Roy's physician. As an infectious disease specialist, he treats AIDS patients. As a psychiatrist, he understands them.
He's going to run to everyone who offers him any hope. And Roy goes to psychic healers and nutritionists and Dr. Hitt.
Do you wish that he weren't going to see Dr.
Yeah, I think Dr. Hitt's treatment is probably harmful.
We have 70 AIDS patients, and we have only had 2 AIDS patients who have come down with secondary opportunistic infections. I would say that this would be well above any standard.
William Hitt is a man full of claims. He claims to be an immunologist who's found a natural treatment for AIDS. His patient's urine is filtered and a byproduct re-injected at $100 a shot, 1 shot per week, indefinitely. He claims he hasn't had time yet to scientifically verify his results, but he did find time to advertise them.
It says here the clinic has proven and promises to extend indefinitely the hope of life for many AIDS victims. What do you mean when you say promises to extend indefinitely?
Well, I didn't write that, but I again...
You didn't approve, though, this?
I think I read that.
Because I was curious as to what that meant, promises.
From what we're seeing in our ongoing studies, that I would certainly think that we would be able to promise that we could extend the life of those patients.
Tabulate the results. Would it take an evening to sit down and do the statistics and put them out there? You may have treated 100 patients, maybe 200. He can put those results together in a matter of hours.
That's what we're doing right now.
That's what you're doing now?
That's what we're doing right now.
With Dr. Bennett?
With Dr. Bennett. Mm-hmm.
But when we called Dr. Michael Bennett, a Dallas immunologist, he said there is no study. Hitt's story, he told us, is purely wishful thinking. And Hitt's claims don't end there.
I've certainly gone out and discussed this with a great number of people, and I've invited people all over to come in and listen, see what we're doing.
To hear you tell it, you have extended yourself out to the medical community and said, hey, I think I'm on something here. Why don't we talk about it?
I think I would go talk about this at a county fair.
He's never offered to meet with any of us in the community. We would love to sit down with him and discuss our results and compare his results and see what's going on. We'd love it. There's another reason that data is not available to us.
And that reason is?
I don't think it exists. I think it's hokey.
Well, do you think he's doing it just for the money?
Well, if it was for fame, he'd send his stuff to the Nobel Committee. If it was for altruism, he'd share it with New York and San Francisco and Los Angeles and Zaire and every place else that had AIDS. So it's not altruistic and it's not for fame. What else is there? $5,000 for a series of injections.
Hitt says he's not making money from the treatments, but almost everything about the man we can verify contradicts what he says, down to his basic credentials. Hitt's patients at his immunotherapy clinic know he's not an MD, but they are told he has a PhD from Johns Hopkins University.
When we asked Johns Hopkins, they said that you don't have any PhD from Johns Hopkins.
Well, I'm sorry, because I certainly do. I mean, in what particular year did you ask them?
They go back to the 1890s in their records, and they have no record of a William Hitt getting a PhD in applied biology or anything else there.
Well, I certainly have that. You might put down the name Dr. Valentine, too.
Dr. Valentine?
Valentine,
We did call Dr. Robert Valentine, a professor emeritus at Johns Hopkins. He knew Hitt when both were members of a local flower society, but Valentine says Hitt has no degree of any kind from the university.
How do you react to those doctors in Houston who say that you're a quack?
I don't know. I guess a quack has got to practice medicine, but I'm not practicing medicine. So.
I think that you understand what I mean, though. They think that treatment's phony.
Okay, they're trying to say the treatment doesn't work.
They're not simply questioning the treatment. They're taking it a step further and saying you're preying on people.
Well, I think in something like this, I think you would just have to ask the patients themselves. And I think that's the only proof of it.
This is the first place I've gone to where they said there was hope. So I'm going to stay here.
There is no doubt Hitt's patients want to believe in him. One of them spoke out as we were ending the interview. He asked not to be seen, but he did want to be heard.
My body's producing this. I'm not rejecting this. My body's using it. And I'm living. Whereas before I was sick, and looked like I should go on and just put my arms across my chest and lay down. Death with dignity. Well, I'd like to live with some dignity instead of dying with it.
That's what Jim Beecher wanted, and it cost him everything. Beecher was president of Houston's AIDS Foundation, an unlikely candidate for fraud, until he met up with this man, James Douglas. Douglas promised him what no one else could, a cure for AIDS based on psychic healing and herbal capsules. He promised David Jones the same thing, but the capsules made Jones sick and suspicious. He sent them to a state lab for analysis.
These quote-unquote herbal capsules actually contain heavy metals, lead, chromium.
Did anyone from the lab tell you what that could do to you?
Well, heavy metals have a tendency to actually short-circuit the brain, from my understanding.
The analysis came too late to help Jim Beecher. Last January, he began to have trouble breathing. Douglas told him it was just part of the cure. It was actually pneumonia. But by the time Beecher was put in the hospital, no one could save him. Dr. Conklin was a consulting physician on the case and met up with Beecher's healer.
My encounter with him was walking into the intensive care unit and finding this man in a clerical collar standing at the foot of the bed with alligator clips on 2 toes and wires coming off these clips. And I said, gee, what are you doing? And he said, I'm communicating with his unconscious. And I said, well, the man's brain dead. And he says, no, I communicate with him, and he wants you to play his favorite opera.
6 months after Jim Beecher's death, James Douglas's clinic was still open. Authorities were reluctant to investigate, one of them told us, because they were afraid of catching AIDS. By the time the Attorney General was ready to press charges, Douglas had skipped town. No one knows where he is now or if he's still practicing. As for Dr. Sadie, he was scheduled to appear in a New York court this morning, charged with the unauthorized practice of medicine and false advertising. Dr. Hitt is currently under investigation by the Texas Attorney General's office, but that hasn't stopped his patients. Ironically, it's the victims themselves who are most reluctant to recognize the fraud. Hope, it seems, is hard to let go of, even when it may be false hope.
They believe. They think this will help. And you just stand there and tell them this is lead and it'll poison you, and there are a certain number who believe it will help. desperation.
New developments today in the battle against AIDS, they centered on issues of public health and public morality. A federal agency called for increased voluntary testing for the AIDS virus, and the nation's largest city began an anti-AIDS advertising campaign of startling frankness. CBS News correspondent Richard Roth reports.
There's no way of its creators say no advertising campaign on the danger of AIDS has talked as tough as this one.
If you're doing anything, you use one of these. You understand?
The print and broadcast ads shown off by New York City officials today are aimed mainly at heterosexuals, intended primarily to encourage the use of condoms as a way to prevent the spread of AIDS.
No. And if he says no, so can you.
The Catholic Church called the commercials an endorsement of promiscuity, and so far only the city-owned TV station has agreed to run them.
Just as I'm concerned that some viewers will be concerned and be offended, I'm also concerned about the fact that there are thousands of people out there who are risking their lives who might otherwise be saved from a certain death.
And a similar concern is fueling debate nationwide over a new federal proposal to vastly increase the number of people tested for AIDS. Not to cure them of the disease, there is no known cure, but to keep them from spreading it.
I'm in some of the high-risk groups.
The proposal drawn up by the Centers for Disease Control says AIDS blood tests like the one this doctor was discussing with a patient today should be encouraged for anyone in a high-risk group, including people with venereal disease, intravenous drug users, and some pregnant women. But it calls routine mandatory AIDS testing not justified, an issue that's dividing some of the president's own advisors.
But I think people who apply for marriage licenses, people who are admitted to hospitals, and others, we should have routine testing. And I still don't understand why we're not doing that.
Voluntary testing, easily accessible to all, with the appropriate counseling and with safeguards to ensure confidentiality, is good public health practice at the present time.
Opponents of wide-scale compulsory testing claim it would waste money and scare off many people who might be infected. The tests now are mandatory only for military and some other government personnel and for blood donors. But that's already enough to keep this Dallas AIDS testing lab, the nation's largest, busy on 3 shifts, 24 hours a day. Richard Roth, CBS News, New York.
This is the CBS Evening News. Susan Spencer reporting. AIDS and the devastation the disease is causing around the world will be a major issue at the upcoming Economic Summit Conference in Venice. The White House confirms tonight that the leaders at the 7-nation gathering will call for international mobilization against AIDS, which they see as a threat to economic and political stability as well as to world health. Jacqueline Adams reports.
President Reagan returned from Camp David today, ready to step up the administration's war against AIDS. Tonight, at an AIDS research fundraising dinner, the president will call for routine AIDS testing for as many as 50 million Americans each year. Next week, at the Venice Economic Summit, Mr. Reagan will join with the leaders of the 7 industrial democracies in labeling AIDS a major world health problem.
The key point is to make sure that everything that can be done cooperatively, internationally, is being done, and that we're not having needless duplication.
Participants in the 3rd International AIDS Conference gathering in Washington believe this signal from the 7 heads of government will give their work a boost.
If nothing else, it'll get people thinking about the problem. If we can get that energy focused into constructive public health measures, that would be great.
The fact that the leaders are talking about it really rockets it into prominence, I think. I think it's terrific.
AIDS experts, however, are troubled by the president's decision to support routine testing here in the United States. They're calling it a highly political step and would prefer a massive education program aimed at all Americans, not just those forced to take an AIDS test. Jacqueline Adams, CBS News, the White House.
President Reagan has an AIDS policy on the record this morning. The president came out last night for widespread testing. He spoke at a fundraising dinner for a private research foundation, and Jacqueline Adams was there.
The setting was gala, but the mood distinctly was not. President Reagan was repeatedly booed at an AIDS research fundraising dinner last night as he detailed his controversial plan for routine AIDS testing.
I've also asked HHS to add the AIDS virus to the list of contagious diseases for which immigrants and aliens seeking permanent residence in the United States can be denied entry.
The president wants AIDS tests for up to 50 million Americans a year, all marriage license applicants, federal prisoners, those seeking treatment for sexually transmitted diseases or drug abuse, and Veterans Hospital patients. Anticipating a hostile reaction, Mr. Reagan took pains to explain his decision.
AIDS is surreptitiously spreading throughout our population, and yet we have no accurate measure of its scope. It's time we knew exactly what we were facing.
But those who disagree say AIDS testing won't work and wastes money.
We need some executive approval, some encouragement that we're going to have some laws passed to protect these people. Otherwise, the disease is going to be driven completely underground. The people are not going to come out and get tested. It's going to work against us, and it's going to work against the public health.
Some AIDS experts are planning to boycott the President's Special Commission on AIDS because so far none of the nominees is gay or an AIDS victim. Even though many believe the administration is politicizing the AIDS crisis, the experts generally welcome the president's decision to put AIDS high on the agenda for next week's Venice Economic Summit. Jacqueline Adams, CBS News, the White House.
Homosexual men and women marched in parades around the country today, all in commemoration of the 1969 New York City riots that marked the beginning of the modern gay rights movement. Today, marchers celebrated the gay lifestyle, but at the same time showed solidarity and sympathy for those with AIDS. The epidemic has hit the gay community in this country especially hard. The desperate plight of those with AIDS was remembered, too, today in West Hollywood. AIDS activists commemorated those who have contracted the fatal disease and those who have died, more than 21,000 Americans so far. The fear of getting AIDS has hit virtually every segment of our society. Some of that fear is rational and some is not. The question for medicine these days is where do its own people draw the line? Dr. Hasib Aoun once had a promising future in cardiology. Today, his future is uncertain. His story, the physician's ultimate nightmare.
I have contracted an infection with the human immune deficiency virus, the AIDS virus.
Dr. Aoun says he got the virus when a tube of AIDS-contaminated blood broke and cut his hand. He is among fewer than a dozen healthcare workers reported infected with AIDS on the job, and all of them through accidents with AIDS-tainted blood. The infrequency proves, the Centers for Disease Control says, that the risk is very, very small. But statistics are one thing, and fear another. And as the epidemic grows, so has physicians' anxiety.
It's fear. It's an immediate fear. The AIDS virus is known to be transmitted through blood products. When you stick yourself with an AIDS needle and see your own blood, you're scared.
I don't care if only 1 out of 1,000 or 1 out of 5,000 get it. If you get it, that's it. It's a fatal illness.
A recent report found that 25% of young New York doctors surveyed said they would not treat AIDS patients if they had a choice.
We are seeing increasing instances of healthcare professionals refusing to treat persons with AIDS or HIV seropositivity. This is a crisis.
At its annual meeting last week, the American Medical Association's Board of Delegates emphasized physicians simply cannot turn their backs on the medical tradition of treating patients with infectious diseases just because of AIDS. But some physicians, and especially some surgeons, disagree.
I will not do a long, complicated cardiac surgical procedure on AIDS patients.
Dr. Johnson's hospital requires a test for the AIDS virus before surgery, a practice many hospitals are expected to adopt soon. A heart bypass specialist, he has refused to operate on 2 patients because they tested positive.
Blood is splashed on me, on my face, and on my assistants. And it's certainly the policy, ethical policy, that a physician has the right to accept or decline any patient that he wants to take care of.
I think any physician or healthcare worker who refuses to take care of a person who's infected with the virus or who has AIDS or any of the complications of AIDS should get out of the business.
The vast majority of doctors are staying in the business, coping with their anxiety, exercising great caution, and accepting some inevitable risk in treating AIDS patients. Dr. Aoun understands both sides of the issue only too well.
Look, I'm one of them now, and if I come to a hospital, I will really feel sad and angry towards a house officer who refuses to come close to me.
6-month military study indicates the rate of AIDS infection may be running as high as 2% among Army recruits from urban centers such as New York. That report in the New England Journal of Medicine is disturbing, of course, but the urban rate has held steady at 2% for more than a year, and some researchers argue that if AIDS were blasting into the general population, the rate should be much higher by now. CBS News national correspondent Bernard Goldberg looks tonight at AIDS, the facts, the figures, the fear.
Some of the TV ads are frightening, a reflection of the disease itself.
At first, only gays and IV drug users were being killed by AIDS. But now we know every one of us could be devastated by it.
It's part of the new AIDS media blitz.
AIDS affects all of us.
The message is powerful.
And AIDS can kill you.
The target, heterosexuals.
He'll tell you just what you want to hear. But what he can't tell you is if he's got the AIDS virus.
In spite of the campaign, in spite of all the talk about AIDS breaking out into the general heterosexual population, the fact is, it hasn't happened in the United States. In this country, AIDS was and still is a disease mainly of homosexual men and IV drug users. And now, some experts are saying AIDS probably never will become an overwhelming danger to the general public.
AIDS is a scary disease, and nobody wants to get AIDS. But I think we still have to put this in perspective, that most people in this country really are at very low risk for AIDS.
They say heterosexuals can die of it too. Name one. Thank you very much. And
it's become the stuff of comedy, but it's comedy with an edge.
That's one of those jokes people go, ah! Honey, I can't think of anybody. Maybe he's on to something here.
But health officials aren't laughing. Some are worried about losing the public's confidence.
We risk a real backlash if we try to scare everybody, and then it turns out that that scare was not based on the real likelihood of transmission.
Here are the facts. Of more than 38,000 Americans with AIDS, 2% are heterosexuals, not in any of the so-called high-risk groups. That means they don't use IV drugs and they don't get regular blood transfusions. 2%. And almost all of them are women who got AIDS from men who did use drugs or were bisexual.
If you say right now who's really at risk, is it the housewife in Cedar Rapids? The answer is no, it really isn't.
But I'm scared to death of getting AIDS.
And even though the campaign is largely aimed at white, middle-class, and yuppie audiences, the facts point to a different victim.
The person who's really at risk for heterosexual transmission right now is likely to be a black or Hispanic teenager having sex with a drug abuser. Right now, that's where the problem is.
For some groups, AIDS has been a nightmare, prompting dire warnings to straight America.
Heterosexuals are also going to die if they're not educated. If they do not have the information they need to protect themselves from getting infected, they also will die.
Yes, AIDS is spread among heterosexuals in Africa, but many experts now say that's unlikely to be duplicated here because conditions are totally different in Africa. And the fact is, a decade after the AIDS virus first surfaced in America, AIDS still has not become a plague on the general population, as some had predicted. The number of victims is relatively small. Fear, on the other hand, is epidemic. Bernard Goldberg, CBS News, New York.
Yes, you're planning an announcement today from the nation's first AIDS hospital. It came amid increasing concern about the ultimate costs of treating victims of the deadly disease. AIDS already has claimed more than 22,000 lives in this country. Harry Smith has the story of the little hospital that couldn't.
Last September, the nation's first research center and hospital devoted solely to the treatment of AIDS patients opened in Houston. Today, the hospital's parent company announced the facility would be closing down.
If the doors close, what's going to happen to this research and the experimental drugs that are keeping so many of us alive?
American Medical International, a for-profit hospital corporation, found out the business of AIDS is a big loser.
This is an expensive disease. The resources of the people who have it are very thin. There is no public sector funding yet earmarked for patient care.
Of a projected $8 million loss this year, AMI claims $5 million comes from patients who can't pay. Many AIDS patients lose insurance as they lose their jobs and their ability to work. Others find a positive blood test for AIDS makes them uninsurable, with 90% of the insurance companies in the country.
In order to pay these phenomenal individual claims costs, running maybe $100,000, $150,000 per person, we will essentially have to elevate the premium cost for all insureds.
My real feeling is that people are being abandoned out of a sense that they really do not count.
A new government study claims by 1991 there will be 172,000 AIDS patients in the United States. Their medical care will cost $60 billion. People with AIDS bear the pain of the disease. No one seems willing to bear the cost. Harry Smith, CBS News, Houston.
Bad as it is among the general population is even worse among minority groups. Today, doctors and scientists got together in Atlanta to search for explanations and solutions. Bruce Hall has our report.
Health officials said today there has been a dramatic rise in AIDS in the black and Hispanic communities as the ghettos have become a breeding ground for the disease. Activists say it is spreading because many blacks still see AIDS as a gay white man's disease.
If it is in the black population, it's an IV drug user, well, so, or it's a person who's gay, well, so, but no, we have 75% of the heterosexual cases in the black community.
At the first National Conference on AIDS in Minorities, officials from the Centers for Disease Control said today minorities are getting AIDS at twice the rate of whites. 38% of all AIDS cases are blacks and Hispanics, although they only make up 19% of the population. 73% of all women with AIDS are minorities. 78% of all children with AIDS are minorities.
This disease does disproportionately affect the black community. We cannot be paranoid about it. We cannot be concerned about the way in which that information will be used to embarrass us.
In heavily black areas, educational campaigns are now beginning on television.
You don't have to be white or gay to get AIDS. Call this number to get the facts on AIDS and how you can prevent it.
And ads are being developed for the Hispanic community. Hispanics say AIDS is difficult to deal with because of cultural barriers.
People in our community have difficulty identifying with it as a potential risk to them. There's difficulty in discussing it openly to certain segments of our society because of the taboos on sexual subjects and issues of homosexuality.
We must not let sensitivity or embarrassment about discussing drug abuse and sexual promiscuity in minority communities impede our ability to address these urgent problems.
And to be successful, activists say the fight must also be carried to the black churches.
When the pulpit focus has to deal with something that talks about sex as its basis, it's very difficult for most ministers to want to take that position. I don't think we have any choice now, though.
Sandra McDonald says the more AIDS victims that die in the black community, the more people are beginning to pay attention. Bruce Hall, CBS News, Atlanta.
Until today, news about the deadly disease called AIDS has been largely depressing when it hasn't been downright terrifying. Today, a note of promise. No more than that, but there is room for hope after the Food and Drug Administration's approval of an experimental vaccine. Deborah Potter has our report.
It's a major milestone, the approval of the first AIDS vaccine for testing on humans.
I would use the word hopeful. We are hopeful that this would be an effective vaccine.
The company that developed the experimental vaccine reports encouraging results in tests on lab animals. Scientists now plan to inject it in humans to make sure it's safe and to see if it triggers any immune response, suggesting that it might prevent the disease. Then and only then will further tests be in order.
We certainly haven't gotten to the point where we have a vaccine that we know will protect anyone from infection with the AIDS virus. We're at the very early beginnings of testing.
The vaccine is made from part of the outer surface of the AIDS virus, and scientists say it alone cannot cause the disease. Homosexual volunteers who don't have AIDS are now being recruited for the first clinical trials.
It's important that people not have a false sense of hope, and it's important that they not let down their guard right now.
The experimental vaccine approved approved today is just one of more than a dozen now being developed. But researchers warn that the AIDS virus is such a mystery, there's no guarantee that any of them will prevent the disease.
This is an unprecedented situation with AIDS. We can't make the kind of projections of protective immunity that we were able to do with other viruses.
Today's announcement does not mean that a cure for AIDS is any closer, and an effective vaccine is still years away. For now, the experts say, the only vaccine available is education. Deborah Potter, CBS News.
Three brothers in Arcadia, Florida. It was a day they will never forget, and neither will the community. Bill Whitaker is there.
Today was the first day of elementary school for the three Ray brothers and their little sister. The DeSoto County School Board tried to keep the boys out of school because they are hemophiliacs who have tested positive for the AIDS virus. It took a court injunction to get them in the classroom. Because the boys came to school today, about half the other students stayed away. Outside the school, tensions were high.
You ain't got nothing better to do, come down here and harass kids?
Those who did come were apprehensive.
I made him bring his own water, and we told him not to go to the bathroom if at all possible.
I don't want to catch the AIDS.
I don't want her teasing them like other children. You know, kids will hurt you.
Doctors say the brothers were probably exposed through contaminated blood clotting medication, all too common among hemophiliacs. But they show no signs of the deadly disease.
I don't worry about picking them up and kissing them. I don't worry about eating after them. I don't worry about drinking after them. And I haven't been affected.
As a matter of fact, there is not one case reported in this country where AIDS has been contracted in school by casual contact.
But such assurances have done little to calm fears here in this rural Central Florida community. A kind of AIDS hysteria has gripped many here in Arcadia.
It's not what they can tell you about AIDS that frightens me, it's what they can't tell you. There are too many unanswered questions.
I think every parent in Arcadia should keep all the children out of all the schools.
Many parents are sending their children to private schools.
Enrollment's up about 25%, and basically that's because of what's going on at the public schools right now.
At a rally last week, the newly formed Citizens Against AIDS in Schools called for mandatory AIDS tests for all school children and teachers and vowed to go back to court to get the Ray brothers out of school.
So it is our responsibility to move in there and pick that fight back up and not let it die.
I think people are only being normal. They're being human, because the threat that appears to them is very real.
You know, I really think that they need to sit down and say, what if it were my child or, you know, my relative or my neighbor?
Newspaper editorials here have dubbed Arcadia the town without pity. Today, the youngest of the Ray brothers played in the schoolyard by himself. Bill Whitaker, CBS News, Arcadia, Florida.
This led to new violence in Arcadia, Florida. A suspicious fire destroyed the home of 3 children infected with the virus, and Peter Van Zandt has our report.
Burned out of house and home by an apparent arsonist last night, the Clifford Ray family of Arcadia, Florida, whose 3 sons carry the AIDS virus, tonight decided to move away from the town where the fear of AIDS had spawned death threats.
And obvious the fire started in the children's bedroom. Whoever did it was trying to make a point.
It's come to the point that, you know, I cannot endanger their lives anymore by being there.
Earlier this month, a firestorm of anger was touched off in Arcadia when the 3 Ray brothers were allowed to attend public school.
As far as the fear goes, it's something that a penicillin shot can't fix, let's put it that way.
Tonight, investigators are looking into whether that firestorm of fear may have played a part in what witnesses describe as an arson fire.
It sounded to me like some glass breaking, like someone threw a beer bottle at me. And I says to my wife, oh my God, someone got to poor Ray's house.
Today, there was new anger in Arcadia, anger directed at whoever may have started the fire.
It's stupid. It's terrible. Picking on people, they had enough of stuff on them.
While most residents expressed shock over the apparent firebombing, others said they expected something like this to happen, that the Rays were asking for trouble.
This don't surprise me at all. I either suspected this or a lot worse.
The Rays will stay with relatives. They have been driven out of town by a fear they will no longer fight. The Rays say the fire destroyed nearly all their possessions, including their children's toys.
First thing my youngest boy said is Mr. Monkey. I said, Mr. Monkey's gone. And
Peter Van Sant, CBS News, Arcadia, Florida.
Deputies patrolled the grounds as 3 brothers enrolled in an elementary school. Police were there because of what happened the last time the boys tried to go to school.
As Victoria Corderi explains, their family, school, and community face what may become a more common dilemma in this country.
A new school day in a new town for Ricky, Robert, and Randy Ray. The three brothers are hemophiliacs who have been exposed to the AIDS virus, and the entire Ray family has been exposed to AIDS hysteria that has upended their lives. But today, the Rays are optimistic.
They're doing real well. They're still a little gun shy of school because of what's happened.
The Rays were driven out of nearby Arcadia after their house was torched. Their efforts to keep their kids in school were met by bomb and death threats, boycotts, and finally arson. They left the place many called the town without pity.
One of the reasons the Rays chose the Sarasota School District is because it has allowed 2 other children with the AIDS virus to attend school. But the Arcadia protesters may follow them here.
The group that led the protest against the Rays in Arcadia has organized into Concerned Citizens Against AIDS in Schools and is trying to go national, planning a rally in Sarasota tonight. The Rays say they aren't frightened.
What they got to say doesn't concern me any longer.
Attendance at the Sarasota Elementary School was down 20% today. Worried parents met last night to get more information from the school system. This woman withdrew both her children.
So what happens if that kid gets sick on the bus and throws up on my child?
But most seem sympathetic.
I think a lot of people felt sorry for him, so when they came here, they felt for him. No one should ever have to go through what they've gone through.
The school system has been holding informational meetings to dispel fears about the Rays and other children like them. Their hope is that while the Ray brothers get a basic education, the community will learn the lessons of compassion. Victoria Corderi, CBS News, Sarasota.
In the war against AIDS, the drug AZT was a breakthrough that made headlines and gave hope. AZT is the only drug known to buy precious time for AIDS victims. But as consumer correspondent Erin Moriarty tells us, that time costs money, a great deal of money.
Kenny Taub has had AIDS for more than 2 years, but he's well enough to volunteer at a New York AIDS shelter. The reason? The life-sustaining drug AZT, marketed under the brand name Retrovir. Not a cure, but time in a bottle, adding months, perhaps years, to the life of an AIDS victim.
If it was not in front of me and I was not able to take it, I don't know what I would do.
But some AIDS victims may do without, because time in a bottle doesn't come cheap.
Some of them are paying $700 and change a month. Some of them are paying $800 and change a month. Some of them are paying $900. Some are being asked to pay $1,100. This is for 1 month.
What you pay for AZT depends where you buy it. As with any other drug, pharmacists are free to add dispensing fees. A recent survey in New York, the state with the highest number of AIDS cases, found the price of a month's supply of AZT ranged from $700 to $1,300.
Some of the fellows that ran out of money were cutting the dose down from 2 every 4 hours to 1 every 4 hours. Some of them were skipping days.
Consumer groups call it price gouging, but they don't just blame the pharmacists. The buck may stop here, but the high price starts elsewhere. AZT is produced by Burroughs Wellcome, a subsidiary of a British company. Its wholesale price of almost $700 for 1 month's supply makes it one of the most expensive drugs on the market. How much it actually costs to produce the drug, Burroughs won't reveal. But one estimate is that less than 1/3 of the price reflects actual cost of production. The rest goes to cost of development, research on new drugs, and profit.
It might look somewhat immoral or amoral for a company to be admitting that clearly and that publicly, that it makes money out of saving lives.
But drug companies do make money, lots of it. In fact, while profits of most businesses average a little under 4 cents for every dollar sold, the pharmaceutical industry averages profits of 14.5 cents for every dollar sold. And while prices for most consumer goods have risen less than 3% in the past 2 years, prescription prices have increased 4 times that, more than 12%.
One has to remember that drug companies aren't philanthropic institutions. They are in business to remain in business.
When they decide to price their drug beyond the reach of people who need it, then it seems to me that society's got to raise a great deal of concern and figure out some way to get around this.
But what, if anything, Congress can do about the high price of life-saving drugs is a big question. It's up against a strong drug lobby, a lobby that's well-financed, again, by drug sales profits, and a lobby that argues that if you take away those profits, you also take away precious dollars for research to develop new medicines like AZT. And those are medications that save lives. It's a dilemma.
It is a dilemma. I mean, granted that the drug is expensive, but aren't insurance companies picking part or all of the tab?
Yes, but the problem is, like, the blues require you to come up with the money first, and then they pay you back, and that can take months, and people don't have that kind of money. Other insurance companies make you take a form and have it signed by your employer. So how long are you going to be working when they see you're getting AZT?
That's true. All right. Okay, thank you, Erin Moriarty. CBS Morning News continues. It is 16 past the hour.
They don't often say it, but a lot of scientists around the world have been watching the spread of AIDS in Central Africa with a mixture of horror and fascination. Horror because of the sheer numbers of infected. Fascination because the region is a kind of human laboratory for studying heterosexual transmissions. The fact is, among African heterosexuals, the disease is spreading much more rapidly than among heterosexuals in the West. At the same time, Central African countries like Uganda look back at the West with embarrassment and anger. They're embarrassed by talk of African promiscuity, and they're angry when outspoken scientists like Dr. Robert Gallo of the National Cancer Institute say that while no one can prove where AIDS began, and isolated cases do appear early in the West, all the scientific signposts still lead to an origin in Africa.
But if the monkeys in parts of Central Africa harbor retroviruses of a great variety, and they do, and if some of them are like the human leukemia virus, and there are, and if some are like the human AIDS virus, and they are, and if monkeys, when they're caught, sometimes bite, and I think they do, then doesn't that make reasonable sense that that's the best bet until someone comes up with a better idea?
But Louis Ochero, head of AIDS education for Uganda, gets angry when people say AIDS started in Africa.
We don't practice it.
He says if anyone's to blame, it's Western homosexuals and drug addicts.
We don't have homosexuals and drug addicts. We don't have them. So this disease must be foreign.
But it's not a homosexual virus. I mean, that's the crazy business, you know. I don't know where it originated for sure. If I'm asked where I think it originated in Central Africa, somewhere around the region of Lake Victoria. I think that's as close as one can get.
This is the region Dr. Gallo is talking about, the heart of the AIDS epidemic in Africa, the Lake region where Uganda, Zaire, Rwanda meet. When you go there, for instance, to the Ugandan province of Rakai, in house after house you find someone dying of AIDS. Florence, a well-educated secretary, the 47-year-old mother of 11 children. Her husband gave her AIDS before he died of it a year ago. Millie, age 21, who is embarrassed at our questions because Ugandans don't believe you should talk about sexual diseases, or for that matter, sex at all.
Do you know why you are sick?
No.
On and off cough, some chest pain.
And there is Francis, a young soldier whose medical record clearly identifies the AIDS virus, called the HIV virus, even though he kept insisting he just had a cold.
Blood HIV.
And then there was this man, who was too sick even to give us his name. This scene may well be a dark vision of the future for all of Uganda. It was just a few years ago that the disease was first noticed in this province. Slim disease, they called it, the disease that makes you thin. And at first, everyone thought that it would stay here. But the disease didn't stop in the province as it traveled this road toward the capital city, because this is the highway used by the truck drivers. John Nsambo is bringing coffee back from the region around the lake, the neighboring countries of Zaire and Burundi. The AIDS virus may well be part of his cargo. And his trip up the highway tells a lot about the way the disease began to spread. As he heads toward the city, he stops at 4 or 5 truck stops along the way. At every truck stop, the women are waiting. By now, as many as 76% of them are infected with the virus. Some of them are ordinary prostitutes, one-night stands. Others are what Ugandans call temporary wives, a woman supported by several regular customers who drop by before heading home to the principal wife. Here and in the rest of Africa, AIDS is a completely heterosexual disease. Men and women pass it back and forth much more easily than in the West. And scientists have several theories why.
There seems to be parts of Central Africa where the rates of going to prostitutes have been very high, higher than what we are accustomed to seeing in the vast majority of our society. It is not just the very numbers of sexual partners, let me give something that complicates it greatly. It is also the presence of venereal disease of other kinds.
Gonorrhea. So a man who has venereal disease and an AIDS virus in Africa is a more dangerous weapon?
I think so. I think if the man has the AIDS virus and has active venereal disease, he is more likely to transmit the virus to anyone he has a sexual encounter with, woman or man.
Whatever the reason, it took only 2 years for AIDS to make its way up the highway from Lake Victoria into the capital city, Kampala. It moved with lightning speed through the suburbs, the workers, the housewives, still affecting men and women equally. Moving straight on to the city's educated professionals, what Ugandans call their Mercedes-Benz set. Some studies show that in parts of the city, 20% of the young people are already infected. And at the current rate, all of them will be infected in just 10 years. What does that mean to the future of Uganda if this disease is concentrating among the professional people?
Well, it is a disaster. It will mean that young people from the age of about 18 to 40, the breadwinners, the well-to-do, will die off.
So you could lose an entire generation?
We could, yes. We could lose the entire generation unless something drastically is done about it. These are very nice. They are very nice.
What Ochero does is make a kind of pilgrimage through the cities. Here, the outskirts of Entebbe, talking about AIDS or slim disease, and in the process, earning himself a national nickname, Dr. Condom.
Please.
He's been getting his condoms from the United States for free. Every few months, the U.S. sends in another plane load. He tries to hand them out in the bars and hotels, along with his pamphlet urging Ugandans to love carefully.
No medicine for slim. This is the only medicine. Keep this well, take to your husband. Mwamwami. You put it on, even if you are very big and very long, it will fit. Now, after you have used it, you use it only one safari for one, not 2, not 3, not 10.
His little speeches are greeted with giggles from those who pay attention. Problem is, few Africans have ever seen condoms before, and not many of the people who take them will ever use them. It's clear that the doctors who man the rundown state hospitals are dealing with a reality most Ugandans have yet to grasp. At the main hospital in Kampala, they are receiving about 4 new AIDS patients a day. Patients sleep on beds that have no sheets, or on the floor when they run out of beds. While American hospitals worry about the thousands, the millions of dollars they'll spend treating AIDS, here at Malago they worry about enough money to buy rubber gloves for the health workers, or a few disposable needles. Here, when they give a man or woman a blood test for AIDS at $1.75, they've just spent the entire per capita health budget for the year. Sister Nellie at the Nsambia St. Francis Hospital has one of Uganda's 5 machines for screening blood to be used in transfusions. just a fraction of the number of machines in New York City alone. The day we were there, she tested blood samples from donors, and the results were 28% positive. But when the donors who tested positive came to get their results, if they looked healthy, they weren't told they were carrying the virus. The doctor said there's no point in giving someone a possible death sentence when you have no counselors to help them deal with the news. Even if it means they spread the disease to others, the doctors say, one cruelty doesn't justify another. Florence saw 10 doctors. No one told her the truth.
They didn't tell you?
No, they didn't. You know, doctor, here, they don't want to tell you the disease.
Why?
I don't know. They said you are going to be worried.
Henry worries too. He's from Rakai and he's been ill for months. It was an 8-hour ride to get to the doctor. But the doctor Henry is going to see is the witch doctor, who will charge him 5 months of his wages for just one treatment. The doctor and his associate, who is called the professor, begin the treatment with a magical X-ray. They toss some coins and keys and produce an instant diagnosis. They say they can tell from the demons in the dark if the patient has AIDS or slim disease, and that they'll adjust the prescription accordingly. Though when we were there, it was always the same concoction of herbs and roots. You can cure slim?
Yes, please.
Because you know doctors all over the world.
Please. Yes, please.
But you can cure it?
We can. Anyway, we can try. We tried. Now, they're a bit okay. We tried.
Are you worried about slim?
I'm very careful.
And before slim, how many women?
I had a lot of girls out throughout Uganda, because I used to walk throughout Uganda.
So you would have many women, what?
Yes, I had.
10, 20?
More than that, I think.
Oh, more than that. 50?
I can't tell, but I had a lot of them, very many of them.
Have you heard about...
So Uganda must try to change sexual habits quickly, but how? At the remote health center in Rakai, you can hear the health workers use the same words you hear in every clinic in the United States. While outside, the man who couldn't give us his name collapses. He's walked hours to get help. He has all the symptoms of AIDS, several months of diarrhea, stomach pains, and a fever. But the clinic has nothing to give him, not even aspirin. So there's nothing to do but walk back home.
This disease, whether you have money or you have no money, at present as it is, there's no way out. There's no way out. I'm losing my weight all the time. I see I have no blood.
No blood?
Can't survive.
You can't survive? What do your children say to you?
They are very worried. Said, Mommy, you are going to die also. Like father.
They're afraid you're going to die like their father?
Yes.
What do you say to them?
Just pray. I just say to them, pray for me.
Not long after she spoke with us, Florence died.
Potentially important story about the deadly disease AIDS. It involves a mystery that may become a hope. Some tests raise the possibility, repeat that word possibility, that some people, it turns out, may have a natural ability to rid themselves of the AIDS virus. CBS News medical correspondent Susan Spencer has the story.
The longer someone is infected with the AIDS virus, the more likely that person is to actually get the disease, and no one is known ever to have recovered. Therefore, the interest in a bizarre discovery at Johns Hopkins that 3 gay men in a study group of 5,000 who had tested positive now test negative for infection.
The tests were quite accurate, and in fact, we ruled out the possibility of laboratory mix-up. So it's not a laboratory error, and the test is a very sensitive and a specific test.
The 3 patients in question are part of a 4-city study designed to chart the progress of the disease. Participants are tested every 6 months. The question, could these unexpected results turn current ideas about AIDS upside down? Could it mean that there are some very few people whose bodies can beat the AIDS infection naturally? That might not mean much to the average patient right now, but such a finding could give AIDS researchers new avenues to explore.
If there are such individuals, one can at least speculate that we would be able to study such people and ask what makes their immune system different than other individuals.
Johns Hopkins spokesman stressed that this study is by no means complete. They will be keeping very close tabs on their 3-star patients in hopes that these early results will hold up. Susan Spencer, CBS News, Washington.
Clifford and Louise Ray and their children used to live in Arcadia, Florida. This summer they were driven out of town by fear. Their boys are hemophiliacs who have AIDS antibodies in their blood. They're just 3 all-American boys, so vigorous it's hard to believe they carry the AIDS virus, so innocent, but targets of such hate.
I'm going to tell them all that my son is not going to go to school.
Just over a year ago, Clifford and Louise Ray were told their 3 boys had tested positive for AIDS. Like many hemophiliacs, they'd been exposed to the virus through the clotting factor used in their treatments. At first, the Rays agreed to keep the boys temporarily at home, away from school. But when they wanted them to go back, the town of Arcadia wouldn't let them. The Rays sued and won.
There's no medical reason why they shouldn't be in school. They should have the right to attend school and be like any other child.
The day the boys returned to school, nearly half the parents kept their children out of classes. There were rallies, bomb threats, and after 5 days of school, the Rays' house was burned down. No one was hurt, but they lost nearly every possession they had, and they finally decided they had enough of Arcadia. The Rays live in Sarasota now. The boys attend the local public school, and there have been few signs of protest. Only 8 kids have been pulled out of a school of 600.
The majority of parents have been very receptive and accepting of the children being here.
The Rays are still bitter. They're still afraid. And they're still trying hard to understand.
You know, I wouldn't want another parent to have to go through what I'm going through. I wouldn't want another parent to worry about losing a child. They're just too precious. But what they have, they can't give to anyone. I mean, my husband, my daughter, and I are living proof of that.
Cliff and Louise Ray and their sons Ricky, Robert, and Randy, and also their daughter Candy join us from Sarasota, Florida this morning. Good morning. Louise,
Good morning.
Ricky, you are the only ones who we mic'd up for this. If you could speak on behalf of the entire family for us.
Okay.
Louise, are you happier there now? What's different about that community of Sarasota?
Everything, to be honest. The people here have been really receptive. The school here has worked with us and helped us to make the transition a better one. The community here just recently, in fact, Monday night, had a benefit for the AIDS support group here, which was really nice. And it's just nice to see a community band together and try to help.
What makes one community more compassionate than another?
Well, I really don't think that it's compassion. I think the problem is education and leadership. The leadership here in Sarasota has been really great. The superintendent, the mayor, everyone has stepped in, and they're helping to try to educate the public rather than to be afraid themselves. What they've tried to do is to learn, and then now they're trying to teach others, and I think that's the big difference.
Are they consulting you on ways to educate people, some of the misconceptions about the disease?
Not really, because they have been educated. Our Dr. Magenheim, who is head of the health department here, is really great. In fact, he's taught me and my family a lot. And so he works real closely with them, and they've taught the community here.
Okay, Ricky, is it easier for you and your two brothers? Are you happier there in Sarasota?
Yeah.
What's the difference?
We got more friends, and there ain't nobody that comes around and picks on you, hits you in the stomach.
No one has assaulted you at all? Talk back to you?
Nope. Mm-mm.
Do you find that sometimes you have to explain to your friends what you have?
Yeah.
What do you tell them?
I just tell them I ain't got the disease. I just carry it.
Can your peers, 10, 9 years old, can they understand that? The difference?
It depends.
What do you tell them? Do you tell them you should go learn that kind of information? That you don't carry, you don't have AIDS, you just carry the virus?
No, I tell them that we don't have the AIDS, but we do carry it. And the only way we haven't got it is because the T cell is fighting it.
What are some of your brother's complaints? What's happening in their lives?
I don't know, really.
Yeah, Louise, there must be great fear and trepidation for you that you feel that you have to keep all your children very healthy. Are you afraid of colds?
No, to be honest, I'm not. You know, any mother doesn't want their child to get sick, and I think that if you just use, you know, precautions such as jackets and shoes and, you know, normal things that a good mother would do, I won't have to worry about that.
All right. Ricky, and all of you, Louisa, Cliff, thank you so much, all of you, the Ray family from Sarasota, Florida.
Thank you.
Thank you.
It's 14 minutes after the hour.
Examined and debated. Today, President Reagan's AIDS Commission finally handed in its first report. At the same time, the National Centers for Disease Control released the latest statistics, saying that as of Monday, almost 27,000 Americans have died of the killer disease. An interesting note, the CDC said white homosexual males are not getting AIDS as rapidly as before. But it was the AIDS Commission report that drew attention today, and medical correspondent Susan Spencer has details.
Determined to prove its act is at long last together, the President's Commission on AIDS issued its preliminary report 5 days early, an outline of what the Commission now is going to do.
As we're going to identify for you, Mr. President, obstacles to progress in prevention, care, and cure of this infectious disease.
Watkins said the Commission will speed up its work, hold extensive hearings, and report in February on 4 very basic questions. How many people are actually infected? How can the healthcare system possibly cope? What can be done to speed up drug development? And how should the growing problem of AIDS among IV drug users be attacked?
My feeling is that this Commission must take a stand. And I make this statement to the President. We will not shy away from these controversial issues.
But with the resignation of its first chairman, the lack of expertise and unorthodox views of some members, one wondered if toilet seats perhaps did spread AIDS. The Commission itself has been the source of controversy. On recent tours of AIDS facilities, the new chairman has insisted those days of turmoil are over, and people on the front lines of the AIDS fight certainly hope so.
What I think we're seeing is that the Commission is beginning to reach the level of understanding of this issue that they should have had when they started off.
If the report reports the obvious, then this will be an exercise, I think, in futility. If, however, the report acknowledges these problems and then establishes parameters and programs that should be followed to meet these needs to try and bring this epidemic to an end, then I think it will be a successful endeavor.
As it buckles down now, Admiral Watkins said the Commission also will focus on this country's apprehension and fear of AIDS, perhaps the biggest obstacles to forming a true national policy. Susan Spencer, CBS News, San Diego.
A study published today found that 9 of 10 AIDS tests performed in one major hospital were inappropriately administered, wrongly interpreted, or done without permission and counseling. Researchers said that may be typical of many medical centers. The report in the Journal of the American Medical Association covered testing at the St. Paul Ramsey Medical Center in Minnesota in 1985 and 86. A spokesman said guidelines have since been tightened at that hospital. But it is even harder to administer guidelines for AIDS testing outside a hospital. And CBS News medical correspondent Susan Spencer has been looking into what that may mean these days.
The private Stop AIDS Foundation in San Francisco offers AIDS tests faster than you can get your dry cleaning.
Well, if you come in before 2 o'clock, we'll give you an answer at 6:30. I mean, you can't get faster than that. That's the fastest service in the country.
Not bad when compared to the weeks it often takes at public sites. Not surprising, then, that some 200 private centers have sprung up around the country. An AIDS-free certificate, an added attraction at some.
I'm quickly telling the vast 95% or more that they're negative quickly.
But critics worry about the other 5%. The charges: many private centers do not provide adequate counseling, give people results by mail, do slipshod work, and sometimes fail to do the necessary second test to be absolutely sure that someone is positive. One company even offers testing by mail.
And they're essentially saying, okay, fine, we'll take your tests, we'll take your money, we won't give you the tools you need to interpret the test and to cope with your results. That is potentially devastating.
Especially if the results are wrong. Gerard Brogan, a healthcare worker from England, got a test at this San Francisco center. He will never forget his thoughts when he was told over the phone that it was positive.
How long have I got? You know, I've got AIDS. Does my wife have AIDS? Does my child have AIDS?
But though Brogan's first test was positive, a second didn't confirm it. A fact he learned only when he took his wife in and accidentally saw his own chart over the technician's shoulder.
He was, oh my God, you're not positive, you're negative.
Many AIDS experts worry that there will be thousands of Gerard Brogans as more and more people are tested. Not only because clinics can be sloppy, but also because independent labs have been shown to have alarming error rates. A recent government study found that in a high-risk population, gays and drug users, the labs will miss 1 in 10 people who are infected. But in the general population, 9 of 10 people identified as infected will not be.
The impact can be as severe as causing people to commit suicide because they see a positive test as equal to AIDS, as equal to death.
To ensure that lab mistakes are at a minimum and that clinics provide adequate counseling, many experts want federal regulations for private testing centers. For now, though, there are no restrictions, and the testing business seems to be on a roll.
If you have any doubts, the simplest way is to just get an AIDS test and...
Susan Spencer, CBS News, San Francisco.
Tonight in Los Angeles, Cicely Tyson joins other celebrities in a big send-off for a quilt. Sounds peculiar, but this is a unique quilt. It is made up of 4,000 panels. As you see, this is when it was in Washington, D.C., each commemorating a person who died of AIDS. From Los Angeles, the quilt begins a 4-month, 20-city tour sponsored by the Names Project, a memorial to AIDS victims. And joining us live from Los Angeles is Cicely Tyson. Good morning.
Good morning, Harry.
What prompted you to get involved in the Names Project?
Well, first of all, there but for the grace of God go I. And my interest has always been to help, to support organizations who fund incurable diseases. And this is one.
It seems to me that anymore there aren't too many people in the United States who don't know or know of someone who has died of AIDS. Has AIDS touched your life personally in any way?
Oh, yes, it has. Many, many friends.
Do you think the public right now is as aware of AIDS as it needs to be? Is it educated enough?
I don't think the public is educated enough. I think for the most part we are aware, but there's such a fear there that it's difficult for us to deal with it to the point where we will accept education with regard to AIDS.
Yeah. What are the best kinds of things we can do to alleviate that fear or sort of to take away some of the myths about the disease?
Allow ourselves to be open to the education. I think one of the greatest fears is not knowing the truth. And I think if we allow ourselves to be educated, then it takes away some of the fear. It's easier for us to acknowledge it and to try to do something about it.
Yeah. Let's talk a little bit about what you have been up to of late. When will we next see you on screen?
Oh, hopefully sometime in the latter part of this year, in the fall.
Now, have you? I've been reading about a movie you were shooting. Have you shot already, or the one with Oprah Winfrey and?
Yes, The Women of Brewster Place.
Yes.
Yes, soon to do.
Soon to do. So you haven't
Yes.
shot it yet.
Oh yes.
Oh, it's
yes.
been shot.
Yes.
What was it? What was the production like? What was the working like?
Well, first of all, I think it's going to be a miraculous piece, but I really would like to talk about the benefit and the fundraiser for the National AIDS Quilt that will take place this evening at Pauley Pavilion, UCLA, starting at 7:30. It's an incredible evening of ceremony and performances, which will consist of people like Whoopi Goldberg and Martin Sheen and Richard Dreyfuss and myself and Sally Kirkland, all in an effort to raise funds to help in further research or to aid victims of AIDS.
All right. Cicely Tyson, thank you very much for getting up early this morning out on the West Coast. We do appreciate it, and best wishes and good luck on the benefit.
Thank you so much, Harry.
Thank you. 13 minutes before the hour.
Historic
Next.
document in your mail. It will come from the federal government, and officials say it marks the first time the government has tried to reach every resident directly by mail regarding a public health crisis. As Eric Ingberg reports, the crisis is AIDS.
Rolling off the presses now, the biggest single health education project the government has ever tried. 107 million copies of the booklet Understanding AIDS will be mailed, one to every home in the country.
The household mailing of Understanding AIDS is the closest we can come to making something required reading in every American home.
The 8-page brochure lays out the Surgeon General's AIDS explanations and warnings in blunt language rare for an official document. AIDS is not spread, the book declares, by insect bites, toilet seats, or casual contact. Risky behavior includes sharing drug needles and engaging in some types of sexual practices. For the first time in any federal publication aimed at the public, the book talks about the dangers of anal sex and endorses the use of condoms as the best safeguard short of abstinence.
We felt the time had come when we could make clear, simple, authoritative statements on how AIDS is and is not transmitted.
Although political pressures are building for mandatory AIDS testing, in this booklet, the government for the first time declares that tests are not needed for people who have avoided risky behavior. The reaction from those who work with AIDS, including the gay community, was overwhelmingly positive.
It's balanced, it's informative, it's candid, and I think most important, it's non-alarming.
But one conservative critic of the Surgeon General disputed the government's experts.
You get the impression that none of us have anything to fear from associating with people who have the virus, or who have ARC, or who have AIDS. Nothing could be further from the truth.
Despite this $17 million program, officials know many people will be missed. They are struggling for ways to reach these have-nots: the homeless, transient drug users, people who cannot read. Eric Engberg, CBS News, Washington.
Has been added to presidential politics this year, the politics of AIDS. How best to deal with this devastating disease is an issue both inside and outside the gay and lesbian community, and much more than a medical question. CBS News chief political correspondent Bruce Morton reports tonight on the impact of AIDS on Campaign 88.
It looks like a lot of other political dinners, but this is a gay and lesbian Democratic club, and candidates speak here to its issues.
The war on AIDS must get the highest priority of any domestic issue.
Years ago, a lot of gays avoided politics, feeling maybe if we leave the government alone, it'll leave us alone. AIDS has changed that.
The only institution that we can really look toward to attempt to solve the epidemic is the federal government.
Perhaps 50,000 cases now, 250,000 by the end of the new president's first term. AIDS will make enormous demands on the healthcare system we all use. It is a national, not just a gay issue. Tax dollars will be needed.
Where are those dollars going to come from? Are they going to be new dollars? Are they going to come from other programs? And so, absolutely, it is a political issue.
You want AIDS recess? Vote about it. It's time to vote about it and not just talk about it.
Jesse Jackson is the first choice of most gays here. He marched to the state capitol with them. to the U.S. Capitol with them last fall. He is for more money against any mandatory testing for AIDS.
And I'm very proud of the fact that my state has the best program for AIDS in the country, that it's one of the few states in the country that devotes state funds to research, that it has done more for education and prevention than any state in the country.
Despite these hecklers, most gay leaders say Dukakis's record is good on AIDS. More research, limited mandatory testing. Gays disagree with him on other issues, like giving heterosexual couples preference as foster parents, a disagreement that may help Dukakis with straight voters.
To sit there and say that the way to find an instant answer is to spend more than $1 billion a year and throw it at the problem, I'm not for that.
Gay leaders are most critical of Bush, saying he's more interested in mandatory testing than in searching for a cure.
You'll see in November the gay and lesbian vote going maybe as high as 80 or 90% Democratic for maybe the first time in its history.
Here in California, AIDS is a concern to straight voters, but it has not split them along party lines. It has made gays more politically active, and it seems to have made most of them Democrats. Bruce Morton, CBS News, San Francisco.
1,000 Americans, the price of AIDS has been death. But for those with the disease, even those who don't have the disease but have tested positive for it, the price has been discrimination.
It doesn't feel as though I have it stenciled on my forehead or though I'm wearing a button saying, "Hi, I'm HIV," but you tend to think differently in the way you react to people for fear of how they would react if indeed they knew.
Though he shows no symptoms of AIDS, he tested positive for the AIDS antibody. And when he applied for a job as a pharmacist at the hospital where he took the supposedly confidential test, he was turned down.
That human nature can be, in many instances, so twisted and so hysterical and so phobic.
Hysteria and fear in a small Indiana town forced 15-year-old Ryan White to move to another town to go to school, because he was a hemophiliac with the AIDS virus. In Florida, the Ray family's house was burned down when they tried to send their 3 young sons to school, all of them hemophiliacs, testing HIV positive. But there's an even greater danger from discrimination. Many fear it will drive AIDS victims away from testing into hiding.
If you threaten them with the loss of a job or the loss of medical services, they won't come forward. They won't seek services. They won't seek to be tested. They won't seek the things that the government wants them to seek.
That was the point made recently by the head of the President's Commission on AIDS. Admiral James Watkins said discrimination and fear will slow the hunt for a cure unless the President extends anti-discrimination laws to victims of AIDS.
We'll be beyond the rejection, the denial, and the vilification of others, and we'll get on to a war against the virus rather than groups and people.
But even if people with the AIDS virus are included in federal civil rights laws, the fear of the disease is so great, it's highly unlikely that legislation will prevent the pain of discrimination. Lynn Brown, CBS News, New York.
Managed to close down the Food and Drug Administration today. They accused the agency under President Reagan of wasting time in the war against AIDS. For some of the protesters, time is a precious commodity, as Susan Spencer explains.
Seize control of the FDA! 52 will die today!
Ronald Reagan was hoisted in effigy this morning as hundreds of AIDS activists descended on the Food and Drug Administration, determined to shut it down. The charge that while people are dying, FDA delays. The demand that the FDA speed up approval of drugs that show any promise against AIDS.
I know that there are drugs out there that can save my life, and I want to know why they're not being tested more quickly.
Police, a few wearing rubber gloves, dutifully arrested demonstrators who often waited for the cameras. But behind all the orchestration, the smoke bombs, the broken windows, is simple frustration. An AIDS bill providing millions for drug development sits stalled in Congress. 8 years into the epidemic, only AZT is licensed for use against AIDS. The government's promised quick release of experimental drugs hasn't happened.
I'm here fighting for my life because I don't have 8 to 10 years to wait for the FDA to approve each new drug.
You think they're doing all they can? They're not. They're sitting on drugs that can save people's lives.
In a written statement, the FDA disputed that, saying AIDS has been given top priority, and adding, the unfortunate fact is that there are no candidates to directly treat the AIDS virus pending before the agency. Doctors who treat AIDS patients also insist that no one is holding back anything worthwhile.
People don't need to be fighting against the FDA. The FDA, the NIH, these are our friends, not the enemy.
None of that, of course, is very comforting to people who have AIDS, who are quite convinced that, in fact, much more can be done, and determined to see to it that in the next administration, it will be. Susan Spencer, CBS News, Rockville, Maryland.
Billionaire real estate developers next month. One of the more than 24 public issues they'll be facing on the ballot is an issue that's been sparking controversy nationwide: AIDS and how to stop the spread of it. John Blackstone reports on this latest clash between the rights of individuals and the overall society's needs and fears.
There's a familiar, if somewhat changed face igniting controversy in California this political season.
Hello, Paul Gann here.
He's Paul Gann, who a decade ago with Howard Jarvis won victory for a tax-cutting revolution, California's Proposition 13. Gann chose to fight taxes, but this new issue was thrust upon him.
I'm here to start what may become the last campaign of my life. My doctor tells me that I have contracted AIDS.
Gann was infected with the AIDS virus through a blood transfusion during heart surgery in 1982. To some, his new campaign that has wide support in California amounts to a declaration of war on homosexuals.
I am not fighting a lifestyle. I wouldn't care if it was my church Sunday school choir. If they were putting out a virus that killed people, I'd do my best to nail the church up and keep them inside, believe me.
I don't believe the people here are dumb enough to vote for it. If it passes in California, something like it will spring up all across the country.
But opinion polls show Gann may well have enough support to win. His Proposition 102 would require that anyone even suspected of carrying the AIDS virus be reported to public health authorities. All anonymous testing for the virus would end. Critics say this would only drive the disease back underground.
If you can't go for anonymous testing, I think a lot of people, myself included, are not going to be tested.
I won't put my insurance on the line or my job or my apartment. I won't.
These evil measures must be defeated.
From pulpits to public health offices, opponents say Gann's proposition would dismantle everything that's been done to stop the spread of AIDS.
The rate of new infections is practically zero. You can't do better than that.
Even as people with AIDS grow more vocal in their demands for help, national surveys show a growing hostility toward them.
Who has a right in America under the Constitution of the United States to kill me? Yeah, nobody.
Paul Gann has turned his hostility and his influence against those who may best understand his suffering. John Blackstone, CBS News, Sacramento.
Activists are saying that thousands of AIDS patients could benefit by an expected government decision to approve widespread distribution of a still experimental drug. Correspondent John Blackstone has our report.
An unapproved drug that Robert Money and thousands of other people with AIDS have been taking for more than a year is about to be approved by the FDA.
I've been taking it for 2 years, and it's been keeping me alive, literally.
The FDA is bending its own rules to speed up approval of aerosol pentamidine. That action will come next week. Pentamidine is used to treat pneumocystis, a form of pneumonia that was rare until AIDS became widespread.
It's the most common life-threatening illness that AIDS patients get, and a lot of people do die from it.
For more than a year, pentamidine has been one of the most popular underground AIDS drugs.
It's given me hope, knowing that I don't have to wake up wondering whether every little cough might be my developing pneumocystis pneumonia, which is such a devastating illness.
Pentamidine is so widely used that it became impossible to conduct the usual trials in which some patients are given a placebo. In some ways, the FDA approval next week will simply recognize what has already become fact in much of the country.
It's nothing new to San Francisco doctors, but to somebody in Omaha, Nebraska, or somebody in Peoria, Illinois, it would mean that those people, the HIV-positive individuals in that particular area, will be able to avail themselves of pentamidine, and it's wonderful.
With its approval of pentamidine, the FDA is keeping a promise it made last year to people with AIDS. It pledged to cut bureaucratic delay for drugs that could help those who don't have time to wait. John Blackstone, CBS News, San Francisco.
New predictions tonight about the killer disease, AIDS. CBS News medical correspondent Susan Spencer is covering this week's International AIDS Conference in Montreal.
About 100 AIDS activists crashed this afternoon's opening session, delaying the start of the conference with shouted demands that the world pay more attention to the AIDS epidemic. The urgency was communicated as well by shocking new estimates that AIDS cases will double in the next 2 years to over 1 million worldwide.
There may be as many as 9 times more AIDS cases emerging during the 1990s than emerged during the 1980s.
A special film shown at opening ceremonies zeroes in on the crisis ahead through the voices of the young.
The only thing we have to do is to be responsible. But when you're young, you know, it's easy to forget.
With education still the key, there will be much analysis here of what does and what doesn't work to control the virus, which is moving now in new directions.
What we're seeing then is a faster transition away from a predominant male disease to a more equal male-to-female distribution in some of these countries.
In Africa, AIDS always has affected men and women equally, but new studies show Brazil and parts of Latin America beginning to see the same thing.
The virus is ahead of us. It had a head start. It spread for almost a decade before we even knew it existed. And therefore, in a sense, we're playing catch-up.
This is the first conference to concentrate on the social as well as the medical side of AIDS, on its political and economic costs. Crucial consideration since no medical breakthrough is expected anytime soon. Susan Spencer, CBS News, Montreal.
Civil rights. The brushfire sweep of AIDS through New York's drug users, minorities, and the poor may be important for other cities and other nations. That was the projection today at the 5th Annual International AIDS Conference in Montreal. CBS News medical correspondent Susan Spencer reports.
AIDS activists again heckled during this morning's session, one shouting in frustration what many doctors here already know.
You get sick in New York, you can't get into a hospital.
With new projections that the number of AIDS cases will double in the next 2 years, there is near panic among experts who already see hospitals pushed to the limit. The problem especially acute in California and New York.
There is going to come a critical point, and it's arriving at that now, where there will not be an available bed in the city of New York, and you will have people waiting online to get into those beds.
Stephen is a writer and an AIDS patient in the hospital for the first time.
I've seen people in hospitals be sent out onto the street saying everything's fine, and it wasn't.
What worries this conference is that what's happening in New York and California probably is a sign of things to come. Ironically, the crisis stems in part from medical progress. Patients today live much longer than they once did. But the treatments that keep them alive are expensive, and many have no insurance. Hospitals pick up the tab.
We are going to have more problems in the years ahead as patients survive longer and come into the hospital over and over and over again.
Also threatening the system, the growing number of AIDS cases among drug users in poor health to begin with.
Up until now, we've enjoyed a great amount of community support. I don't know if we're going to have the same community support with the intravenous drug users.
There will be much searching here for alternatives to hospitals, hospices, home and long-term care, anything to guarantee that as AIDS increases, compassion will not take a back seat to the bottom line. Susan Spencer, CBS News, Montreal.
AIDS outbreak, the question of testing has been troublesome. Balancing the promise of more effective treatment with an early diagnosis are the twin threats of despair and discrimination. And today, new proposals about testing commanded stage center at the International AIDS Conference in Montreal. CBS News medical correspondent Susan Spencer is there.
AIDS activists marched outside the hall this afternoon, demonstrating against what they see as a new threat, changes in policy on AIDS testing.
Treatment, not tracing. Treatment, not tracing.
There have been suggestions at this conference that it soon will make sense to take names, to aggressively follow sexual partners. Because today, knowing one is infected, sometimes even before there are symptoms, really can matter.
The doom and gloom if you're HIV infected, that there's nothing you can do anyway, so what's the difference, is something of the past.
On a practical level, we've doubled the life
lifespan of people with AIDS.
AZT has been the most important drug to prolong life, but approval is expected soon of another, pentamidine, helpful in warding off AIDS-related pneumonia. Early treatments that improve survival have prompted some groups, once uneasy about testing, now to promote it, but only if it's voluntary and anonymous.
I think there is more medical evidence that favors testing, and the irony is that there is still that presence of discrimination.
The decision to be tested is a very personal and a very individual decision, and it should not be altered in any way by even the possibility of treatment or a cure.
But as treatments improve, some doctors see questions about how to test and who should be tested getting much tougher.
Given the choice of losing one's confidentiality and preventing disease, most people would choose to prevent disease.
People with AIDS say they resent spending time fighting off new ideas about testing when the real battle should be figuring out how to pay for all these expensive treatments for everyone who needs them. Susan Spencer, CBS News, Montreal.
An announcement yesterday that the drug AZT may soon make AIDS a treatable disease was an encouraging development, to be sure. But the recommendation that people at risk arrange to be tested immediately also presents something of a dilemma. Richard Roth has our report.
The government's call for wider AIDS testing could help hundreds of thousands of people, but it's also reignited a controversy.
The irony is that by taking the test in order to gain access to better health care, people can, as a result, lose access to health care because they lose their insurance or because doctors or nurses are afraid to deal with them.
Just this week, New York City's largest private group providing AIDS counseling reversed its policy and endorsed widespread voluntary testing for the AIDS virus. But government and private AIDS experts are still at odds over two key issues surrounding the simple blood test for the virus. Who will know the results, and what happens to those who test positive? Nathaniel Peer is a Manhattan physician with a large AIDS practice who says the medical care system for AIDS patients is already crumbling, a shortage of beds and personnel and money.
We don't see anybody from the Bush administration saying, let's provide these services, the funds for these services.
Public health officials say they need to know who has AIDS in order to track down others who may have been exposed. But AIDS sufferers worry that compromises their privacy.
What happens if I did get registered with the state after testing positive, and politicians in the future decide to use that list for some other purpose?
For example, insurance is already difficult to find for anyone considered at risk of developing AIDS, though insurers say that's simply the way the system works.
What you're dealing with here is an applicant asking for health insurance after the onset of a near-fatal disease. And insurance companies have never done that.
Nor until the FDA approves it will many insurance policies pay for the AZT hailed yesterday by the government. And the FDA won't say how long its approval process may take. Richard Roth, CBS News,
That's
New
been
York.
troubling AIDS researchers since the onset of that deadly disease. CBS News medical correspondent Susan Spencer reports on what one scientist calls the most significant advance in the vaccine field since we started the AIDS vaccine program. Susan Spencer reports.
In a development that dramatically boosts the possibilities for a human AIDS vaccine, researchers today announced that they have successfully inoculated monkeys against a type of AIDS.
We've answered the question, can you immunize against AIDS? And it appears that the answer is yes.
Now we have the foundation upon which to build a vaccine safe enough for humans.
The model vaccine, made by injecting inactive virus, protected the monkeys from simian AIDS, a close relative of the disease that affects people. 9 monkeys were vaccinated, then exposed to AIDS. Months later, 8 still are not infected. The other shows signs of infection, but is not sick.
As a matter of fact, I'm seeing extremely healthy-looking animals. This gives us something to compare to.
By contrast, the monkeys who were exposed to AIDS but not vaccinated all got sick or died.
It's established the fact that you can protect someone, be it an animal, and hopefully a man, from infection by immunizing them.
But going from monkey to man is a big leap. Unlike the monkeys, people can't be exposed to AIDS just to test a vaccine. Researchers would have to vaccinate large numbers and then wait years to see if anyone came down with AIDS.
If we're lucky, and we do develop the vaccine, it'll be well into the mid-90s that we have one available.
Given the difficulties, an AIDS vaccine might first be used as a treatment to protect people who are already infected from becoming sick. Today's results are the strongest indication so far that even that is possible. Susan Spencer, CBS News, Washington.
Doctors in death in a New York courtroom today. In her first full day of testimony, a 32-year-old physician pitted herself against other doctors and the hospital where she worked. Her lawyers called the case, quote, a nightmare that will end with her death. But as Richard Threlkeld reports, this trial's effects may be immediate and lasting.
Dr. Veronica Prego is sick, deathly sick. She's dying of AIDS, contracted 7 years ago when she accidentally pricked her finger with an AIDS-infected needle. She says the New York City hospital where she worked was negligent in disposing of its AIDS-contaminated waste, and she's suing for $175 million.
I realized that there was a very good chance that I was going to die. And I asked a friend that speaks Spanish to grow my mouth.
The hospital insists Dr. Prego is at fault because she was careless. What's happened to Dr. Prego is the nightmare for each of the 6.5 million healthcare workers in this country. The Centers for Disease Control have found just 19 cases where health workers have contracted AIDS on the job, but admit that number could be low. Hospitals maintain they are following CDC guidelines in trying to protect their employees, but the guidelines are 8 years old, and critics say it's not protection enough. Dr. Lorraine Day, for example, routinely wears a spacesuit in the operating room. She's been crusading to warn health workers about the risks of AIDS infection. After 15 years at San Francisco General Hospital, she's quitting because she's afraid.
The government is spending hundreds of millions of dollars developing treatments for AIDS patients, and that's very good. But they're not spending one single dime to develop equipment to protect healthcare workers.
And what about the patients, people with AIDS who are already squeezed in a system that is financially restricted? And there's concern that the Prego case won't make getting care any easier.
Doctors will be nervous about getting infected. Hospitals will be nervous about getting sued if their doctors or other workers do get infected. So it means that we don't get the care that we need.
Is there an acceptable risk for those who treat AIDS patients? And if so, what is it? Daunting questions for any jury to decide. The answers, whatever they are, will be Dr. Veronica Prego's legacy. Richard Threlkeld, CBS News.
A black tie benefit in Los Angeles on July 8th will help children with AIDS and other serious illnesses. Athletes and Entertainers for Kids is sponsoring this event. And to talk about it, joining us live from Los Angeles is a young actress very involved in the organization, Drew Barrymore. And from Indianapolis, Indiana this morning, Ryan White, who was at the center of a national controversy back in 1985 when a public school refused to admit him because he has AIDS. Ryan, Drew, good morning.
Morning.
Ryan, I haven't seen you in about a year. You've lived in, was it Cicero, Indiana now for a year since moving out of Kokomo. How's your new house? How's the new home?
Well, it's going really good. Everything seems to be doing really nice.
And you've gained some weight, haven't you?
Yeah, I've gained about 10 pounds.
How much treatment are you going through now?
Well, I'm getting contaminating twice a month and gamma globulin once a month, and I'm still on AZT.
Are you exercising? You look terrific. Obviously, you're eating more.
Oh, yeah, I'm eating a lot more, but I'm not really exercising.
And are you that worried about getting, any kind of cold or any... I remember before, about 2 years ago, you were contracting colds and sore throats and had some hearing problems. Is that all better?
Yeah, I'm doing really great now.
Oh, that's terrific. Drew?
Yeah?
How important is it for young adults to understand, you're still, you're 16 and you've just gone through a phase in the past 2 years where AIDS came to the forefront. How important is it for young people to know the cause of AIDS and how it's transmitted?
Well, a lot of my friends and I talk about it a lot, like in psychology class and just outside of school. And I think that people are really becoming aware of what's going on and that they're caring a lot more about it and trying to learn more about it so we can do something about it.
Ryan, do you feel in your new town that younger people are much more informed about AIDS?
Yeah, I think in our town it's really hit it because they were aware that I was coming to their school and they educate everyone ahead of time. And I think that, you know, they had questions and I think their questions were finally answered.
Well, what are some other questions that you get most, Ryan?
Well, mostly how you can and can't get it, and, you know, is it okay to talk with somebody who has it or sit next to someone who has it?
And, Drew, what do you think is the most frightening thing about AIDS?
Probably being pushed aside from other people. That would be the scariest thing for me, because nobody should be treated differently that has this, because they're just as equal as everyone else. And, you know, that's the way I feel.
Entertainers and actors like you, Drew, get behind an issue like AIDS. Ryan, does it really help when there is a celebrity cause behind an event like this? Does it draw attention?
Yeah, I think it does, because it shows that somebody, you know, that everybody knows is really getting involved with this, and maybe they should too.
Drew, how did you get involved with this organization?
Well, my friend Marley Matlin is involved with the cause, and she asked me if I would be a part of it, and I said, of course I would.
Well, I think that a couple of years ago, Ryan, Elton John, I mean, kind of took you under his wing, if that's possible. Do you still see Elton John at all? Oh, I think we've just lost. Ryan can't hear me. We were having some audio problems earlier, right before we went on, and obviously he can't hear me again. Drew, what are some of the celebrities that are going to be involved in the event at the beginning of next month?
Excuse me?
Oh, are you having problems too?
Not really.
Oh, no. Tell me about the event. Who are the celebrities who are probably going to be coming out?
Marley Matlin, Charlie Sheen, Elton John, and a whole bunch more people, but I'm not really sure of who.
Now, does it benefit children's awareness? It helps spread the word to young adults? Is that the purpose of the event?
I think it's going to spread the word to everyone, and I think that's why this cause is so important, because everyone should be educated through all ages.
All right. Well, Drew Barrymore, thank you so much for joining us this morning. Ryan, it's great to see you. I hear that you are working at a skateboard shop this summer in Indianapolis.
Yeah.
Well, that's
yeah,
terrific.
Maui Surfing Sport.
That's great. Thanks, Ryan. Drew, thank you. 5 before
Thank
the
you.
hour. CBS This Morning continues in a moment.
Connie Chung. Good evening. Ryan White, the boy whose long fight against AIDS inspired the whole country, finally died of an AIDS-related illness early today at Riley Hospital for Children in Indianapolis. The doctors said it was painless.
He never regained consciousness, and I am confident that he suffered no pain at the end.
This is the picture of Ryan White that's become so familiar to us the past few years. He could have been anybody's kid, mine or yours.
He was the boy next door who first showed to a stunned nation that no one is safe from the risk of AIDS.
Ryan, a hemophiliac, got AIDS from a transfusion when he was in 7th grade. It was 1984 and nobody knew much about AIDS then. The local school expelled him for fear he'd give it to his schoolmates. He had to sue in court to get back in. Ryan White never gave AIDS to anybody, but he was a carrier of hope and of courage, and he infected the whole country with a new understanding of this terrible disease and compassion for those who suffer from it. It became his life's work.
A lot more people are not afraid of AIDS now, and they're not afraid of someone who has it. And I think they're more willing to accept people who have AIDS.
Last week, as he lay dying, the hospital was flooded with get well messages, though everybody knew Ryan probably wasn't going to get well. But he'd lived long enough to know he'd accomplished what he set out to do.
Ryan has helped us understand the truth about AIDS, and he's shown all of us the strength, the bravery of the human heart.
This one's for Ryan.
Last night at the Farm Aid concert in Indianapolis, Elton John sang a song for him, Candle in the Wind.
It seems to me you lived your life like a candle in the wind.
Ryan White was 18 years old when he died. He'd just reached manhood. Thanks to him, on the subject of AIDS, all of us are now a lot more grown up.
Your candle burned out long before your legend ever did. God bless you. Thank you.
Brian White.
Researchers are gathering in San Francisco today to discuss the latest advances in fighting the disease. Also gathering there are thousands of AIDS activists. John Blackstone reports.
Seldom do police strap on riot gear to prepare for a scientific conference, but the International Conference on AIDS that begins in San Francisco today is different. The preliminary event yesterday, a march on the offices of the Immigration Service. U.S. immigration law denies entry to people with AIDS. Some marchers broke through police lines, bringing the first confrontation of what could be a busy week in San Francisco.
The bottom line is we're not here to please anyone, to make friends. We're here to save our lives and the lives of the people with HIV.
Most of the excitement at the 6th International Conference on AIDS is likely to be on the streets. Inside of the scientific session, no major breakthroughs are expected. The conference, organizers say, is meant to bring together the many diverse groups fighting AIDS.
The hardest thing by far has been keeping all of the groups who need to work together talking with each other.
Among those attracted to the conference, Elizabeth Taylor, who announced a new $400,000 fund to help fight AIDS internationally.
This week, the eyes of the whole world are turned toward this beautiful city. People around the world, around the globe, are looking here with hope and desperation.
That AIDS has become as much a political issue as it is a medical issue will be clear both inside and outside this week's conference. John Blackstone, CBS News.
The science panel said today that there is new hope for developing an AIDS vaccine, but that it will take a lot more research and money. AIDS already touches many lives. Bob Fall looks tonight at some of the youngest.
You're a good girl. You're a good girl. Hold there, that fuzzy bear. Hold fuzzy bear tight.
At a big city hospital, a nurse tries to comfort a terrified child,
You can give him this needle.
letting her give a needle to her friend, Fozzie Bear.
Use your medicine to stay well, because we love you. Okay, you lay down.
This 2.5-year-old is one of 3,000 children in the U.S. who have tested positive for AIDS. Today, they can live longer and better lives than only a few years ago, but there is a price, both for the children and their families. Many must endure painful treatments, including this grueling 2-hour infusion of medicine every month.
Are we worried about what's going to happen when the population totally overwhelms the system? Yes.
And parents or foster parents who live with the fear of death also fear discovery. The stigma of AIDS is still so great, mothers here would not let us photograph the faces of their children or their own.
My daughter said, Mommy, if people find out, I won't have any friends.
The ordeal seems hardest on an AIDS baby struggling to live. It is almost as hard on a mother who fears she may have infected and may still be a danger to her child.
I worry every day. I mean, it's, every morning, every night.
It's too early to know whether this 9-month-old has AIDS, but her mother, who is carrying the virus, can't take any chances.
Now, I don't do, kiss her on her mouth a lot. I don't share food with her. Even though things like that, you cannot spread it, but I just take every precaution.
The mother's ambivalence, wanting to be close but knowing she must keep a distance, can be almost as crushing as the mother's guilt.
Now, she's a little bit on the low side.
It's an awful experience for the mothers, particularly when the child dies, that they feel incredibly guilty, that they feel incredible loss.
Does a woman ever get over the notion that she's contaminated her child?
I don't think so.
This Boston City Hospital pediatric AIDS clinic has had success. Most of the children here look and act like there's nothing wrong.
If you saw them walking down the street or playing in daycare or playing with their parents, you'd never know. They look like normal, healthy kids.
Bye-bye. Hello?
But the doctors who work with them find that AIDS babies do not develop as fast as other kids. They also find that parents often can't give the children proper care at home.
Difficult for them to take some of the responsibilities that we might take for granted.
Given their lifestyle. And for mothers too sick to care, the hospital also provides what it calls a respite center, but concedes that any respite for mothers is temporary.
a big piece of our work is to do planning with them and help them think through what did they want to happen for their child and who did they want to care for that child, so they can have their own inner peace, quite frankly, to die.
There is still no cure for AIDS, and the uncertainty exacts a terrible toll on those with the disease and those who love them.
To take care of HIV baby, it needs a lot of support, a lot of love, and understanding.
And more will be needed. In the next 10 years, say the experts, AIDS will infect 6 times as many children as it does today. Bob Fall, CBS News, Boston.
You are such a good girl. You did great.
Coming up next, a young baseball card collector who made the deal of his life. For a decade now, America has been struggling to come to grips with AIDS, how to deal with the fear of it, how to treat neighbors who have the disease. Tonight on Eye on America, reporter Bob McEwen takes us to a New York City apartment complex that is setting an example.
Before AIDS, my expression was through my music. Since AIDS, my expression is through my life. Music is a major part of it. A couple years ago, I thought that the music was over.
To be honest, that one day when the diagnosis and the prescription came out at the same time for AZT, that was the hardest day I could ever remember inside of me. It really felt like that's it. That's the door.
For me, it's like the big thing, the difference between living with AIDS and dying from it. And I'm definitely for living with it.
Living with a deadly disease isn't all that these men have in common. They are among the 3,500 people who call the Manhattan Plaza apartment complex home. Many of them in the performing arts, too many of them with AIDS.
I'm trying to keep a very clear focus on the possibility of living well, regardless of what's going on in my body.
How much of a part in that does Manhattan Plaza play?
100%.
It's believed more people have died from AIDS at Manhattan Plaza than on any other residential block in the country. But rather than tearing this community apart, what that harsh reality has done, in fact, is bring it closer together. Many of the people who live here have become care partners to the residents with AIDS, giving them the benefit of an old-fashioned kind of treatment. Neighbors helping their neighbors.
When they started the AIDS project here at Manhattan Plaza, well, I started out with chicken soup.
Roz Dunn is one of 60 volunteers in the building.
They said that some of the guys might like that, and that's the one thing. I don't cook well, but I make a good chicken soup, so that's what I did.
I have to be honest and say that it was a little scary at first, but now that I am really working with people, it's a disease like any other disease. I'm not going to catch it by baking somebody bread.
Lynn Chase is another care partner.
Well, I do. My big thing is healthy food, but also whatever he needs. It may be getting to the doctor, it may be picking up some medicine, it may be going and having a cup of tea, or even sharing the laughs, trying to find the laughs, trying to just, find the good parts of life that we can still find.
They're all extremely grateful, and they get the most wonderful care.
Archie Black delivers food donated by local restaurants.
I wasn't sure when I could pick these up today. I think I see them over there, huh? Jack? Lunch. I'll put it in the kitchen. Okay. God, I think we've had, since Christmas, I think we've had 6 or 7 deaths of people that I have delivered meals to. Okie doke then. Take care.
What do you get from it? What do you receive because you do it?
It's just the great satisfaction of making life maybe a little easier on their later days, being able to help someone who is sadly stricken.
When you see somebody who's lived a long time with a disease, who is in
terrible physical condition. I prayed for him to die.
Susan Chadwick's partner died last July. Now she's a care partner again to a man who's asked not to be identified on camera. How are you?
Good.
Good to see you.
There are still lots of people that think, you can't shake hands with somebody that's sick. I'm saddened and depressed by that.
And I think because it's the end of the day, my eyes are tired, so I'm having trouble focusing. And
People say this, it sounds like a cliche. It's true. I get a lot more back from it than I give to it.
The people with AIDS and those who work with them say the Manhattan Plaza Project should be an example to others that it is possible to build bridges in a disease that usually builds walls.
Get involved with your community. You have to. Death does not have to be lonely. And if there's someone terribly sick out there, and he's by himself or she's by herself,
Hi, it's me.
don't let him go alone.
Bob McEwen, CBS News, New York.
At an international conference on AIDS in Italy, the U.S. came under fire for its policy banning visits by foreigners infected with the virus. Also, hundreds protested, demanding more action from the medical establishment on AIDS. Alan Pizzi reports.
They marched to demand a solution to the most pressing issue of their lives, AIDS. Locked out of the conference that is devoted to the theme Science Against AIDS, anger and slogans were all they had.
I don't feel too positive about anything 11 years down the pipeline, and we have AZT, which is basically chemotherapy as far as I'm concerned.
2 new AIDS-fighting drugs are expected to be presented at this 6-day gathering, and while scientists warn that breakthroughs are not imminent, there is some optimism.
This 7th International Conference on AIDS may prove to be a turning point.
If it does, only the scientists who speak the language of AIDS may know it.
The mechanisms of cytopathicity, the acute HIV syndrome, the mechanisms and implications of latency.
For those who see the scourge of AIDS in more personal terms, the issues are simpler.
I've been discriminated against. I've been left on a surgery table, okay, and I was told that they would not do surgery on me because I was HIV positive. This is from a doctor's lips, okay?
The coming week will produce a lot of both kinds of words and hopefully something positive because, in the words of one delegate, no country is immune, no society has an innate resistance to AIDS. Alan Pizzi, CBS News, Florence.
What could be an unlimited source.
Good evening. The official word came moments ago. The dazzling career of one of the world's best-known athletes is over. He is only 32 years old. Basketball superstar Erwin Magic Johnson has the AIDS virus. My colleague Pat O'Brien of CBS Sports is standing by at the Forum, home of the Los Angeles Lakers. Pat?
Dan, thank you very much. Home of what they used to call the Magic Kingdom here at the Forum in Inglewood, California. Perhaps not since Lou Gehrig announced that he had an incurable disease has there ever been such a stunning announcement from a sports figure. Magic Johnson, who was rumored to have had a terrible bout of the flu, he missed the first 3 games of the regular season, confirmed today that he has tested positive for the HIV virus. Here is some of what he had to say.
First of all, let me say good after late afternoon. Because of the HIV virus that I have attained, I will have to retire from the Lakers today. I just want to make clear, first of all, that I do not have the AIDS disease, because I know a lot of you want to know that, but the HIV virus. My wife is fine. She's negative, so no problem with her. I plan on going on, living for a long time, bugging you guys like I've always have. So you'll see me around. I plan on being with the Lakers in the league. Hopefully David will have me for a while. And going on with my life. And I guess now I get to enjoy some of the other sides of living that because of the season and the long practices and so on. I just want to say that I'm going to miss playing, and I will now become a spokesman for the HIV virus because I want people and young people to realize that they can practice safe sex. And, you know, sometimes you're a little naive about it and you think it could never happen to you. And you only thought it could happen to, you know, other people and so on and on. And it has happened, but I'm going to deal with it and my life will go on. And
Irvin Johnson is arguably the greatest to pick up a basketball in 12 years, an All-Star 11 times, 3 times an MVP, 5 world championships in the 80s. He revolutionized the game with a flashy style that gave him the name Magic. He was the inventor of Showtime and is credited, along with Larry Bird, with saving the NBA in the early 80s when interest was waning. As a human being, one of the most generous people in the public eye, certainly one of the most popular worldwide. His fans ranged from 2 to 92, and like Muhammad Ali, Magic Johnson really did transcend sports. He was everybody's athlete, and this is a sad ending to his basketball career today. I spoke with Magic earlier, and he said, "I'll be fine." And people who are close to him say he's handling this like he would handle a tough basketball game. He's taking it one step at a time and telling people around him to be calm. Dan, I'm within earshot of some young people over here playing basketball in Inglewood, California, and I think Magic would like them to remember him as a basketball player with this anecdote. In Dallas at the All-Star game a few years back, it was tied, and at the buzzer, Magic threw an impossible 80-foot shot, and it just barely went in. It went out. He got on the floor and pounded his fist, and I went up to him after the game and said, "You didn't expect that to go in?" He said, "I expect them all to go in." Back to you, Dan.
Pat O'Brien at the Forum in Los Angeles. Thanks. NBA players and coaches expressed their shock and concern today about the Magic Johnson news, and we'll be having that for you a little later on in the broadcast. Basketball fans are among the many Americans who were stunned and saddened by the news about Magic Johnson, fans who sat in the stands and fans who play on the playground courts all over the country. Correspondent Harold Dow has been out gathering some of their reactions.
Magic Johnson doesn't know Charles, Harry, Jamal, or Vanessa, but they sure know him. They know his moves. They've seen his magic. At a New York City YMCA today, magic was all they talked about. It was as if they had just been told that a favorite relative was ill.
I was hurt. It seems like I grew up with Magic. I've been watching him so long, and I love basketball myself. I felt like I lost a personal friend in my family.
He meant so much to basketball, not only to the Lakers.
Not only to the Lakers, but to everyone. Everyone that's trying to make it in society.
I've been watching him since I was a kid, and I don't know what to say. I mean, I just came here and I just heard about it, and I'm still shocked about it right now.
As fans, their thoughts are with Magic, but they all realized that this is one contest that Magic will have to fight alone.
My heart goes out to him and his family, and I hope he managed to pull through it, you know.
If Magic Johnson could get it, now I know everybody could get it. For so many young people on basketball courts across America, Magic Johnson was Mr. Basketball. He was the link to their dreams, dreams of what could be. Today, those dreams have been shattered. Harold Dow, CBS News, New York.
Now about the National Basketball Association players and coaches. This hit like an earthquake all around the NBA today. The news that Magic Johnson was going to retire, and then the news behind that, that he had the HIV virus.
As you saw, the old Irvin, he is alive, but not very well right now. And, you know, we do not, want to eulogize him. We want to now give him, all the love and support and prayers, and all the other people that are afflicted by this insidious disease.
Magic is a super person, has done so much for the game of basketball and for people, and we're just devastated, and let's hope now that we even focus more on finding the cure.
Just look at every NBA player's hands, and they're just all full of nicks and scars and cuts that have, from fingernails, and all the times that you've, slammed into somebody's mouth with your elbow and you're bleeding, he's bleeding. There's just a lot of blood on the court, and if one person has AIDS, no matter, you know, how sad that his situation is, if he just gives it to one other person, I mean, just one other person, NBA dies from that. It's a tragedy.
Our special coverage of the shocking news about Magic Johnson, retirement, and the AIDS virus will continue in a moment. Coming up, a complete medical update on the AIDS epidemic.
Before investing in any luxury car, may we suggest you do slightly more than kick the tires.
In art, matters of taste are often subjective. But in life, good taste is well defined. Fancy Feast gourmet cat food in the gold single-serving can. Exceptionally moist, uniquely delicious. For a gourmet taste to satisfy even the most discriminating connoisseurs. Fancy Feast. Good taste is easy to recognize.
The news that basketball superstar Magic Johnson has the AIDS virus has again put the spotlight on a frightening and much misunderstood illness. What is AIDS? How do you get it? And what, if anything, can be done to treat it? Our CBS News health correspondent Edie Magnus is here with a report on that. Edie?
Dan, with all of the attention given to AIDS, there is still a surprisingly large number of people who do not know how you get this syndrome. There are 3 known ways: through sexual contact with an infected person, through intravenous drug use with a dirty needle, which is an infected needle, or through getting infected blood in a transfusion. AIDS is an acronym, as you may know, for Acquired Immune Deficiency Syndrome. Acquired because you get it from someone else. Immune deficiency because the AIDS virus breaks down a person's immune system, which is the natural defense system against disease. When the immune system is deficient, a person is vulnerable to getting any number of diseases, which can kill him because the body has no way to fight back. For 10 years now, the AIDS virus has defied some of the most brilliant scientific minds in the world. It is a devious virus because by destroying the immune system, it destroys the body's only way to fight it. And there's another way it is devious. It can infect someone and they may not know it right away.
There is a very long incubation period between infection and disease, during which people are infected, can transmit the virus to others, but feel well and look well.
In the last 10 years, nearly 130,000 people have died from the AIDS syndrome in the U.S., and the Federal Centers for Disease Control estimates that 1 million Americans are currently infected with AIDS, although many of them may not know it. The good news, if there is any good news, is that in 1991, people are living longer with this syndrome than they were just 5 years ago. 5 years ago, once a person developed any complications from AIDS, such as infections or cancers, he or she lived only about 11 months. Now, a person can live with AIDS complications for around 3.5 years.
Within 5 years, we will have combinations of drugs that will allow physicians to keep their patients, if treated early and continuously, to keep their patients alive for many years.
We should emphasize that Magic Johnson may live longer than 3.5 years because he hasn't developed the symptoms yet, so he says. By the end of the century, Dr. Curran believes we will have an AIDS vaccine. For now, there are 2 drugs approved for treating AIDS, AZT and DDI, and there are a number of others which treat the complications from AIDS. No one really talks about curing this syndrome. Scientists hope that one day, like measles or influenza, they may be able to turn it into a syndrome that people can survive. Dan?
Edie Magnus, thanks. The list of people who have died of AIDS is growing, and so, slowly, is public awareness. As Richard Threlkeld reports, the casualties come from all walks of life, including, as is in the case of Magic Johnson, some of America's best-known names.
Mr. Rock Hudson has acquired immune deficiency syndrome.
So far, 126,159 Americans have died of AIDS, including, among others, Rock Hudson and Liberace and Holston and Perry Ellis, designers, and Michael Bennett, the choreographer, and Keith Haring and Robert Mapplethorpe, artists, and Roy Cohn, the attorney, and Terry Dolan, the conservative activist, and Max Robinson, the anchorman, and Jerry Smith of the Washington Redskins, and Ryan White, the little boy who caught AIDS and lost a brave battle against it. When somebody we know or know of dies of AIDS, we are shocked. But for every famous victim, there are thousands who suffer and die of it quietly, often anonymously. A patchwork quilt of Americans known only to their loved ones or only to themselves. Richard Threlkeld, CBS News, New York.
There is more CBS News ahead, including President Bush traveling again in Europe and our special series on the money crunch here at home. Tonight, a warning about packaging that gives you less than you expect.
Here he comes from behind the back, a fake. Oh, the pass, here we go. Magic Johnson angry.
Basketball star Magic Johnson is calling it quits. A tragic ending to a magical career. Basketball star Magic Johnson is calling it quits.
The HIV virus that I have attained, I will have to retire from the Lakers today.
This is the CBS Evening News. Dan Rather reporting tonight from CBS News headquarters in New York. Good evening. The official word came moments ago. The dazzling career of one of the world's best-known athletes is over. He is only 32 years old. Basketball superstar Erwin Magic Johnson has the AIDS virus. My colleague Pat O'Brien of CBS Sports is standing by at the Forum, home of the Los Angeles Lakers. Pat?
Dan, thank you very much. Home of what they used to call the Magic Kingdom here at the Forum in Inglewood, California. Perhaps not since Lou Gehrig announced that he had an incurable disease has there ever been such a stunning announcement from a sports figure. Magic Johnson, who was rumored to have had a terrible bout of the flu, he missed the first 3 games of the regular season, confirmed today that he has tested positive for the HIV virus. Here is some of what he had to say.
First of all, let me say good after late afternoon. Because of the HIV virus that I have attained, I will have to retire from the Lakers today. I just want to make clear, first of all, that I do not have the AIDS disease, because I know a lot of you want to know that, but the HIV virus. My wife is fine. She's negative, so no problem with her. I plan on going on, living for a long time, bugging you guys like I've always have. So you'll see me around. I plan on being with the Lakers in the league. Hopefully David will have me for a while. And going on with my life. And I guess now I get to enjoy some of the other sides of living that because of the season and the long practices and so on. I just want to say that I'm going to miss playing, and I will now become a spokesman for the HIV virus because I want people and young people to realize that they can practice safe sex. And, you know, sometimes you're a little naive about it and you think it could never happen to you. And you only thought it could happen to, you know, other people and so on and on. And it has happened, but I'm going to deal with it, and my life will go on. And
Ervin Johnson is arguably the greatest to pick up a basketball in 12 years, an All-Star 11 times, 3 times an MVP, 5 world championships in the 80s. He revolutionized the game with a flashy style that gave him the name Magic. He was the inventor of Showtime and is credited, along with Larry Bird, with saving the NBA in the early 80s when interest was waning. As a human being, one of the most generous people in the public eye, certainly one of the most popular worldwide, His fans range from 2 to 92, and like Muhammad Ali, Magic Johnson really did transcend sports. He was everybody's athlete, and this is a sad ending to his basketball career today. I spoke with Magic earlier, and he said, "I'll be fine." And people who are close to him say he's handling this like he would handle a tough basketball game. He's taking it one step at a time and telling people around him to be calm. Dan, I'm within earshot of some young people over here playing basketball in Inglewood, California, and I think Magic would like them to remember him as a basketball player with this anecdote. In Dallas at the All-Star game a few years back, it was tied, and at the buzzer, Magic threw an impossible 80-foot shot, and it just barely went in. It went out. He got on the floor and pounded his fist, and I went up to him after the game and said, "You didn't expect that to go in." He said, "I expect them all to go in." Back to you, Dan.
Pat O'Brien at the Forum in Los Angeles.
He had AIDS, and they verified that later at 12 o'clock it was positive he had AIDS.
Well, let me get your reaction to it, though.
Well, like I was talking with this guy here, I said, "Boy, it's terrible, terrible." I mean, it just shows you all the money people got to can't save their life. It's terrible. Yeah. Big trouble.
What is your name?
Victor Leduc.
Thank you, Victor. Irma. Name is Irma. What's the last name? Johnson. Irma Johnson. What's your reaction to some startling developments today?
Yeah, this is startling. I was devastated, basically. Because I follow Magic and the Lakers in basketball, and the team's not going to be great without him.
Do you feel like it's a personal loss?
Yeah, it is. You know, I've been watching him for years, so it's going to be a loss to me.
What fears do you have, if any, now, having heard what you did today?
Got to be more careful, you know. Like he was saying, you got to learn to practice safe sex and, try to do the right things and, because you just never know. It could be you.
Thank you. No smiles now. We have a serious subject. No, actually, really, what was your reaction to what you heard?
It's sad for whatever happened to him anyway, because that's something that could happen to anybody anyway. Even if you are on sport or something like that, it could happen to anybody.
You feel, with Magic having to retire from basketball, that you feel a personal loss there?
No, well, for the Lakers it's going to be anyway, because he can do everything over there with them, but for other people he might be helping now with the other people now that had the same problem that he has now.
What is your name?
Francisco.
Last name?
Acevedo.
Thank you, Francisco.
Thank you.
Appreciate it.
Clarence Chappell.
Clarence, how do you spell your last name?
Chappell.
Clarence, get an immediate reaction from you.
Well, I was working in this area and I caught it on the radio and I was shocked because, I'm from the Lansing, Michigan myself. Moved out here about a year and a half ago and went through middle school with Irvin, long before he was Magic and all that. And so I took a little personal, being from, homeboy, if you will, and was shocked.
Come on, time out. Let's go over here. Kurt, can we just get a quick reaction from you?
Support him.
I haven't talked to anybody. I'm sorry?
Give somebody.
Got nothing to say. Kurt, can you just give us a quick comment one way or the other? Just something to go with. Okay, you were telling us the story of having gone to the same school as
same middle school. I was born and raised in Lansing, Michigan, also, and like I said, I moved out here about a year and a half ago. And so, when I heard the news about an hour and a half ago on the radio, I was sitting in my car in between stops on my job, and I was shocked. It shocked me.
Sense of realization set in?
Yeah. I think he handled himself in class. I was, glad to see that. I think he really handled it like a man, be upfront about it, and still, it's a shock.
You went to school at the same time with Magic?
In middle school. I was a year ahead of him. He was a year behind me.
You said that you were shocked by this. Is there a sense of losing him as a basketball player, obviously, but is that a personal loss to you?
Yeah. I mean, I'm more concerned about him as a person. I'm glad it seemingly is not as serious, evidently, as it could be, but still, it's a tragedy. Obviously, I admired him as a player. I mean, I watched him come up through his high school years. When he first was named Magic by Mr. Stabley back there at the local paper back there, and I mean, it's like, who would have thunk, like, hey, I grew up with probably the greatest basketball player to ever play, and then, to see his career to come to an end like this, it's a shocker.
That's the best comment. Thank you.
Another sports legend announces that he has AIDS. Shocking news about radioactive pollution. Tens of thousands of contaminated sites in almost every state in the country. Also, Eye on America. Tonight, how you can cash in on the tax code just like the rich and famous. This is the CBS Evening News. Good evening. Dan Rather reporting. The news today came as a shock. Tennis Hall of Famer Arthur Ashe revealed that he has AIDS. It was something Arthur Ashe wanted to keep private, but he says he was finally forced to go public. CBS News health correspondent Edie Magnus reports on Arthur Ashe and AIDS.
Arthur Ashe was the first black man to win one of tennis's Grand Slam tournaments, defeating Jimmy Connors at Wimbledon in 1975. He ranked among America's top 10 tennis players for 15 years until he suffered a heart attack in 1979, which forced him suddenly to retire. Why me? Ashe asked then. He could be asking that question now.
I have known since the time of my brain operation in September 1988 that I have AIDS.
Tests showed Ashe had a brain infection, and more tests confirmed the cause was AIDS, acquired, he says, from a blood transfusion during one of 2 bypass operations on his heart.
I am not sick, and I can function very well in all that I have been involved in for the past several years. As for my family, my wife and daughter are in excellent health, and both are HIV negative.
Ashe did not want to go public today, but said that rumors about his health had been leaking out, that someone had, in his words, ratted on him to reporters who started asking questions.
I didn't commit any crime. I'm not running for public office. I should be able to reserve the right to keep things like that private.
But now it's out, and friends and admirers are profoundly sad.
He's a very bright guy. He has got a big heart.
Lisa Jones, now 28, was among the first recipients of an Arthur Ashe tennis scholarship at age 13.
Continues to be a great role model, and I feel like a blow has been hit to the black tennis community, knowing that someone like that we hold high on a pedestal has been hit by something like this.
To date, the Centers for Disease Control has traced more than 4,700 cases of AIDS to contaminated blood. Almost all of the cases, like Arthur Ashe, occurred before 1985, when the U.S. started to screen all donated blood for the AIDS virus.
There's no question about the fact that the blood supply in the United States now is infinitely more safe than it was in 1983.
Ashe says he's not going to sue the hospital where he had heart surgery. He's looking forward as best he can.
I'm feeling very optimistic about being able to get on with my life in as normal a way as possible.
And Arthur Ashe says he plans to get actively involved in the AIDS movement, likely teaming up with Magic Johnson to try to reach this country's children. Dan?
So why did Arthur Ashe wait so long to go public?
He said today it was for one very simple reason. He wanted it to be private. He was worried that he would be treated differently, that his wife and daughter would be treated differently. They said today they're going to have to teach her now to deal with cruelty, that people project onto AIDS all kinds of fears. And Arthur Ashe did not want his family to be subjected to that, but events conspired against him.
Edie Magnus, thanks. A new U.S. government survey says there are more than 45,000 locations across this country that may be...
Saying no to drugs is the biggest decision you can make in your lives.
And I want you to know it can happen to you.
Free condoms.
Mainstream America can preach all it wants, but on the streets, telling inner city kids to just say no is proving to be more rhetorical than effective.
I knew that I was at risk of contracting the HIV virus, but I really didn't care at the time.
William is like many young urban blacks, according to a new study done by a black-owned market research firm. They've heard the warnings, but practicing what's preached is a whole different ballgame.
They tell us sex is great and it's great, but wait, wait till you get older. But it's the best feeling in the world. And you're gonna tell us to wait? You sound crazy.
We really need to educate our society. You have no idea the ignorance that exists out there.
The study found that even black role models like Arsenio Hall, Magic Johnson, and Jesse Jackson are too much in the mainstream culture to have much success in reaching alienated teens.
I think kids are smart enough to say, these guys aren't from my environment, they don't know what I'm going through, and they can't relate to my experience.
So then how do you reach kids here in the inner city, impact their values and their behavior? One answer may lie in targeting their peer groups. What most influences kids, this study found, is other kids.
AIDS, who got AIDS? Anyone who got AIDS?
Rap music with a safe sex message might be one way to communicate effectively. Another way is to use young people like William, who is HIV positive. His message hits home in ways Just Say No never could.
The reality of this disease is that I might someday get sick and die.
In these communities where homicide is the #1 killer of black youth, finding ways to better communicate is a #1 priority. Catchy slogans alone just don't seem to work. Giselle Fernandez, CBS News, New York.
Bush, Mr. Quayle, Senator Helms, President Bush, Mr. Quayle, Senator Helms, your policy is wrong, dead wrong, and you know it.
This conference may be remembered more for its politics than for its scientific news.
The blood of people with AIDS!
From theatrical demonstrations to a letter from Governor Bill Clinton promising more help for AIDS patients, delegates here expressed anger that the AIDS virus continues to outwit all of us.
I was hoping that there was going to be at least a hint of a cure.
I don't think more answers come out of a conference like this. I think there's too much politics interjected into it.
As this year's conference closes, most are frustrated by the fact that we've learned more about what we don't know than what we do. Vaccine and drug research, while offering glimmers of hope, fell short of saving lives. A detailed report by the Treatment Action Group, or TAG, blames government and the National Institutes of Health for poorly coordinated research efforts and wasted funds.
One space shuttle mission, of course, cost more than the AIDS budget for the entire year.
I want you to remember the names of those that you've lost.
The conference did succeed in drawing together people of vastly disparate cultures, making clear that while we share the burden of the disease, we must also share the fight for answers. Dr. Bob Arnott, CBS News, Amsterdam.
Switzerland is sounding the alarm. The epidemic is spreading farther and faster than anyone imagined when it began. Today's troubling news, the huge AIDS gender gap is slamming shut. In the past 6 months alone, 500,000 women infected worldwide, most in developing countries. And their children?
1 out of every 3 children born to an HIV-infected woman gets AIDS from their mother, gets the virus. The other 2 become orphans.
The numbers are so large they're numbing. Worldwide, 12 million have the virus, 2 million with full-blown AIDS. In the U.S., 1 million are believed infected, nearly 250,000 sick with AIDS. And by year's end, as many as 57,000 will have died. The movement's most celebrated fundraiser made an appearance at the conference today to call attention to the crisis.
If you do your bit with all of your heart, and I do my bit with all of my heart, and everybody out there does the same thing, we will make a goddamn difference.
But what's clear at session after scientific session is that making a difference is a painfully slow process. There are still only 3 drugs that attack the virus, and doctors still are not sure how to use them, when to start, how much to give, in what combinations, and to whom.
You're literally making it up as you're going along.
San Francisco doctor Marcus Conan has treated some 5,000 AIDS patients since the epidemic began.
Trouble is that we can't wait until we know all about the drug before we can use it. We have a group of desperately ill patients. The moment that a drug shows benefit, we're compelled to use it.
For patients, that means treatment is often a crapshoot.
I feel like a guinea pig and a pioneer, but I'm just happy that they've made as much progress as they have.
There you go. Good.
But the painful progress of AIDS research also means trying drug after drug that just doesn't work. There were several examples of that here today.
If we find out that we've reached a dead end, then I think it's good because hopefully then we can move on.
Researchers here say they're not worried yet about published reports of a possible new and unidentified strain of the AIDS virus in the U.S. They say the incidence is too small and requires further study. Experts are intrigued by two promising drugs being discussed this week called TAT and protease. They seem to offer another way to attack the virus in the body before it spreads. Maybe they'll work and can be added to the mix. And then again, maybe they won't. Edie Magnus, CBS News, Amsterdam.
16 minutes until the hour, Dr. Bob Arnott is wrapping up a week in Amsterdam at the International AIDS Conference. And this morning, he reports on what people are doing to live longer with the disease.
After hundreds of talks, little new has emerged from this conference. But some doctors are finding great success saving lives by creatively applying what we already know.
Because of the HIV virus that I have attained, I will have to retire from the Lakers.
I was told I had AIDS, not HIV positive. You have AIDS.
Magic Johnson, Arthur Ashe, paint a new face on the AIDS epidemic. They may live longer than anyone hoped, longer than most patients who don't have their economic status, and access to the best health care. Lou Kadoff knows that full-blown AIDS is no longer an immediate sentence of death. He's had full-blown AIDS since 1986. 6 full years with AIDS, and you look terrific. Why?
Why? Well, I've gotten very good health care. I've been very aggressive. I'm a very educated consumer. I'm very lucky.
Access and aggressiveness make the life-saving difference for Lou. He and his doctors in New York City have gotten their hands on just about every new drug that's come down the pike, both approved and experimental.
This is one of the most important things, that if I look back on the patients who've done well, they've all of them been aggressive on their own behalf.
Doctors like Joseph Sonneman have been winning an underground battle against AIDS. Rather than waiting for new drugs to fight the AIDS virus directly, they're fighting a defensive war against AIDS by preventing the infections that kill most patients. Lou prevents MAC, a tuberculosis-like illness that hits 1 in 5 AIDS patients. He's taking rifabutin, a not-yet-approved medication. How important do you think it has been to your survival to take drugs to prevent infections before they infect you?
I think it's essential. I'm very convinced that if I hadn't, I really probably would not have survived the 6 years.
We are seeing more and more people with AIDS who are living very active, relatively normal lives. They're working, they're enjoying their life, even though they've been diagnosed 6, even 8, 10 years ago.
Patients like Lou don't just survive, they thrive. He works hard every day researching long-term AIDS survival. He travels. He's positive.
I would say at least 50% of success is attitude.
I really enjoy my life. I have a wonderful partner. I have a job that I really care about and that's challenging. I have a number of other sort of research and kind of projects that I'm involved in that I care a lot about. I have good friends.
The next great challenge? Take the treatment strategy that's saving AIDS patients with money and stature and extend it to the majority of AIDS patients so that they too can share a liberal dose of Lou's brand of optimism.
I still go as if I'm going to be around a long time. I know that probably won't happen. And I know that I'll disappoint a lot of people if I get very sick a year from now or 2 years from now. But I'm going to act as if I'm going to live a long time.
A report at this conference shows that the cost of caring for AIDS patients is skyrocketing, making it even less likely that the underprivileged will receive state-of-the-art care. Paula?
Thank you, Bob. 12 minutes before the hour. Coming up next, Ann Archer tackles a different kind of role.
At the important International AIDS Conference in Berlin today, the U.S. Surgeon General said AIDS is now one of the top 3 killers of Americans between the ages of 15 and 44. But as health correspondent Dr. Bob Arnott reports, if you have AIDS and you live in a small town, just finding a doctor for treatment can be agony.
I don't travel well. The sicker I get, the closer I want to be to someone that can care for me.
Linda Gibson is very sick with AIDS. She's often forced to make the difficult trip from her country home to the big city because no doctors where she lives are trained to treat AIDS patients.
It should say,
Dr. Robert Smith is among only a handful of AIDS specialists in the entire state of Maine, where AIDS cases have doubled in the past year alone. AIDS is overwhelming small-town America. Since 1991, there's been an alarming 53% increase in AIDS cases in non-metropolitan areas. Experts say patient care is being compromised.
Many rural doctors haven't had experience with taking care of HIV and a disease in someone. Until they do, there's a feeling that they may not be able to provide state-of-the-art care.
But help may be on the way. Here at the AIDS conference, the American Medical Association has announced new guidelines to help doctors everywhere who have no experience with AIDS patients. It's a comprehensive manual on the basics of AIDS diagnosis, early treatment, and counseling.
The magnitude of the HIV epidemic requires that primary care physicians be involved. These are family doctors, general internists, people without specific training in HIV care.
These new guidelines will soon be available to every U.S. physician, but critics say they're not enough because effective AIDS treatment requires hands-on experience. Still, the consensus is there's no other way to care for the increasing number of AIDS patients without the general practitioner. Dr. Bob Arnott, CBS News, at the International AIDS Conference in Berlin.
My name is Easy, yeah, this is true. Keeping your attention is what I'm gonna do.
Eric Wright, also known as Eazy-E, pioneered gangsta rap, a gritty street revolution in the music industry. But tonight, the 31-year-old rap artist is hospitalized in Los Angeles in critical condition. He was admitted 3 weeks ago complaining of breathing problems, apparently unaware he had been infected with the AIDS virus. Wright issued a statement through his attorney.
I would like to turn my own problem into something good that will reach out to all my homeboys.
Wright lived the hard life he promoted through his music. He's a self-admitted drug dealer with a criminal record. He's been in and out of jail more than 40 times. Wright is married with a young child, but admits to fathering 7 children by 6 other women. The star's publicist says all these women have tested HIV negative.
You're talking about things that are very, very dangerous to play around with, whether they're how you're living your life or just how you're presenting yourself to the public.
Easy access, babe.
Male rap stars known for their promiscuous images in their music have historically promoted unsafe sex.
Let's talk about sex.
But female rappers have largely pushed the AIDS awareness message. AIDS is the #1 killer among young African-American men and women. AIDS workers are praying young people will now sit up and take notice.
We hope that people won't just ask, how did he get it? And that they'll ask questions of themselves about what is it that I'm doing.
Are you going to change your behavior now because of this?
Definitely. Most definitely.
This Western edition, the nation's capital this weekend is a center of protest and of somber remembrance. The protest was by tens of thousands of Hispanic Americans, the remembrance for hundreds of thousands who have died from AIDS. We begin with Cheryl Atkinson and the anguish of the AIDS quilt.
This may be the last time the quilt is displayed in its entirety. A mile long and the size of 24 football fields, it is just getting too big. And like AIDS, it is growing fast.
This is like walking through a graveyard.
James Papa came to find the panels of 38 friends, including his best friend.
I've lost everybody. I mean, there's not that many friends left. I mean, I can't find anybody to go to movies with on Saturday night. They're all dead.
George Martin, Roger Wall.
There are 70,000 names sewn into the fabric of the quilt. Volunteers are reading each and every one.
Christopher John Reed.
The enormity of the quilt and the disease is not lost on the young.
Once you see that there are people just like you, you kind of realize that there's nothing stopping it from being you.
Cleve Jones founded the Quilt Project in San Francisco after his best friend died of AIDS in 1985.
I think we're going to beat this disease. We want the president and the Congress to step up to bat now.
Part of his mission was accomplished when President Clinton became the first president to personally view the quilt. Today, demonstrators joined hands around the Capitol to demand a larger commitment from Congress to fight AIDS. While inside, members of Congress listened to AIDS activists, including actress Elizabeth Taylor.
And I love you, and God bless you.
As the day drew to a close, marchers carried candles down to the Lincoln Memorial to show support for those living with AIDS and to show that those who have died have not been forgotten.
A huge, steady stream of marchers has been pouring into the area around the reflecting pool in front of the Lincoln Memorial for more than 45 minutes and is still coming strong. Organizers hope to have 100,000 people here. As large as the quilt is, it represents only a fraction, about 11% of the total number of U.S. AIDS deaths, more than 343,000. Worldwide, the toll is estimated at 5.8 million. Anthony?